We even tried the oral formulation of semaglutide because we thought once a week is accumulating in the body, so maybe once a day would be better for her. But she was not the right candidate. So maybe in that case, bariatric surgery, which still has 20 to 25%. But I have another psychiatric patient, depressant patient. He gained lots of weight due to antidepressants, and he's doing very good. So not necessarily every shoe fits everyone, right? In science, it doesn't work that way. So not everyone who wants to didn't get benefited, and we had to find other options and help them. Yeah, thank you.
I think that's a great point, because there is no, 100% of one thing for anyone, no matter what it is. Are there any questions from the audience about any of these things that we've been discussing about the GLP-1s? Yes. Can you go to the microphone just so everybody could hear you? Thank you.
Okay, so anyone can answer this that you wish. I just wondered if at this stage in your practices that are you able to prescribe certain kinds of foods, certain kinds of like supplements and that type of thing?
In addition to the
Yes.
medication? Oh, okay.
To build kind of a strength around the situation.
So for me, when you walk in my office, whether it's the medical side or the med spa side, everybody is offered the diet I had put together. So it's broken down into food groups. Everything on it is a low glycemic index, so less than 54. And everything on there is going to help to decrease inflammation in the body. So it's I'm not only following how much sugar is in there, what type of food is going to actually trigger your hunger center, but also decreasing the inflammation in your body is going to help your body to work more efficiently, and you're going to be able to get to the weight that is healthy for you and give you more energy. So in addition to just going off of that, in addition to the diet that I offer, we also have an infrared sauna, which has been shown in research to mimic exercising. So your heart is beating faster, you're sweating, you're detoxing, and it does something to the brain to actually want you to start working out, especially for someone who was generally working out on a regular basis and kind of fell off the wagon. And I know it's happened to me, in certain times in my life. I love working out, but there's when I had to have my rotator cuff surgery done, or I had back surgery done years ago, it's really hard to get back into it. And the first couple of times you start working out, every single bone in your body hurts. And so for people like that coming to the office and going in the infrared sauna, which helps them to lose even more weight, you can actually lose up to 600 calories in 60 minutes in these infrared saunas because of how it gets down to the cellular level, those far rays. So in addition to the diet, I also include the infrared sauna. And then we have IV treatments as well. We have B12, we have something called the skinny shot that's a combination of different vitamin Bs that work synergistically together to allow your fat cells to be used as energy. So you see results quicker because we're getting rid of that fat pad over your abdominal area. So that's what we do in my practice.
And in my practice, since the GLP-1 slowed down the absorption in the gut movement, we have this new multivitamins because especially in GLP-1 with decreased absorption, they can be deficient in B12s and some other multivitamins. So the nanotechnology particle-based multivitamin, instead of taking the bulky, chalky vitamins, which are difficult to swallow, which can cause nausea, we have this nanotechnology-based. It's very simple, just a small capful of liquid provides all your vitamins, supplements in one capful. Just swish and swallow. All the absorption happens at your mouth surface. No need to drink lots of water with it. So it enhances your absorption. It avoids any drug interaction in the stomach. I always recommend my patients to get both vitamins and supplements. And hydration is also very important. Hydration means not just water with electrolytes. So we always want the most common side effect, and the adverse event happen because of nausea and diarrhea. So when that happens, it's very important they hydrate with electrolytes. So we also add a complement of electrolytes and supplement in a liquid form. Thank you for the question. Thanks.
Anyone else?
I think, she had a quick one.
Did you have a quick question?
Yeah.
It wasn't a quick question, it's just pediatrics, and just what is the conversation now for the ages going down to teens and preteens?
It
as
is
far as
approved for 12 and
medication?
above. I
And
have
is
done for teens.
Approved but recommended? I mean, are you guys using them and with good results?
Yes,
And
if any young adult, I have a teenager who takes it, she's 17-year-old, and she has PCOS and metabolic syndrome, and she needs it. So it has, yeah, she's doing great.
Thank you so much for joining us.
Thank you
this
so
morning.
much,
Thank
audience,
you.
for the engagement.
Excellent. Thank you for that fascinating discussion. Now we move from pharmaceutical innovation to an entirely new medical frontier, integrating quantum science, Western medicine, and traditional healing. What if modern medicine, ancient healing, and quantum science weren't separate disciplines, but interconnected pieces of the same puzzle? This transformative approach could redefine healthcare as we know it, bridging cutting-edge research, energy-based healing, and time-tested traditional therapies. In this keynote on integrating quantum science, Western medicine, and traditional therapies for a new medical paradigm, Dr. Nikos, Director of Humanpathy Limited, will share how these worlds are converging to create a new paradigm in patient care, from quantum physics influencing biology to the integration of holistic and evidence-based medicine. He will challenge everything we think we know about healing. Let's welcome Dr. Nikos to the stage.
Thank you very much for participating in this conference and giving me the opportunity to present you what we are doing. I'm going to speak about transforming healing with the new awareness, an awareness that want to create medical doctors that are guides, and we want to increase the therapeutic awareness of the patient. So, first of all, I want to present myself. I'm Dr. Nikos Hadjibalassis. I am a naturopathic doctor from Greece. I live and work in London, and I have been trained I have a BA in naturopathy. I have been trained in homeopathy for many years. I have a postgraduate degree in homeopathy, and I also had a great research on the human biofield, and based on that I have a PhD and a big experience for thousands of hours of assessments with my clients. So all this led me to where I am now. But I want to tell you how everything started, my journey. I was a young teenager, 23, when my father was diagnosed with cancer. On the first day of the conference, I had people that have been through cancer and how their relatives suffered. This brought me a great change in my life. There was a day that my father told me, I don't feel well, please take me to the hospital. We went to the hospital. The doctor diagnosed acute cholecystitis, but unfortunately, when they tried to operate him, they realized that it was intestinal cancer with metastasis in the liver that wasn't operational. That created a big disappointment to me. My whole world collapsed. So going this journey with my father, we started the best we can provide. So we went to the Hammersmith Hospital of London. I struggled with all the doctors there. I couldn't accept my father was going to pass away. And the question always was, why my father? What's hiding beneath? I never took a proper answer on that. So this became my goal, to find what's hiding behind the disease. Because my father was a healthy man, working hard. He didn't do anything that smoking, drinking, and he didn't have any history. We didn't have any history of cancer in our family. So it was all strange. So all this made me wanted to find what's hiding beneath the disease. And now it's pretty obvious nowadays, and people are more aware, that it's not enough to treat the symptom. The symptom usually is a result. I had this beautiful panel about Ozempic. And it's amazing how science strives to find technical solutions to many things. But the most important thing is to be able to guide and find what's hiding beneath obesity. What's hiding beneath obesity can be an emotional pattern, can be something, we can even say genetic, but even in genetics, you can see that the family has a certain characteristic, certain pattern. And we can see that there are groups of people with certain characteristics. So for me, when it's an urgency, when it's a scientific and medical urgency, we can use medical drugs. But first, we have to find the root cause. We have to find how to guide the patient to make a change with nutrition or maybe with his mindset and his personality. So this is now a demand, and people know that and are asking to have more information about that. So this need led many doctors to speak about holistic medicine. But in fact, if you ask somebody that does functional medicine or provides supplements, what is holistic medicine, they do not know what to answer. Because holistic medicine is, the most usually answer is that it's something that treats body, mind, and soul. But when you go to the question of what is soul or spiritual awareness, this goes beyond science, and sometimes it cannot be defined. So there is a need to put some science in everything and redefine the body, mind, soul theory. So I want to drive you back to the ancient times and ancient treating systems. And because I'm Greek, and also you know Hippocrates, in Greece, in ancient Greece, Hippocrates spoke about the 4 humoral elements. He spoke about the fluids in the body. And Plato, with Aristotle, spoke about the ether, the etheric energy that flows around your body and is your vital force. So even from ancient years, we were speaking about an energy field about the body. Also, in Chinese philosophy and Indian philosophy, in Ayurveda and Chinese medicine, therapists were speaking about energy. We were speaking about the yin and the yang fields. We were speaking about the 5 elements of creation, and also about the qi energy, the jing energy that runs through the meridians. So from very ancient years, we had the knowledge that there is an energy field around the body which plays a vital role. Nowadays, acupuncture is accepted, and many doctors are advising people to do acupuncture, although we cannot measure the qi energy. And going beyond that, because I practice homeopathy as a principle came from, again, the ancient years and from Hippocrates, when he said that similar cures similar. In ancient Greek, it was omnia, omis, isi, amata. In the later years, around the 80s, Dr. Samuel Hahnemann introduced the theory of potencialized remedies. So he discovered that the similar remedy that can treat a symptom, when you dilute it and then you vitally force it with succussions, then you increase the energy of that remedy, and as a result, it has even better therapeutic results without having the initial drug or remedy inside. So he provided information that the energy of a substance can provide equal therapeutic results as the remedy itself. So again, in homeopathy, you are speaking about certain energies and energy fields that can be therapeutic. When somebody has a distortion in his mindset, in his energy, in the way he is living, this is much similar with some archetype or certain things in the nature. So when we use the energy of this archetype, we can rebalance the energy of the patient. And that's what the message of homeopathy. And again, we are speaking about an energy field. So if we go now to what's happening now, we have professors and doctors doing research about the photonic energy of the body. So we are very proud and glad to have him as a friend, and being one of the professors that collaborating with our academy, Dr. Konstantin Korotkov, who has created a device, and there are many other devices doing similar things, but this is, for me, the most advanced and scientific proven, that can measure the photonic energy around your body. So we can now redefine holistic medicine with body, mind, and the human biofield. I can speak for hours about the human biofield, because the human biofield is an energy field that it's vital, but also it seems that it has some kind of awareness. A lot of professors claim that all the thinking and all the emotions are not happening inside our brains, but they are transmitting to our biofield, to our energy field. Some people can call it soul. I don't know if it's the soul, but I know it exists. And the thing is that the disease first manifests in this biofield through your imbalances, through your, the trauma you faced in your life, through the distortion you get from electromagnetic frequencies, and all the negative energy you live around in societies. So we have to find the disease first in the biofield, and the new medicine has to take care how to treat the unseen. So the need to move beyond the traditional and complementary approaches is also very important, because traditional and Western medicine is very scientific and can be released with the symptoms when they occur in the body. Prevention is not when we have bad biochemical indicators. Prevention is to go to one step beyond, and then do not have problem to manifest in your body. So again, complementary medical approaches are doing the same mistakes. You can see herbalists, you can see therapists with homeopathy fighting the symptom. So we can see that even complementary systems are trying to follow the symptoms and not trying to find the root cause. So integrating traditional Western medicine, complementary medical approaches, and technologies that can give us information what's hiding beneath the disease is very essential. So that is how humanopathy as a practice is born. Humanopathy is a combination of technologies and training around the Western medicine and the complementary medicine. Humanopathy as a word comes from two different words, human and pathos. Pathos is a Greek word about passion. We have passion for humanity. We love what we are doing. We are a team of professors, doctors, and people working on Humanopathy Academy, and we want to provide service to humanity. So there is a growing demand for humanopathic medicine because people are more aware that the way they are thinking and the way they interact with their body plays a significant role for their therapeutic journey. We have doctors like George Dispenza and a lot of other biologists speaking how you can manifest your health. But that's not enough, because to manifest your health, it's not how you project your thoughts. It's also about who you are behind. There is a mechanism working inside your mind, and this mechanism is preventing you from manifesting what you do. So telling you that you can manifest your health is half true. You have to be guided how to manifest your health. So we need Western medicine when somebody is acute or somebody has to be more intense, but we need to have also guidance to this therapeutic journey. So to become a humanopathic practitioner, you have to be scientific and you have to follow some kind of training. Usually, especially therapists and some doctors want to find the easy way. It's just following up a seminar or taking a certain small course, how you can use supplements, that you can provide a real good service in humanity. So proper training is part of what we are doing. And why it is so important nowadays to have this humanopathic approach in medicine. We can see that the technology is running so fast that we cannot even imagine what will be happening in 5 years. I saw a panel yesterday speaking about AI. AI can be a disaster or it can be a blessing. The thing is that until now, a lot of technologies are used by people that usually create disasters. But if we want to make it a blessing, we have to point out the right things that we have to be careful. And the first important thing in treatment and therapy is the personal connection. When I see my client in my office, even without speaking, by watching his face, I can understand a lot of information. I can understand a lot of things about his personality and the background. This cannot become artificial. So the connection from the heart and through your energy field cannot be exchanged with an AI system. But on the other hand, an AI system can be very helpful, providing information in seconds. A lot of doctors will find a challenge in the next years because I believe governments will take their position with AI systems. So a lot of GPs in the UK where I'm living, I think they are going to be exchanged with AI systems, and we are going to have the first level of treatment from an AI system. So being able to be more aware and try to focus on the personal communication with your patient might be vital in the future. So Humanopathy Academy is an organization that offers online courses. Online courses that are made for different professors, and you can do it in your own pace. You can follow up our training course, go on the live online courses, do your assessments, your recaps, and finally become a member of our society, which mainly we want to provide humanopathic service. I will now present you some of our courses and the reason that they are in this postgraduate program we have. We have this postgraduate diploma in humanopathy for medical doctors, and also we provide a certification of achievement to practitioners and therapists. And the first course that they have to follow up is a course on homeopathy. They are not going to become homeopathists, our students, because becoming a homeopath needs 5 or 6 years of training, but you are going to have the principles. And the principles we are going to provide you from homeopathy is to understand the remedy that is more equal with your client, and through the remedy you can understand his personality. Understanding the personality of the patient is vital because you know how his body is working. Dr. Sasi Mohan Sharma, that is presenting the course, is the principal of the Hahnemann College of London, and they are going to accreditate also this course for us. Then we have psychology. We are going to train our doctors in basic psychology principles and neurolinguistic programming. So for me, it's not proper for a doctor not to know how to address his client, his patient. Usually, the doctor is an authority, and the way he presents information to his client is programming his mind. So giving predictions of living for 6 months or 1 year, or that this disease has a certain way that it will develop, is completely wrong. So doctors must be educated how to approach the client depending to his personality. And that's what we provide with a course in psychology. We also are going to provide a course in Chinese medicine, because the knowledge in Chinese medicine and the interaction of the organs and the energy is very important, because when the symptom is manifested, sometimes it's just a reflection of another system or another organ. And you can see that this organ is overcharged when you know the personality of your patient. So Chinese medicine is also one of the courses, and is provided by this young man who is very passionate about Chinese medicine. We're going to have a course in lifestyle medicine provided by Dr. Bianca. She graduated from Harvard, and she is an amazing woman trying to serve humanity also. You know, you can understand that our lifestyle medicine is a basic knowledge for everybody, so he can guide his patients how to change their lifestyle and improve even obesity, diabetes, because as you said, exercise and even technologies and nutrition is very vital. And of course, nutrition is part of our educational system. Nutrition will going to be provided by a very important person, which will going to be announced in the next month. And then we have herbalism. We want to provide the doctors knowledge about herbs, how they can be prescribed. We also want to provide them with a biochemical type of the herb so that they know the interaction with Western pharmaceuticals and medicine. We want also to provide knowledge about Ayurvedic herbs, and this will be another course we're going to have in the academy. And then we have integrative medicine. Integrative medicine will be provided as a course by Dr. Konstantin Korotkov. Dr. Korotkov is the creator of BioWell. He's a well-recognized person globally. A lot of the pictures that I show you is from his device, and he has huge experience, and he's going to share his experience with our doctors and students. And then it's me. I'm going to be providing a course about health awareness and medical awareness, and how this must make a change, and of course how you connect all the above information to have the right conclusions. But Humanopathic Academy is much more than a training academy. Our intention is to create a community of humanopathic doctors and practitioners. In our practice, we implement technologies that can screen your energy field, so that when you screen the energy field, you can understand where there are some deficiencies or some excessive energy points, and you have to have the knowledge to understand if this is connected with maybe a malignancy or it's just a healthy organ. And then we can have the training, so how to understand the personality in the root cause, and finally we can have therapeutic systems that can rebalance your body with certain frequencies. So our Humanopathy Academy is a community of trained professionals that can share the knowledge. So after completing your course, your postgraduate diploma in humanopathy, there are a lot of other scientific community courses that we can follow up. I can give you some examples. We have Dr. Alexandra Filipovic, an oncologist from Imperial. She's going to provide a course about holistic oncology. We have Dr. Sotiris Nikolakopoulos. He's a molecular oncologist. She's going to provide a course about epigenetics and personalized medicine in cancer. We have Dr. Papandreou providing a course about the energy fluids of the body and the medicine around it, how to balance the energy fluids. We have psychologists, we have many doctors. And so when you finish your postgraduate diploma, you can follow up in different courses that we offer in our academy and become a member of the community. But we have even much more. The Humanopathy Academy has a mission. So by the end of this year, we are going to establish a non-profit organization that is going to be funded from the academy. So our intention is to create profit and funds to support a lot of humanitarian aspects. Right now, a lot of people that I know, especially from India, Pakistan, because I have a lot of connections there, are calling me that with the need to support children and communities that they are very poor and they do not have medicine. So technology provides a lot of opportunities. And one opportunity is that when you know which frequency to use for a treatment, you can just send it with an email, and with a proper technology they can do treatment or charge water. Charging water and information of water is another course we're going to provide, by the way. So we want to create funds to support communities or even create research programs. We are now, as much as we can afford, support them by sending money to buy remedies for these communities, but in the future we want to do much more. So the success of Humanopathy Academy is important for a global impact. So in Yale University there's a sign, and it's from an ancient Greek saying, «Λαμπάδια έχοντες διαδώσουσι αλλήλους». This means that the ones that have the knowledge must spread it and share it with others. Knowledge that is not shared is knowledge without quality. So everybody has the obligation to share his knowledge and to humanity and serve. So you are welcome to become member of our Humanopathy Academy, You can become a member as a student. We want collaboration with institutes, and also you can become one of our professors providing your knowledge in our academy. We'll be hosting free webinars to our community and a lot of courses if we have something to share. Thank you for your time. It was precious, and I'm very privileged to be here around you today. Thank you very much.
Thank you, Dr. Nikos. I'm sure he'll be around if you have any questions for him. Now, pivoting on to our next panel titled Value-Based Healthcare Delivery, Transforming Payment Models to Prioritize Quality and Outcomes. Let's dive into how the healthcare system can shift from volume-based care to patient-centered results. For decades, healthcare has been built on the fee-for-service model, rewarding volume rather than value. But what if the hospitals and providers were incentivized based on patient outcomes instead? Would it lead to better care, lower costs, and a healthier population? In this session, we are taking a look at the shift towards patient-centered care, its challenges, and whether alternative payment models can truly improve healthcare efficiency. Is this the future of medicine, or are we not ready for the change? Let's answer this question by calling on the stage our moderator for the next session, Dr. Tandria Callens, the CEO and principal of the Language and Literacy Academy for Learning, Inc., and the rest of our panelists. Welcome them with a big round of applause.
Good morning. It's so good to see each and every one of you here today. I'm Dr. Callens, and I am a speech-language pathologist. I'm certified as an ADHD coach, a clinical specialist for autism spectrum disorders, and a certified youth mental health specialist. We're going to get started with our panel discussion today. And we are going to start off with introductions. I'm actually going to have a seat.
Awesome. Hello.
And we are going to start off with our first panelist, Dr. Abhishek Kumar.
Great. So my name is Abhishek. I'm the Director for IT Solutions at ICONMA. I'm very, very excited to be part of this discussion on value-based care and its transformative potential. I mean, as we all know, the traditional fee-for-service model often, promotes volume over quality, which leads to escalating cost, fragmented care. So the value-based care offers a very compelling alternative, where it focuses on patient outcomes and reward providers on providing efficient, high-quality care. And in the heart of this entire transformation lies the power of data and analytics. And I'm looking forward for a very productive discussion on this today with my fellow panel members and with the great audience who have joined here. So looking forward for it. Thank you so much.
Good morning. My name is Dr. Aditoro Oriaifo, and I currently serve as the Chief Pharmacy Officer for Total Healthcare. So Total Healthcare is a federally qualified health center that's located in Baltimore, Maryland. We care for about 30,000 lives annually, providing comprehensive healthcare services, pharmacy services, dental services, behavioral health, and we also provide specialty services in infectious diseases and podiatry. Again, today, I'm so excited to be here to have the opportunity to be a part of this very important discussion about value-based health, value-based care. But again, for me, it's more from the perspective of the role of the pharmacist, right, as a healthcare member. Again, as a healthcare leader, a pharmacy advocate, I've had the opportunity to work across clinical, operational, and even the public health space. And I see the opportunity that pharmacists can play. I see the potential for pharmacists to participate in the value-based care and how they can help drive the positive healthcare outcomes, which is the whole purpose of value-based care. So again, I'm looking forward to having a very interesting conversation today. Thank you so much.
Thank you. Good morning, everybody. Fantastic to be here in Las Vegas. Just finally getting over my jet lag. I got in on Monday afternoon, and I'm finally over it, but I'm going to be back on a red eye tonight. My name is Mustali Dohadwala. I'm a clinical invasive cardiologist. I have my own practice, a little north of Boston, about 14, 15 miles north of Boston, Massachusetts. I cover over 3,000 lives. I've been able to successfully run a solo practice for almost 15 years now, with a mission, a model to provide exceptional care to each and every one of my patients, my members, without exception. And I feel so blessed, humbled, honored to be part of this discussion, because I think we're at a very important crossroads right now in healthcare. And I think that right now we're really going to be addressing a seismic, I would say, philosophical change in the way the patient-healthcare provider relationship will be, if it hasn't already become. I truly believe that there's going to be a tremendous change in this particular relationship. And I think this value-based financial incentivization, I think most would agree that will relieve I would argue, all healthcare systems, groups, solo practitioners such as myself, from inherently over-treating, right?
Right.
Or under-treating.
Yes.
So I'm excited to be here. Thank you.
Great.
Thank you, panel, for being here. Now, what I would like to do, in order for this conversation to be meaningful to you, let's start off with questions from the audience, because we want to make sure we address your concerns or your questions, because we're involved in our fields every day, and we can talk about this all the time. But are there any specific questions or concerns from the audience that we can address ahead of time before we delve into this deep conversation?
Exactly, because we can keep speaking the
Yeah.
whole day.
Okay, so let's go ahead and get started. I think it is important for us to all have a foundational knowledge and understanding of value-based care. I don't want to assume that you all understand or know what that exactly means. So if Dr. Kumar, if you can go ahead and get started and just give us a foundational definition in your line of work of what value-based care is.
Absolutely, absolutely. So actually there are, thanks a lot, Andrea, for that. And there are 5 key talking points which I like to put across, more like a food for thought for all of us here. The first one is, as you rightly asked, Andrea, defining value in the value-based care. Okay, that's the first point. And I'll get deeper into that one. The second one is data-driven foundation for the value-based care. Okay, that's the second key point. AI as a catalyst to VBC, value-based care. Okay, that's the third point. Then overcoming barriers to data-driven VBC, because that's another very important point what we have to ensure. Okay, that everything is great, but if we are not able to overcome barriers, everything is a loss. And the last but not the least, what is the future of VBC using data and AI? These are the 5 key talking points that I would like to start with, okay, more like a food for thought, and we'll keep delving deeper into those. But now coming back to what Tandria just said, defining value in value-based care. Now think about it. In value-based care, who are the 3 primary key stakeholders, okay? They are, everybody, you all can guess, right? It's patient or the members, like all of us. It's the provider and the payer, insurance companies. These are the three key or primary stakeholders into that, right? Now, a value can be best defined if we take a collaborative and a multi-stakeholder approach, which includes patient-reported outcomes, clinical efficacy, cost effectiveness, okay, all measured through standardized metrics and tailored to the respective or specific patient population. That's very important, okay? And in a nutshell, and if I talk in very simple terms or literal meaning, if all these three key stakeholders are happy and without friction, we will get our value-based care. Until then, there is no value-based care, okay? Please.
Thank you.
That's something.
Dr.
Yeah.
Arayafo?
Yes. I agree with Abhishek's I agree with Abhishek's definition. Again, as a pharmacist, to me, value-based care is providing those clinical services that help to drive patient outcomes. Again, as we see now, especially in, when we look at the healthcare landscape now with primary care services with providers, there's a shortage right now, right? Trying to get to hire providers right now is it's a challenge, especially from my FQHC space. And I see pharmacists, again, being able to deliver value in this, especially to help address these shortages. What tasks can we relieve current providers, right? Relieve them from where the pharmacist can step in and take on this task. Things like medication reconciliation, right? That would free up our providers now to be able to see more patients, right? And do what they do best, right? So to me, that's what I would say, from a pharmacist perspective, is delivering those pharmacy clinical services, preventative care, vaccinations, right? That help to drive patient outcomes. Thank you.
Great, thank you. Is there a particular question that you have for me in particular, or?
No, if you want to expand on just the definition so that we're all on the same
Sure.
Level playing field with our understanding before we dive into the details.
Absolutely. I think it's important to also understand where we're shifting from, and that's the traditional at the register, collecting the copay,
correct,
right? Fee-for-service model. And that, I think, I think it's really important to digest that what does that entail? And it's that volume-based incentivization, for the most part, historically has shown that it really translates to treatment rather than prevention.
Yep.
So I think that the next 25, 50 years in healthcare is really going to become, it's going to be tremendous to identify preventive strategies to help reduce disease burden, overall prognosis, and then finally cost to our society.
Absolutely.
And I think, what are we moving to? And when we talk about these value-based healthcare delivery systems and models, there might be a fear that, hey, we're not going to be able to collect that copay at the register anymore. But in the end, I think that we're trading that copay fee off with prioritization of several fundamentally important things that I see as a solo clinical practitioner in healthcare, and that's focusing on preventive health strategies, right? I think that we can manage chronic conditions better in a more effective and efficient manner, and we're in utilization of collaborative multidisciplinary resources, which at present, frankly, we don't have time for, nor are we incentivized for.
Yep.
And then finally, I think that I sort of touched on there's a shift in a paradigm and a philosophical change in that patient healthcare provider relationship. And I truly believe that this delivery system or this model of care, value-based proposition that we're discussing here, will be able to shift. We'll actually be able to focus on quality rather than quantity or duration of a person's life.
Exactly. And basically what you're saying, just to add on that, going from a reactive to a proactive approach. That's, I think, that's the whole things of it. We have to do that.
And as the CEO of a public charter school in Florida, when we apply this value-based care paradigm in the school setting, it's very similar to the medical setting where we are looking at preventative strategies. So we are wanting to implement the therapies early on, the mental health services early on. So it's early intervention prior to us reacting to a trauma or behavior disorder or a diagnosis of a deficit for a student. So looking at how we can intervene early on, whether that's Head Start or VPK programs, all those programs that actually help our students get a head start. And if there is a medical diagnosis, if there's a deficit, if there's a challenge, that we're intervening as soon as we can. So thank you all. I think we now have a good understanding from the different areas of value-based care. So let's move on and let's dig a little deeper. And let's start with some of the challenges that you face in your profession. And let's start with you, Dr. Kumar.
Exactly. I mean, the challenges from a, and again, I'll talk again on the data-driven foundation when, we are talking. So first is the data interoperability. That's the first major challenge. Okay, data standardization. That's the second major challenge. And the third one is getting the data or data integration from diverse data sources across healthcare system. And I'll try to explain you will be surprised because I was in the thicks of that, implementing some solutions for large healthcare systems and large payers. What is the level of data access problems which are available? I would like to definitely share some of my emotional thing there. So again, but these are the three major challenges which are there. And forget about accessing data across healthcare system. Let's talk about one healthcare system. In one healthcare system, there could be, let's say, 20 affiliated hospitals. Forget about those 20 affiliated hospitals also. I talk only about that one hospital in the one healthcare system, three different departments of that hospital. There is a recruitment department. There's a credentialing department, which is called the credentialing verification organization within that hospital. And then there's an enrollment department who is enrolling the providers with the health plans, right? All these departments are taking the same provider data, entering it multiple times into their own system of record, which could be Excel sheet, which could be sometimes the big Excel sheet they call as big Kahuna sheet, okay? Or some kind of system. And they are doing it multiple times day in and day out, and none of these systems, none of these departments are talking to each other. So they get the provider information, recruitment team puts all of them pretty much in an Excel sheet or something, and then once they are done, the letter of intent is signed, agreement is signed, all that great stuff, they send an email or something to the CVO, then CVO takes that information, again enters that into some system of record, conducts all the CVO activities and everything, then once they are done, then they go to the payer enrollment department that, okay, you can now start enrolling. Until that time, payer enrollment department has no visibility, pretty much, that they could have started in parallel, okay, for enrolling and preparation for enrolling those providers in the health plans. And now, finally, they again do the same thing, entering the data again to start putting the providers or enrolling the providers into health plan. Now, think about this perspective here. All these the problems, what ultimately it leads to? It leads to the delay in getting the provider participating in a particular health plan. And that means the provider is not seeing the patient, or if they are seeing the patient, there's a high enough chances of their claims getting denied. And ultimately, who's the sufferer? Patient. Okay? So, the value-based care goes for a toss. Okay? So that's the challenge, those three key challenges, and what are the real-world problems which happen. So forget I just talked about one healthcare system, one hospital, different department. I didn't even go to other affiliated hospitals and across healthcare system. It's unheard of right now.
Right. So Dr. Olivero, let me ask you this question. Coming from a pharmacist perspective, when we have weight loss concerns, Ozempic, for example, or tobacco cessation, those type of public concerns, how does value-based care, the paradigm shift, impact those particular healthcare concerns?
Okay. So, again, when we look at the role of pharmacists in value-based care, I think it's two main roles. One is the clinical, and the other is that public health advocate. And when you look at things like weight loss, smoking cessation, I think those are public health issues, that pharmacists can intervene in. In terms of value-based care, so right now, when you talk about the challenges from a pharmacist's perspective, number one is the payment. That's a big one, right? Yep. Pharmacists right now, in most, depending on your state, are not being compensated for these services. And again, as you said, if we don't rightly align the incentives, then folks are not going to do it. So again, right now, pharmacists are not being incentivized to provide these services, so that's a major issue. Secondly, in terms of, he spoke about the data interoperability. That's a big one too. I work in my current healthcare setting, I work in a FQ, which is a clinic, and our pharmacists are within the clinic. So we do have access to the EMR. Let's look at it from the perspective of an independent pharmacist, right? It's an independent pharmacist in a community, they have patients that they're seeing. How do they, without data interoperability, having this health exchange warehouse where they're connected to, where they can say, hey, provider B or provider Dr. Smith, I see that we have 10 mutual patients, right? And I see that your patients, based on this Medicare star ratings or high-risk measures, they're not meeting these measures, and I've identified these gaps in care. This is the service I can offer, whether it's smoking cessation, whether it's weight loss, and I'm going to work on them. And then having that bi-directional feedback that once he does, the pharmacist has done what they need to do, the healthcare provider is seeing it, and now they're not duplicating that effort again, which is basically what's driving the cost duplication of effort, right? So again, those data challenges. Also, again, for pharmacists, I think some of the things some of the challenges is how do we demonstrate value in this new,
that's a good one.
This new healthcare model. But we can, again, I look at it, the four main challenges is, the data interoperability, bi-directional communication, real-time data, payments, and then demonstrating value. But I say if we can solve the first two, the data interoperability, bi-directional data, real-time data, then it's just a matter of time that you're going to be able to demonstrate value, because now you have data to say, hey, see what I did. I worked with Dr. Smith. I was able to follow 10 patients. I identified these gaps in care. These are the interventions I made. It's documented, and this is the result. I mean, it will only take, payers have to be out of their mind not to want to reimburse you for the value that you have done, that you have created. So I think, again, if we can solve those two, the data aspect of, data interoperability, bi-directional data, real-time data, and also, again, another important thing is when you have data, because, again, I'm speaking from my perspective as, working in a healthcare clinic, we have access to data. But then somebody has to sit down and scrub this data, interpret this data. How do I know who should I be reaching out to first? That risk stratification, and I again, I'm happy we have Abhishek here to say, I believe AI can help us with that. What task in scrubbing that data, making sense of that data, can AI take care of so that the pharmacist is actually spending time in the high level tasks that deliver the value we're looking for, the clinical interventions, the patient counseling, the education, right? So I think that's my perspective. Thank you.
Fantastic. Awesome.
Thank you for that. So next question, piggybacking on things that I've heard, how does collaboration with other professionals help us to promote value-based care, to prevent the gaps in service, and to ensure that the data interpretation is valuable for the patient?
Yeah, I mean, I think before I answer that question, I think it's, the way I see challenges at present, I think from a bird's eye view, I think a major challenge is there are a number of parties that have to essentially, be on the same page. First and foremost, it's our patients, our healthcare providers. They need to be on the same page. Our payers need to be on the same page as our patients and our healthcare providers. And then finally, governing bodies, right? Governing bodies, obviously, local, state, federal governing bodies, professional organizations, like for me in particular, the American College of Cardiology. All these entities have to be on the same page. Mm-hmm. And I think that has been a challenge this is not new, right? This value-based healthcare delivery concept is not new by any means. Right. I think the reason why it hasn't completely taken off is because of this. I think taking a little bit, going into the weeds a little bit, I think that another challenge, I think a major challenge I see is of time. And what I mean by time is there's an upfront investment, whether you're a large healthcare system, whether you're a multi-pronged group, multifaceted, multi-specialty group, or for that matter, you're a solo practitioner like me. And there's a time in creating, tailoring, curating an individualized, personalized plan of care for each and every patient member of yours. So I've got 3,000 patient members in my panel. I want to create a personalized. I want to create a personalized prescription for that patient. Mm-hmm. Mm-hmm. And then obviously cost. And what I see as cost as a solo practitioner is not necessarily, how am I going to, balance my books at the end of the month. The way I see cost is really how do you end up recruiting and hiring highly trained, experienced personnel, healthcare providers that can help. Most importantly, what I see as how do you hire these people that can help you as a provider coordinate care, communicate with your patients. You're bringing up data analysis, how to actually look at that clinical data mm-hmm. Mm-hmm. in a meaningful manner, right? And then finally, engaging with patients. So that's not just money, that's also time.
Exactly, and time is money, of course. So, yeah.
And then I think going to your point, I'm sorry, repeat your question one last time.
Collaboration with professionals to prevent these gaps in care.
Right, and I think it goes to sort of my point about creating a team and all being on the same page. So that whole team has to be on the same page. Reimbursement has to be, essentially thought of as, okay, we're taking care of this patient in a group fashion, and we need to figure out how to reimburse each and every member that is providing care in that comprehensive, multifaceted way.
And doctor, you also mentioned, put a very good point on, the value-based care, both in terms of primary care and specialty care, that, coming out of that one shoe size fits all strategy and creating a customized treatment plan is the way, is very important, because the medical conditions are getting aggravated by the day. It's not the same medical condition which used to be there like 10 years before, right? There are different kinds of complex medical conditions which are coming, and if I have more medical conditions, I need more care, as simple as that. So even if I have the value-based arrangement, okay, that value-based specialty care arrangement has to be customized for a patient like, in me in this case, to be more personalized as compared to, other patient who does not need that much of care. So That's a very interesting paradigm also, which you just brought.
In line with data, and the advent of information and the amount of information we have, that allows us to personalize care.
Correct? Exactly.
That allows us to personalize care in a very, very meaningful way.
Exactly.
So just because you've got a diagnosis of stable coronary heart disease doesn't necessarily mean that you have to take a statin drug, although certainly it's highly recommended. But there might be other lipid-lowering or anti-inflammatory medications, agents, supplements that can be taken that may ameliorate your risk for developing complications from known coronary heart disease, perhaps better than a statin drug. And we know, and we can gather that information in a very, 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 very sophisticated, elegant way using proteomics, genomics, and we're able to identify each person's risk profile and what puts them at risk for an acute myocardial infarction, right? What makes him or her higher at risk versus the person that is sitting next to them? And I think that's what makes this so fascinating right now.
I want to go back to the issue of time, right? Because I think that's where pharmacists actually do come in. There was a study that was done by the National Association of Community Drug Stores, and in this study they discovered that patients actually see their pharmacist. They visit their community pharmacist 12 more times than they see their primary care provider. I think that just creates that wonderful opportunity. I mean, if you're coming and I'm seeing you 12 times, I'm not scheduling an appointment, so that accessibility. Imagine having a relationship with a pharmacist. That, let's go back to the patient that has the issue with their heart, right? And you say, hey, they can look in the system and say, hey, Dr. Smith's patient, I know has this issue. They come in 12 times. It's just a quick conversation. Hey, do you have a second, right? I noticed this. Do you have a second? Let's 15 minutes, let's talk, let's counsel. There they can see, oh, I see you're not taking your meds, right? This is the impact. This is the implication. I need you to refill this medication. And by the way, I see that the last time they did your levels, your lipid levels, I can see it there, and this is what that means. A lot of patients go to the doctor. 15 minutes. How much education can the provider offer the patient in 15 minutes, right? What are your numbers? What do these numbers mean? I think the pharmacist is well placed because we do have that time. They're already in the pharmacy. We're not having to call them. They're already there. And I think we could leverage pharmacists in that aspect.
How do we do that? So you're actually in a clinic, but what about us that just go through the drive-through and pick up our prescription and we're just passing through?
So that's the 12 I'm talking about. It's for community pharmacists, not in a clinic. In my clinic, I think our patients it's double that, because then they come to see the provider, they pass through the pharmacy, and they actually come to the pharmacy. So we have more higher number of touch points with them because we're right there underneath that same roof with the provider.
Right.
But for the community pharmacist, it's still 12 times more than they see their provider, which I think that's very, that's significant, right?
So I'm just imagining going through, and I'm not promoting any pharmaceutical company or, company where I pick up my prescriptions from, but I can imagine going through the drive-through and my pharmacist say, hey, can you come in? Do you have time? Instead of coming through the drive-through, can you come in so that I can talk to you about your prescriptions? I see that you're seeing this provider, and provide some patient counseling and some education.
Right there and
like
then, right.
That would be value-based.
Right.
Exactly.
In real time.
Right, exactly.
Yeah.
Exactly.
So,
and having that AI or that technology
Correct.
that flags that patient, that flags you in the system, that said, hey, by the way, this is needed. These are the gaps. These are the issues that you could address.
Exactly.
Instead of somebody going through Excel sheet and having, by the time you're done with the Excel sheet, the patient's already gone, right? But having that technology that can flag what's needed in real time, so then the pharmacist can then provide that service.
And it's very much there. I mean but I always go with that analogy that we have so much of data, but we don't have data. Okay, that's the problem. Okay, Like, as if, you are in that ocean with the water all around, but you cannot drink even a sip of the water, although you are thirsty, right?
So your data reach, I think it's data reach information poor, they say, right? Something like that.
Exactly. So, all that intelligence that you talked about, okay, because with all the patient information and everything that we have, the treatment data, the discharge history, the EMR data, EHR data, all the data can be very well consolidated. Right. And a predictive AI model can be written based on that one to say, hey, you have a likelihood of getting a chronic condition in next 6 months to 8 months, and this is the data, what it says. And if you're not taking these medication, or in fact, we can do a prescriptive analytics there to suggest the best course of action. Okay, these are the medications you should be doing. These are the fitness related coaching you need to do. These are the, all those proactive intervention strategies that can be placed for that patient to not become a patient, and ultimately for the payers also, then I'm saving cost, right? Because the cost of hospitalization that would have happened or will happen in next 6 months or 1 year down the lane is 10x more than getting it resolved through primary care. True. So why not?
Right. And so when I think about what I'm hearing in our conversation, we've been kind of stagnant in this trajectory and moving towards value-based care. If we had an opportunity to talk to the decision makers above us, who actually have the power to just complete the shift, what would you say? How would you advocate for value-based and just patient empowerment? It's open to anyone.
Okay. I can go first. Yeah, I think it starts with policy, honestly. I think policy would help drive, it will help drive that change. When you have the policies, from the policymakers, then make this, that really are aligned. And as you said again, everybody, all the different stakeholders, and policymakers are stakeholders in this too, because again, and once we have the policies, and policymakers saying, okay, this is where, this is what we want to do, and this is how we're going to do it. Mm-hmm. Then I think payers are going to fall in line, right? As payers fall in line, then it just goes down the chain that way. I think it primarily starts with policy changes that support value-based care.
Yeah, absolutely. I definitely believe that we need to convey to regulatory bodies, our societies that we're affiliated with. They're certainly fighting for us as healthcare providers. We need to ensure that they understand the importance of this model when it comes to the opportunities that not just us as healthcare providers can gain, but the patients. And what I mean by that is, we can truly see empowerment of our patients through this particular model. And what I mean by empowerment is they're going to become more invested in their overall well-being, right? It's going to force them to become more invested. And when I think about being more invested, when I find that when my patients are more invested, what I've seen over time is those patients are the ones that are better at dealing with their chronic medical conditions, or for that matter, are the ones that perhaps avoid developing debilitating chronic medical conditions. Mm-hmm. And then when it comes to healthcare providers, I think it's an opportunity for us, and I think it's important for these regulatory bodies it's important to show them that we have an opportunity to focus more on granular metrics rather than the traditional metrics that we've been taught. So what I mean by granular metrics I'm talking about focusing on the full spectrum of care and the external factors that influence a patient's health trajectory, right? Mm-hmm. Mm-hmm. And I think that when we as healthcare providers are focusing on granular metrics, we're able to better have open dialogues with our patients regarding realistic treatment goals and their overall prognosis.
Makes perfect sense. And I'll I'll try to answer this again from being a data advocate, from the data angle. Okay, first and the foremost, foster a culture of data-driven decision making. Incentivize data sharing techniques, data sharing strategy. Incentivize that, and going over and beyond. And again, that's inevitable. That's also going to come. Data democratization. Why I need my data to be stored or owned by a healthcare institution? Why not my data? Because it's my data. I am the owner of my data. Why not my data can be there in a blockchain, in a shared blockchain, which has stringent security standards that decreases very well the probability of getting it hacked and cheated and all those things. Why not my data can be there in blockchain, and I get a decentralized identifier that is called as DIDs. So when I now think about a situation here, okay? I go to the provider. I say, provider, my DID is P001. Okay, great. So provider, and I am the owner of my data. I can give access, a temporary access to my provider to that data, where he or she can get all the information that is related to my treatment, vaccinations, blah, 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 everything that has done to me. And then he or she can prescribe whatever the symptoms are, diagnosis is, conditions are, and then update that data, and it updates back that into the blockchain. Again, and it's there with my ID. I go to the next provider, it's already there. Today, how it happens? If I have to go to a doctor, and if I was not going to that doctor, I'm going for the first time, in order for that doctor to get my medical history and everything, they will fax. Right. By the way, we are still doing the faxing in this digital era. Okay, they will fax the information to another practice. That another practice will take its own sweet time to give that data in the own snail mail pace. Okay, however, and we in fact we use snail mails also sometimes for that. Okay, and that data reaches. And after that data reaches, what I do as a provider, my staff again enters the data into some of my system of record and everything, which we don't know if the data that was received from that previous entity is still complete or reliable or not, because it could be outdated, it could be, who knows, because of so much of redundancies and everything that has happened. So that's the broken thing. Why I need that data to be controlled anywhere? Why not I become the owner of my data, democratize the data, put that into blockchain, and give me the DID, that is a decentralized identifier. There are verified credentials. It is already, there are works which are happening on these blockchain technology, and it is inevitable. It is going to come.
And I think, just to touch on redundancies, I think it's important to reiterate to lawmakers, governing bodies, our societies, that redundancies cost money. And more importantly,
absolutely,
these redundancies, as you're well aware, when you're prescribing when you're helping us prescribe medications and dispense them, redundancies can can lead to morbidity as well as potential patient mortality.
Yes, definitely.
And I think that is what needs to be reiterated. I mean, I'm pretty certain that our governing bodies, lawmakers, payers are well aware of this. But you're absolutely right. My fax machine is running right now at my office.
Exactly, yeah.
So let's talk about if policy doesn't change, if we continue not to be incentivized, and it seems that fee-for-service is going to continue to be the hallmark. How are we going to still have the outcomes that we want and still add value to each of our practices? It's open to anyone.
So again, I can start, again, working for a federally qualified health center right now. Right now, again, for FQs, they get reimbursed using fee-for-service. That's the model, right? Fee-for-service per patient, right? So what we do right now, again, pharmacists are not being reimbursed, but again, because we do see the impact of when pharmacists are embedded in that as part of the healthcare team, and we're helping our clinical providers, helping them to identify those care gaps, and we're working on to close those care gaps, we see the outcomes. And so right now, we do have our pharmacists. Again, we're not being compensated right now for it, but again, thank God in Maryland, they just actually, again, I know you said if they didn't, but now they have actually passed legislation now that pharmacies are going to be reimbursed for some of the
Well, that's
services
good
they post,
news.
which is awesome. So again, but I think for us, the good thing is since we've already been doing it, now we have the advantage of just kind of rolling into the model and now, billing for it. But again, we've been doing it, and I think in states that are not getting incentivized, I think we have to look at the greater good. Again, as I was saying, the whole point of healthcare, why we as pharmacists, doctors, nurses go into healthcare is to serve, right? Is to serve.
Exactly,
So,
exactly. And on that, I mean, CMS has already, given that tentative deadline that all the Medicare and most of the Medicaid beneficiaries will move to a value-based care arrangements by 2030, okay? Of course, which is going to drive the cost by, with my stats right now, which I read through, it's 8.1% for the Medicare, and it will be 11.1% for the healthcare private insurance companies. So the policy is there. I mean, it's going to change to value-based care, but again, same question goes back to the same thing. Are we still creating the value? Or if we are creating value, what is the cost of creating the value? How we will create value? The question again goes back to the same. And again, we are talking about all these great data analytics tool, AI tool. We also have to be cautioned about while, it brings great opportunities. Okay, AI is bringing great opportunity, but I would also like to highlight there will be downside to it also. I'm not saying that you stop driving the car, as someone was saying in the panel yesterday, you stop driving the car because there were some accidents, okay? Accidents will happen, failures will happen. It's just about we have to be registering that and making sure we have right policies and procedures in place to mitigate that risk also. Okay, that's, the ethical use of AI basically, okay? So yeah, we can talk more on that one.
I think again, in lieu of having policies, or again, 2030 is still, that's how, it's 5 years.
That's 5 years, yes.
I guess it's going to come in a snap of a time now.
Yeah.
But again, in that time period is to start working on these things, having the interoperability, the AI, agentic AI, what role can that play in simplifying, making things more efficient, driving more impact? I think we should use that time period to work on these things and make sure those things are ready so that when 2030 comes, we're ready to move.
To echo your sentiment, that was going to be my exact point. I think we don't have much time left.
Exactly.
You beat me to the punch. I was actually going to tell you that this is a train that's already moving. But you're partly right in that until we do have this healthcare delivery system up and running, as we know, there are a small percentage of commercial payers that are already using this particular healthcare delivery system.
Mm-hmm.
There are certain states that are better than others.
Right.
Our federal government is certainly going to get there, probably not soon enough, but but they are going to get there. But exactly. I think, echoing your sentiment, we have a tremendous opportunity. We can on-ramp with utilization of tools that your company has expertise in. How do we make, I look at data all the time. It tires me. I get so much data that's completely meaningless. How can we, over the next few years, how can we utilize the science, the resources that we have, to make that information meaningful? So when the vast majority of payers are going to be looking for value-based health health metrics. How will we, how can we make sure that we're going to be put in the best position to succeed?
Absolutely.
And let's talk to our audience about what it looks like moving forward and how they can assist us in pushing forward this paradigm shift.
Absolutely. And and again, most of the people must have every time has the questions about the AI and there will be AI biasing, okay? Because again, AI is a model. It's as good as the data that is being fed, okay? So we all have that question, and I keep hearing that questions every time, from everywhere, that there are problems like that. Yes, there will be problem like that. I'm not denying that. Okay, we have to, keep, first of all, we have to have a strict data governance policy, okay, to make sure, that we are keeping that in
An
check.
AI governance policy,
Yep,
yes.
exactly. The second one is algorithmic transparency. Okay, now it's easier said than done, but that is something which is required. How you can create a traceability or transparency in how your model is taking decisions, because they are taking decisions on your behalf, okay, and you are knowingly or unknowingly going forward with that decision, okay, pretty much, okay. You have to ensure that how you are creating that traceability and transparency into your algorithm, okay, that's the second thing, okay. Okay, so algorithmic this thing. Then conducting regular bias audits, because as I said, the biasing will be there in the data. How you can keep monitoring that, there has to be a process which is continuously evaluating that, making sure that bias is being identified, and you keep correcting the bias. You cannot reach 100%. There's nothing 100%. There's no, the 100% is a myth, but as closer to 100% you can get, that's how good your model is. And then last but not the least, you have to prioritize patient consent and data security, because you are dealing with PHI information here.
Very important.
Yeah,
Yes.
you have to do that. It's HIPAA. HIPAA will kill you for that for sure, and they should kill you. If there is a problem like that. So you have to definitely prioritize patient consent and data security. So yeah.
That's what I was going to say, the way the public can help.
And as you have the mic, we're going to go ahead and do our closing remarks. So whatever closing remarks you have.
All right.
Go
So I was
ahead.
going to say the way the public can help is giving that consent. I know one of the reasons why we in my practice have access is because our patients have given us consent to be able to access their information so we can help them.
Mm-hmm.
So having that consent from the patients, I think it's very important.
I just want to end on, I feel, again, humbled and blessed to be part of healthcare during this time. People ask me all the time, why is there so much lability? Why is there so much volatility in healthcare right now? But I think I look at the bright side. And I think some of the discussion that we had here today highlights the bright side.
Absolutely.
And despite the time being volatile, despite it being unclear, I do believe that there's very bright light.
There's light at the end of the tunnel.
Very nearby. Thank you.
Yep, and I'd like to, again, with my closing remarks, the value-based care is a complex but a necessary undertaking. We have to do it. And by harnessing properly the power of data and analytics, we can create a healthcare delivery system which focuses on quality of care and improves the lives of the patient. That's what really matters. Okay, so. Yep, looking forward for more productive discussions on this as value-based care keeps evolving every day. So thank you so much for this.
And I think as we, the rise of, or the awareness, I should say, of mental health concerns, behavior concerns, I think every one of us wants and appreciates the value-based care model for treatment, for longevity, preventative concerns. Do we have any questions that, we have 2 minutes. Any questions? Yes.
Does it seem realistic that the insurance companies are going to change?
Can I?
I'm not confident that, I believe in this value-based care. It's essential. The way we're doing it now is not right. But I can't see these powerful leaders in this industry doing anything that's going to affect
Their bottom line, right, yes. And I think you all have already mentioned the fact that we have policy changes already that's in place.
Yes.
And so if you want to go ahead and add to that.
I think just really quickly to touch on that, it certainly seems that way. It certainly seems that way. But I think that, I'm certain that healthcare systems, payers for sure, and governing bodies understand that our society is not getting any younger, they're getting older. People are certainly living longer. Chronic medical conditions cost a lot of money. They cost a lot of money. And you don't have to be a genius to understand that preventative medicine, focusing on preventative medicine, will at minimum delay the development of these chronic debilitating medical conditions.
Well, is there a disconnect? Because I see you talking, and it's so great because everybody here is 100% into treating the whole person.
Right.
But the healthcare system, they don't want to do it that way. They're not interested in that at all. So there's a disconnect between, because when you go to the doctor, you feel like, oh, well, they don't even care about me, but I know you do. But you're constrained in the way that you can treat people.
What systems and payers do appreciate is money and costs. And right now, healthcare costs a lot of money in this country.
Thank you so much for your time, attention, and engagement. If you need to speak to any of us, we will be glad to answer your questions on the side. So thank you.
Thank you. Thank you so much.
Excellent. Thank you, panelists, for breaking down the challenges and opportunities in the value-based healthcare. As a quick reminder, if you haven't already done your interview, they are going to be closing at 1, so make sure you get your interview in. In an era where technology intersects with personal care, understanding how to integrate high-tech solutions with a high-touch approach is crucial for enhancing home care services. Our next keynote, Home Care Delivery with High Tech and High Touch, led by Andrew Pakistan, Chief Operating Officer at All Care Provider, tackles this subject. With a robust foundation in engineering from California State Polytech University, Pomona, the business expertise from USC Marshall School of Business, Andrew leverages his unique skill set to advance home care services. In this keynote, Andrew will discuss how technology advancements like remote health monitoring, AI-driven care plans, and mobile health applications are revolutionizing the home care industry. So without further ado, let's give it up for Andrew.
Hello, everyone. Glad and thank you for coming to this keynote session. My name is Andrew Pakistan, as elated, and very happy to see you guys. But just, taking a quick pulse around the room, how many individuals are providers here? Awesome. Okay, how many are actually clinicians as well? It could be multitask. Awesome, great. How many are here as in behalf of health plans? Okay, all right. And how many are advocates for health care? And I should be seeing a lot of hands here, yeah. Awesome. And for individuals over live, I'm pretty sure you have those participations as well. But I'm here to talk about tech, innovations, as well as, compassion and care. For All Care, we believe in actually using both, innovation and compassion to do a high tech as well as high touch to our patients that we serve. Again, serving as a committee board for California State Association for Home Care and Hospice, as well as the national committee members for the National Alliance for Care at Home. Those are one of the biggest things that we want to bestow to everyone, is how can we make this real? With healthcare being so strained, right? We hear it throughout the whole conference. We hear it across the nation. It's how can we do more with less? We see the physicians, numbers kind of declining as well. They may be even part of the healthcare system as service as well. But what do we do with the current technology and the current, you can kind of say, silver tsunami coming down the pipeline? Over in All Care, we see everything from pediatrics all the way to the end of life, at post-acute at home. And we know that what the most comfortable places to be is actually in your own home. And those are one of the things that we really want to bestow into healthcare, is how can we get ahead of the curve? How can we get the hospital at home, skilled nursing at home? Again, we know that's a high cost, center for everyone. But also, how do we use technology to really be pre-acute versus post-acute? Again, we see a lot of devices out there, fantastic. It's great, biowearables, telehealth, as well as like having face-to-face conversations over the web with some specialists, right? Because again, the previous panel said that time is money, but also, as providers, we understand this. But let's flip it on its head. The time of our patients are also valuable. And how do we make that real? But also, how do we make that understandable? To relate to the story for this is, especially in technology, we have biowearables, telehealth, that's great. It's all data, right? And sometimes too much data is noise. And how is that comprehending down to the patient level, right? And that's one of the beautiful things. We had one patient who has diabetes, as well as cardiovascular issues. We're able to take a look at, hey, there are some issues here, and be pre-acute. Hey, go ahead and talk to that patient and say, what have you eaten? Blood sugars come up. They may want to celebrate a birthday with their grandchildren, right? And that may be a blip. But if it's a consistent trend where AI could actually scrub through that data and say, hey, we need to have a different interview with these patients, maybe change a little behavior, and then reduce the hospitalization of high costs, but still provide accurate and patient-centered care. And that's the one thing that we really want to see is like, how can we be that high touch? Data is great. Let's go beyond that, right? We know fall's an issue. Things are very susceptible after that. But how can we make that real for the patient? How can we have them in the driver's seat? And the way that we do this at AllCare and the National Alliance of Care at Home is talking with the patients. Think about it. Time is money, right? Patients go to the hospitals. They talk to their primary care physicians for X amount of minutes, right? But at Care at Home, we're there frequently, interviewing. We have our clinicians out and 2 times a week, 3 times a week, or even caregivers every day that are embedded into these patients at home. Again, that pre-acute of a human touch, as well as using high tech to quantify everything and really reach out. Again, physicians, fantastic job, right? They master of their own criteria. Those are their specialties as well. And there is a need for them. But at the same time, what is underneath the hood? What is driving that patient? What is our lifestyle change that they could really comprehend into it? And these are the individuals who are at the home. That's why we really believe that we really need to get the patient-centered goals into it. But we need to have empathy. And if you don't have that face-to-face, data is just really cold. That's great. We have it. We have these statistics. But when you teach that to the patient, it doesn't really hit here in the heart. What really hits hard is having that face-to-face of what is the goals of the patients in their own words. We've seen patients that have hip and knee replacements. And it's like, okay, what's your goals after this traumatic event or some post-surgical? Sometimes they're going to say, I want to run a marathon. Realistically, probably not. Probably so. But one of the biggest things that hits in my heart, I want to be able to walk down the aisle to my daughter's wedding. Again, huge task, but after getting to know that and have that compassion and empathy, our agency at AllCare, how do we make that true? How do we work with the doctors? How do we work with the health plans to actually get that possible? Because we have to make that the patient-centered goal, right? A lot of noise, but how do we make this real? How do we get that buy-in from the patient to really collaborate versus us just sending them data, sending them stuff? These are the things you have to do. But at the same time, advocate for the patient, but sometimes the patient doesn't want to advocate for themselves. So we have to have that change of conversation. That's why heart is in the home. Everyone we'd like to serve would like to be in the home, but how do we make that real with technology? Again, we see this as an accelerator. Take a look at Meta, Facebook and Instagram. Fantastic tool of historical facts. When we go into memory care, go ahead and using that to reflect some items. They went over to a cruise, remember individuals there. Kind of scary at what big data has to done, but if you take these little instances and using AI tools that are kind of semi-free, But how do we get that touching points for these patients? But also add tech as a stack on top of it. And what is the right stack for it? Even going on to that continuum is, even for a lot of our patients, when they go into health plan portals, when they go into the hospital portals, their electronic health records, right? Ideally, especially with the group before me, is how do we get that interoperability where the patient could use one login for their whole health record? Again, it's like the confusion and noise. How do we make it so simplified? Even myself and the National Alliance for Care at Home, we work hard in DC. We pound on the walls. Again, some of our shoes has hold on it because we've been walking up and down the aisles. But those are the things that we have to make true. Not only that we had to participate, but also all of you had to participate as well. But how do we make that message, right? That we need tech, we need compassion, we need innovation to really reduce this cost for healthcare. But at the same time, for our population that we see, is how do we aid them in the tools to make them successful? Taking a look at a lot of things that we do. But again, it's going to go down to that patient level. Have that heart, right? Time is money. But even if you use AI, right, as an overall skill, it will get you to some type of answers. Hopefully it doesn't have any hallucinations, right, where it gravitates towards that other. But everyone here knows what the cases that you need for that actual patient, right? You guys are the drivers. You're that warm touch. AI and tech is that cold analytics that accelerates us. And those are the biggest things. For us as practitioners, we understand this underneath the hood. But the human element of compassion and empathy and understanding that patient's goals will drive that patient to success in lowering costs and increase that health literacy. And those are one of the biggest things that we have for all care. From pediatrics all the way to end of life, and talking on the palliative side, right? How can you have discussions? Again, data is there. You could have a prospect and future date of expected end of life, but that's a cold touch. How can you have that meaningful conversation, not only for that beneficiary, but also the family to understand? So those are one of the biggest warm touch that we want to have. High tech, high touch. Again, we really want to emphasize this national care at home is how do we really bestow that? We pound on the hills, we pound closely, but also have your patients advocate as well. What we're so proud for our agency is we're able to take a look at that data, filter it through, walk through the patients and their caregivers on how to simplify their life with using the healthcare continuum, right? But also when they call health plans or doctors, how do we give them key words to say, hey, this is what I need to do, this is my goals, and how do you make it real? Let's be honest here. Sometimes when the patient goes into the ER or goes into the primary care physician, they have a little bit of white coat syndrome, right? Give them some medications. But who's in the home actually checking? At a skilled nursing facility, you do have someone as an oversight, but that's a higher cost of care. But what about the home? What is the oversight for that? You could have these medical carousels and bestow it, but you still have to have that keen eye for it. My previous life is as an engineer, especially for making medical devices. Now being a population management individual is how can we make it successful, right? Not feel like I have beeping machines or other, but how can we have compassion on it, but increase that health lit for it? Again, these are the biggest things that we have to think to ourselves on how do we change this continuum? How do we put the patient at the center of their care, be involved in their care, advocate for themselves, not only towards their own health, but also to health plans from like the previous panel, but also out on the hill, no matter where you're at. But also, how do we create these societies or communities where it's just like-minded? So we could go to the hill and, hey, we need a change, right? And those are the things. Like, we may be in our little towns. We may be part of our little villages as well. But how do we come as a community to add, hey, here's statistical fact through data, and we save certain monies because they're at home, and we go ahead and get forward with it, but also how do we roll it back, right? And those are the things. And in case there's any traumatic events, how can we prevent it? Again, that health literacy is really key. So for me, taking a look at it, if anyone has any questions, go ahead and come up to the mic. But these are one of the things that we have, is what we really want to do. We want to advocate, get some funding over to the states, and take a look at telehealth to reduce that cost. But we cannot do it without your help, without the patient's help as well. So, as far as a big, meaningful conversation, I just want to say thank you, for participating and hearing me on this keynote. But I'd like to say, pound on the walls, go out there, make it simple for our patients, as well. But again, if you have anything else, I'm also here. But we also have someone over for questions.
Is there a way that we could use AI as a tool to help our patients set their goals so that we can really get to that heart-centered goal, but using the technology to do that? Have you guys looked through that? Have you investigated that?
We have. Again, is taking a look at what are the certain HIPAA rules. There's ambient listening where we could have, a technology that's kind of like having a casual conversation. Really depicts certain items in there, but also what I've learned from the National Alliance and some research over in Harvard and Duke is they could tell certain tones of the patient, if they're like fearful or not. But again, you have to have that baseline. Once you have those items, then it takes all this statistical knowledge, takes a look at everything, and say, okay, here's our confidence rate with it. Now, the added bonuses, especially downstream for other, providers, you could kind of say, like nurses and certified home health aides, is like, okay, what are the next conversations you want to have for these patients? And then you really go down to that path, right? And then once you start losing patients, usually ambient listening technology or AI say, hey, you may have to reiterate this tomorrow or the next day because you're going down that specific path, but you want to come back to baseline and say, is it really going to be true? Same time in changing behavior models too. You need to be physically watching there. I was part of a program up north in Washington State where they have all types of sensors. It's great, it's noise, but you have to get to the root cause. You have to get to the patient level. And that's where we're seeing AI and ambient listening.
And how are you dealing with the patient fear of AI? Because a lot of our elders are a little bit fearful or reluctant to use AI in that manner. They don't want them listening in.
So it comes down to patient choice, right? And then how can they put like a little toe? I mean, we have some patients, not a lot, that fully dive in. We have other ones who are, oh my God, I don't want Big Brother, right? The Big Brother attitude, taking a look at it. When I did a little bit of overseas studies out in like China and Japan, I was like, okay, there's a cultural, difference. So I want Big Brother looking at it. But I think after taking a look at, let's not use AI first. Let's go ahead and put like bio-wearables. You're currently like pricking your finger, you have to like write it down. And then we slowly go ahead and say, hey, talk to a health plan, of course. Let's go ahead and get you a CGM, right? Let's take a look at these trends. And then you slowly start feeding it. We see a range anywhere from like 6 to like 18 months of acceptance. We're like, okay, what about AI? Then we go into conversation with the large language models and natural language, right? It's like, are they comfortable with it? And then that's, again, is stepping stones. There are certain questions that you could ask the patients, right? And how comfortable and what their perception of where it's going to. What are Big Brothers, or do you want to keep it internally on your own? Again, we want them to control their own entity. But we start building firewalls or breaking down firewalls as we go through that. And again, it's patient-centered, but they should be in control, but they should advocate and know, not be kind of tunnel visioned for it.
That's great, thank you.
Thank you. Great questions. I know I don't have anyone on the web, so that's it. So I want to thank everyone for coming to this keynote. If you have any questions on technology, current technology in the future, and forward stepping, I mean, my contact information is on the QR code, as well as you see everything on the slide. Single slide, keep it simple, right? I know, keep it easy. It's like, oh, I don't want to read through the slides. I just want to bring it up. But I want to be in person with you guys. And then individuals over the web, you could also contact me as well, right? Hit me up on LinkedIn, right? That's the best place to actually contact me. For individuals here, we're face-to-face, so you have that opportunity as well. But over on LinkedIn, just Andrew, Andrew, Pagsisian, Pagsisihan, and I'm pretty sure there's two names on there, so it should be relatively easy. All right. So I want to thank you all for coming. And again, any questions, go ahead and hit me up and just follow. All right. Thank you, everyone.
All right, it looks like we're just a hair early before starting our awards at 11:40. So go ahead and do some business card exchanging. Again, if you haven't already done your interviews, they are closing at 1 out front. And then make sure you're following us on hashtag Health2Conf. All right, we'll see you at 11:40. All right, it looks like we're back at it. A quick reminder, make sure you get those interviews in. We are closing again at 1 out there. Now, before we move forward, let's take a moment to recognize outstanding leaders in the healthcare innovation. Behind every medical breakthrough, patient advocacy movement, and public health initiative, there are individuals who refuse to accept the status quo. Today, we honor those making a real difference in advancing patient care, medical research, and accessibility. To present these awards, please welcome Elizabeth Conley, founder and president of Thin Line Peer Support Team, Inc., to the stage. All right, our first award is DJ Lodgery. DJ is the co-founder and chief consistency officer at Acres of Diamonds, LLC. With 500 plus hours of one-on-one and group coaching experiences, DJ specializes in mental fitness. DJ holds certificates in training in emotional intelligence, mental fitness, NLP, leadership, and human optimization, focusing on eating, moving, and sleeping. Congratulations on your Health 2.0 Conference Excellence in Healthcare Award.
Hello there, everyone. My name is DJ Ligori, and first off, I just want to say thank you so much to Health 2.0, all of the organizations and individuals who are behind me having the opportunity to receive this award this week. And real quick, what I want to do is I want to give everyone an idea to think about. All right, this will take like 30 seconds. It'll be pretty cool. All right, I want you to envision a world where young men are healthy. All right, they're emotionally healthy. They're mentally healthy, and they're physically healthy. All right, they know how to manage their stress and anxiety. And because they know how to manage that stress and anxiety, they then become more confident young men. And that confidence then allows them to build world-class habits. All right, so imagine how cool that would be. Right, imagine what that might do for the world. All right, so that idea, that vision is what I'm trying to make a reality. It's been a little difficult, but it's going to be fun. All right, it's going to be a heck of a journey. And my goal with all of us kind of collectively thinking about that idea for this 30 seconds, maybe we can instill a little bit of hope and optimism in each of our hearts for the future generations of young men. All right, so once again, thank you so much to Health 2.0, all of the organizations and individuals who are behind this whole event, me having the opportunity to meet all of you this week, and I'm very blessed and beyond grateful, so thank you.
Our next award is for Ann Vu for Health 2.0 Conference Excellence in Healthcare Award. SVP Senior Quality and Regulatory Affairs Officer at ZimV, Ann is a visionary strategic leader and a Lean Six Sigma Black Belt with 30 plus years of experience. She has extensive leadership in global quality management and compliance risk in the medical technology sector. She is also a volunteer attorney and elder law advocacy. Congratulations, Anne. Our next award is for Chaitana Shah Vantha, Health 2.0 Conference Excellence in Healthcare Award. Chaitana is the founder and CEO of Circle Health and is committed to transforming healthcare for the working population. A graduate of the prestigious IIM, Chaitana has held leadership roles in strategy consulting at Booz & Company and has also led brand and digital initiatives at India's largest maternal hospital chain, Cloud9. Congratulations. Our next award is for Dr. Deborah Chasko for Health 2.0 Conference Excellence in Healthcare Award. The Director of Nursing Informatics of the University Medical Center of El Paso, Dr. Chasko has 36 plus years of nursing experience. Certified in critical care and nursing administration, she holds a DNP degree from Texas Christian University. She contributes through national presentations and peer-reviewed publications, advancing nursing informatics and leadership. Congratulations, Deborah. Our next award winner is going to be joining us via video, and this is for Dream Cloud, Health 2.0 Conference Outstanding Organization Award. DreamCloud is an award-winning outpatient psychiatric practice that integrates technology to deliver modern, efficient care. Through compassion and a patient-centered approach, the brand aims to remove boundaries so that all patients can achieve their dreams.
Thank you. I am honored to accept this award on behalf of DreamCloud. Our goal has always been to make mental health care easier to access and more effective for patients. This recognition means a lot to us. It's a testament to the hard work of our team and the trust of our patients. We're excited to keep pushing forward. Thank you, Health 2.0.
Hey everyone, this is Muskan Sheth. I just want to quickly say thank you.
All right, our next award winner is Gaure Udon Wadekar for Health 2.0 Conference Excellence in Healthcare Award. Gaure is the Senior Vice President of Operations at Daybreak Health, and in this role, she leads all post-revenue operational and clinical teams grouped under diverse areas. Gaure has led multiple operations teams through periods of intense growth and change in her role, first as a clinician founder and then as a senior operational role. Our next award is for Dr. Glenn Loomis, Health 2.0 Conference Excellence in Healthcare Award. Dr. Loomis, founder and president of the Query Health, is a physician leader in virtual care and artificial intelligence in medicine. He has held prominent leadership roles in the AMA, AMGA, and the AAFP. Dr. Loomis is a board certified in both family medicine and artificial intelligence in medicine.
I just want to say thank you to all the teams I've led over the years who did all the work and made me look good. I also want to say thank you to my beautiful wife who inspires me to be better every day. And I'm really excited to be here on the cusp of Query Health releasing our first clinical AI agent. And it's been a dream and a quest for the last 8 years. And I'm excited that we're finally there and hopefully going to change medicine. So thank you all very much.
The next award is for Isa Kaber for Health 2.0 Conference Excellence in Healthcare Award. Chaplain of the Hospital of University of Pennsylvania, Dr. Kaber is a dedicated interfaith leader and conflict resolution specialist. With extensive experience, he works to bridge gaps between individuals and organizations, promoting peace and reconciliation. Dr. Kaber has been a student ambassador, facilitator, and coordinator for various initiatives. Congratulations. This next award winner is going to be joining us via video, and it is for Muskan Sheth for Health 2.0 Conference Young Achiever Award. A research associate at Ascend Advanced Therapies, Muskan holds a BA in molecular and cell biology from UC Berkeley. Currently, she works in gene and cell therapy research in California with a patent underway for optimizing AAV as a therapeutic vector. Muskan is passionate about expanding healthcare and educational access for underserved communities.
Everyone, this is Muskan Sheth. I just want to quickly say thank you so much for honoring me with the Young Achiever Award in Healthcare at the Health 2.0 conference. This is not just a personal milestone, but I think it's a testament to the power of perseverance, innovation, and the ability to create change at a young age. My journey has been shaped by challenges that have taught me resilience, as well as the passion for driving meaningful change. From optimizing gene therapy vectors to supporting the underserved communities, my work has always been fueled by a deep commitment to creating a more effective and accessible healthcare system. This award is not just for me, but it's for every healthcare professional, researcher, and advocate striving to create a change, especially for those born and brought up in developing countries who might think that creating an impact is a far-fetched goal. I'm here to prove that it is not. You have to keep working hard and have a positive outlook. I look forward to continuing this journey and inspiring others to create a change with me. Thank you so much again.
Our next award is for pharmacist Amar Jet Makar for Health 2.0 Conference Excellence in Healthcare Award. CEO, manager, and owner of Kiwatan Medical Center and Pharmacy, Amar Jet came from rural India and became and overcame adversity to become a pharmacist in Canada. He opened his own clinic, providing essential services during COVID-19, and now focuses on improving healthcare access for Aboriginal populations. The next award is for Poyab Vu, Health 2.0 Conference Excellence and Healthcare Award. Poyab is the founder of Your Own Pathway Coaching and Consulting, is dedicated to helping individuals within a system better understand each other to foster collaborative efforts through a humanistic approach. She holds a master's degree in social work, and additionally, she has worked as a trained psychotherapist.
Good morning still. I want to thank the Healthcare 2.0 conference for inviting me and being here, and it's been amazing to meet all of you who are passionate and compassionate for the care that you provide your clients and patients, and I'm honored to be here, so thank you.
Our next award is for Risha Megha for Health 2.0 Conference Visionaries Award. Dr. Risha Megha is a resident member of the American Society of Plastic Surgeons, has 14 years of experience enhancing the field of surgery with significant roles in multiple medical and academic organizations. Dr. Megha oversees surgical development at Cloud Services Limited. His leadership has notably advanced plastic and gastrointestinal surgery while promoting innovative medical education methods. Our next award is for Dr. Sanji Sharma for Health 2.0 Conference Excellence and Healthcare Award. Co-founder and CEO of Highmark Interactive, Dr. Sharma is a healthcare entrepreneur and visionary leader. He is also the founding CEO of WellPoint Health Services. Under his leadership at Highmark Health, the team has launched EQ Brand Performance, the world's first FDA-cleared gamified medical software. This next award, they're going to be joining us via video. We have Dr. Sheila Wood for Health 2.0 Conference Excellence in Healthcare Award. Dr. Wood, an intuitive health healing coach at Healthful Energetics, holds a distinct space in trauma healing. She offers a unique approach to trauma healing, integrating intuitive energy work, spiritual mediumship. The Ashadic record readings, her practice focuses on addressing both generational and personal trauma, fostering profound and lasting healing.
Hello. I am honored and humbled to receive this global recognition at the Health 2.0 Summit in 2025. My contributions to wholeness are supported by my scientific background, plus divine gifts that allow insight into those unseen parts of us that affect our physical health. My brand of energy healing brings into focus inherited traits and traumas that are nested in ancestral DNA memory and other lifetimes. Clearing and aligning these energies creates a new role in vibrational health. I am excited about expanding the awareness of how our minds and our souls affect our physical bodies. Thank you for giving me the opportunity to do this. You can find me at SheilaJWood.com. Thank you.
All right, our next award is for Shivra Boys for Health 2.0 Conference Young Achiever Award. Shivri Boys is the vice president of her organization, Mental Health Education, Inc., with a rich background in psychology and extensive experience in developing and implementing mental health education programs globally. She has an unwavering passion for making a difference in the field, and alongside her journalistic endeavors, Shivri found solace in the world of literature, both as a reviewer and a published author, with her recent book winning the International Impact Book Award. The next award is for Shri Vana Singh Arju. Health 2.0 Conference Excellence in Healthcare Award. Shrivana is the founder, in charge, and CEO of Qubit Wellness Pharmacy. She has over 20 years of experience in hospital and retail pharmacy. Shrivana champions preventative care at the molecular level, ensuring no patient leaves without medication. Her diverse background spans hospital, outpatient retail, and compounding pharmacy.
Oof, we pharmacists don't get awards, rewards that easily, right? We always get angry customers throwing things at our table. But thank you, Health 2.0 Conference, for recognizing my efforts, my dreams. Thanks to everyone, Priya, Devika, Utsav. This is a great conference. I'm getting energy like a Superman absorbs energy from sun. I'm absorbing all the energy from you all, so I hope to take it back and give it back to my community. That said, I just cannot end this speech. I'll take only a few seconds to thank my parents, trusting me, believing me, I don't know, giving me the wings to be what I am, what I can do. They never stopped me. My brothers, my pillars, Prasanna, Rajsekar, truly thankful to have you guys support me. They think I'm the Mark Zuckerberg in the family. I don't know why they believe in me like that. My beloved kids, Manaswin, Vishnu, wherever you are, thanks for rooting for mom, taking care of your homeworks, you know, managing things on your own, learning to drive so you don't have to bother a mom pharmacist stuck inside her cube, trying to figure out insurance, you know, struggles. And my dearest niece is here today, Marali, came to support me. And she works for CDC, by the way. And past 3 weeks, there were no updates from CDC. I asked her, what's happening? She's like, Atta, I'm busy answering to Elon Musk, so I'll update your MMR outbreak soon. So that said, I know we are all here to solve a problem we found. Recently, I was in Dubai. I was very inspired by their leader, Prince Rashid Maktoum. He said, excellence has no finish line. Sky's the limit for some, sky's the beginning for some. And imagine, he sold an arid land of Dubai years ago in economic crisis times to investors with a dream. Every emirate around him has money, but he's the one who could give him a vision, progress it, and still continue to do so. I really get inspired by leaders like that who try to achieve things out of, you know, abnormal times, and how they turn things into positivity and make dreams come true. A lot of people over there really admire him, so I really get energy from people like that, and I see people here. At Qubit Wellness, we are trying to do that. I hear the patients are turned away for lack of, you know, insurance coverage or not understanding the prescription, and that's where I come in. I step in. I try to bridge the gap between the doctors, patients, and insurance companies. We ship all over California. We're licensed a few other states. We have 300 Google positive reviews, and we are still scaling up. I'm opening an infusion center pretty soon. I'm pretty excited about that. And thanks to all my Google reviews from my patients, really gives me fuel to do more, and I'm looking to do more. This is just the beginning, and Health 2.0, thanks for the courage and encouragement. Thank you.
The next award is for Tabitha Kola-Duge for Health 2.0 Conference Excellence in Healthcare Award. Trauma and spiritually informed practitioner and awakened and aligned, Tabitha is passionate about mental health. Through extensive training and personal healing, she creates safe spaces for clients. She helps release inner demons, heal past traumas, and achieve desired futures professionally and personally.
Thank you so much, Health 2.0. I feel super honored and super grateful to be here. For me, one of the things that I often like to remind myself of is you can't grow unless you're willing to stretch. And for me, this award really is a reminder for me of everything that I've been through, everything that I had to go through and grow through to be here with all you amazing people today. I think it's really easy for us to show up when things are good, when life is flowing, but it's in those moments when things are really hard and challenging that we have to consistently put one foot in front of the other. And for me, that's what's allowed me to be here today. So with that being said, I'd also like to give a shout out to my mentors, Kim and Tara, my mentors in Australia, Bo and Kirsty, and also my friends and my family for just believing in me, for supporting me, for allowing me to be here today, but more importantly for my clients, for trusting me as a practitioner, as a leader, as a mentor, but also for being that safe space for them. So again, thank you.
Our next award is for Umesh Kumar for Health 2.0 Conference Excellence in Healthcare Award. Umesh, Associate Stat Programming Director at Avik RDS India Private Limited, has built a 20-plus year IT career in healthcare. Umesh directs product strategy, architecture, and delivery, demonstrating deep technical expertise. His leadership ensures the effective implementation of critical healthcare solutions. Our next award is for Dr. Isma Maya Chalamat for Health 2.0 Conference Visionaries Award. Dr. Chalamat is a psychic CEO at Yoga of Health LLC. With almost 3 decades of experience across various fields in healthcare, she is a revolutionary inventor, disruptor, visionary, and builder of the net positive economy. Dr. Chalamat is dedicated to creating a unique approach to health that can replace the current model.
Ladies and gentlemen, my esteemed colleagues, thank you for being here today and those who are watching online. Just like the TED Talk titled, "Why the Majority Are Always Wrong," we must approach things differently if we wish to achieve better results. This is particularly true for the healthcare sector, where we bear significant responsibility for delivering outcomes. I would like to start with a quick thought exercise that may spark some creative thinking. Imagine you have arrived on Earth from another planet and are observing the state of health here. With that fresh perspective, how would you address the problems that we face using basic logic? As a visionary leader in healthcare, what I call the doctor of the future, I advocate for change. While change may not always be easy, our goal is to shift that mentality and make it enjoyable. We should cultivate a trend where evolution is pursued and those who innovate are held in high regard within society. Being healthy is our birthright, and it's something that we all deserve. I invite everyone in this sector to prioritize our own health each day, each session, and every new beginning. By becoming healthier as healthcare providers, we can truly understand what superior health means. We want to radiate vitality so that our patients, clients, and patrons will aspire to adopt that lifestyle for themselves. I developed my Yoga of Health system over nearly 3 decades of experience across various health disciplines. This system aims to replace the outdated sick care model with a framework that supports everyone in innovating regardless of their position or practice. We must start with ourselves because the doctor's oath is to first do no harm. This means living in a way that minimizes harm to our own bodies, our immediate environment, and all forms of life that we share this planet with. It is our responsibility to lead the way. When we feel amazing and radiate vitality, we demonstrate to others that it is indeed possible to live in alignment with our values. Thank you for this wonderful award. I am deeply grateful for the opportunity to support this movement toward the future of health, transitioning from an outdated model of degeneration and sick care to one focused on regeneration, prevention, and energy medicine. If you would like me to speak more on this or offer training, please go to my website, yogaofhealth.net, for contact details. Here is to us all building together the net positive economy. Thanks also to Steve Jobs for naming me the Psychic CEO, and all those who have mentored and inspired me, and for those in the future who beckon us all to our greatness. Thank you so much. Okay. Thank you. And it's Shalom.
Our next award is for Nithahaya Ramamurthy for Health 2.0 Conference and Excellence Healthcare Award. Lead of Digital Analytics at the Mayo Clinic, Nithya has 12-plus years of experience in healthcare and consumer behavior. Beyond this role, she is an active member, mentor, industry expert, and peer reviewer. She has devoted her career to using data skills to promote inclusive and equitable digital health products. Our next award is for VitaWelt Pharmacies Health 2.0 Conference Outstanding Organization Award. VitaWelt Pharmacies is a group of pharmacies that provide comprehensive pharmaceutical services and products. They are known for their wide range of medications, health and care products, expert advice, and the production of health special medicines. On behalf of this organization, we have Stefan Wall, the pharmacist, to receive the award.
So, thank you, Health 2.0. Is it right? I should set 2.0. Thank you for my family to come with me. It's a long way from Germany to Las Vegas. It was a long flight, but it was an impressive experience here. And now I think today in the evening and tomorrow we can gamble. Thank you very much.
The next award is for Upscript Health 2.0 Conference Outstanding Organization Award. Upscript Health is the direct-to-patient telehealth company providing new distribution channels for pharmaceutical and medical device brands. As a pioneer company, Upscript Health has helped patients access convenient health care and over 2 million prescriptions. On behalf of this organization, we have Peter, the founder and CEO, to receive the award.
Thank you. I'll just say a few words. If you're going to be here at roughly 4 o'clock today, I'm on a panel where we're going to talk about elevating the patient experience. Upscript provides a direct-to-patient solution based on telehealth. We do that by working with pharmaceutical manufacturers around the world. We've been in business for more than 20 years. We're actually probably involved with more than 100 major pharmaceutical companies at this point, developing various partnerships for how to deliver care. We'll talk more about it later this afternoon, but thank you very much. Thank you for this recognition.
All right, a huge round of applause for all of our honorees. Your work is transforming the future of healthcare, and we thank you for your dedication. Now it's time to refuel, recharge, and take this opportunity to meet industry peers, exchange ideas, and build lasting connections. Whether you're looking to discuss insights from this morning's panel or explore potential collaborations, this is your moment to do so. Also, a quick thank you to our silver sponsor, Centrifuge, Inc., for their support. Don't forget to visit the 2.0 conference exhibit booths to get a sneak peek at our exciting sessions that we have lined up for future events. And to learn more and secure your spot, speak with our representative from the 2.0 conferences. This is an opportunity you won't want to miss. Now, remember from this morning we mentioned that we have a little surprise. Well, we don't usually do this on day 3, but we know that you loved it so much that we brought it back. It is going to be networking hour this afternoon from 4:30 to 6 p.m., and that is your chance to connect, collaborate, and make the most of those final moments before we say goodbye. Whether you're here to spark new ideas, build lasting partnerships, or enjoy great company, this is the place to be. So don't miss out. Let's close the event the right way with energy, connections, and unforgettable conversations. We will reconvene back here at 1:30 sharp for our next session. Enjoy your lunch and use this time to network to the fullest. And remember to share your moments at the official hashtag Health2Conf while posting your pictures and stories online. See you back at 1:30. All right, I hope you guys enjoyed that lunch break. Now, before we move forward, let's take a moment to recognize outstanding leaders in the healthcare innovation. To help present some of these these awards, please help me welcome to the stage our presenter. We have Alan Krishna. Welcome him to the stage to help us present these awards. Alan is the president of Team Up Corp Inc., pioneered India's first customer loyalty program for Corona Limited. He has also contributed significantly through board service on multiple nonprofit organizations. His commitment is extended to his student years, where he has organized educational events. Thank you, Alan, for helping us present awards today. All right, our first award goes for Chaitanya Sharvana for Health 2.0 Conference Excellence in Healthcare Award. Chaitanya is the founder and CEO of Circle Health and is committed to transforming healthcare for the working population. A graduate of the prestigious IIM, Chaitanya has held leadership roles in strategy consulting at Booz and Company, and he has also led brand and digital initiatives at India's largest maternal hospital chain, Cloud9.
So thank you so much, sir, for the award. Really appreciate it. Thank you to Health 2.0 for the opportunity. I think it's great to be recognized on a global stage for all the work that you've done. Healthcare is extremely tough, so it's great to get some kind of a recognition after decades of effort that you put in. Hoping to participate in more such events, win more accolades, and keep doing more in the healthcare space. Thank you so much.
Our next award is for Mainaz Kazan Shadham for Health 2.0 Conference Excellence in Healthcare Award. Mazna is the chair of the advisory board of Viva Valet Inc., develops healthcare and technology solutions for the aging populations. As CEO of Housing and the Silicon Valley Salvation Army advisory board member, she demonstrates broad community involvement, certified in CCIM, CPM, and MRICS. She also holds a PhD in economy and industrial system modeling.
Thank you, everyone. Thank you, Health 2.0 and the conference. This has been extremely interesting for me, seeing so many different panelists, so many experts here working so hard together to bring in innovation into the health and businesses. At Viva Valet, we are bringing a new platform where we are actually encouraging services for the elderly. So I really look and encourage everyone to look us up. And we are great to be here, and thank you so much for my husband who's here. And I know everyone says this, that without our family, we will not be where we are, but this is a definite truth. Without the family, we're not where we are. So thank you so much, everyone.
All right, our next session is going to be an incredibly insightful subject. Be strong, don't cry, handle it yourself. These traditional messages have long defined masculinity, but they come with significant drawbacks. As men's mental health concerns continue to climb, the reluctance to seek help persists. Join us for a compelling panel discussion, Redefining Masculine Norms, Emotional Wellness in the 21st Century. Led by our esteemed moderator, Julie Smith, speaker, author, physiotherapist, and coach of Body Effects LLC, and our other distinguished panelists. Let's welcome them to the stage.
Hi, everyone. Thanks for joining us. I know we're here to talk about masculine norms, but I'm going to throw a little bit of a feminine norm at you. We like to talk, so I decided I'd be moderator so I get the mic all the time. We would like everyone to join in.
Actually, we didn't decide it. She decided.
It's true.
Let's
I did.
fix that from the go. She says we decided. If I remember correctly, she says I will be.
I'll moderate.
No comment. No comment.
We want to keep this light, keep it fun, and have everybody contribute equally. And we'd love it if you guys jump in with some conversations and questions as well. So I'll turn it over to Barry on the end over there to begin the introductions for the people on the panel.
Okay, thank you. Hi, my name is Barry Dow. I come from New York City. I was a school principal for 20 years in special education. I work with kids at risk. And I spent my life learning through experience what emotional intelligence is, and now have a company with my wife, Janet, and we are called Star Factor of New York City, Inc., and we work with principals and superintendents in the area of emotional intelligence.
Awesome. Dr. Paul?
My name is Dr. Paul Dyer. How you doing? I'm originally from New York. I'm a Bronx kid. I'm a Boogie Down guy.
I'm a Brooklyn guy.
Yeah, I won't hold that against you, being from Brooklyn. Okay, so anyway, so I'm a neuroscientist and a physicist, and so I study how the brain and the chemistry works together with our emotions. So I really consider myself just an emotional scientist, how I break it down from the cellular side to the biology side to the neural side, so and then all in between. So that's to simplify it.
Fantastic. My name's Julie Smith, and I've been a physiotherapist and body worker for almost 3 decades now. I mean, I pretend like I'm still 30, it's fine. I work with people to learn about their reaction to and relationship with change so that we can create a positive resilience so that they can be more productive and follow their purpose. And I have a close connection to this topic because I've been spending most of my career spending time creating space for men in particular to be vulnerable in a situation where they aren't usually allowed to do that.
Hello there, everyone. My name is DJ Ligori, and I am actually originally from New York as well. I'm from upstate Rochester, New York, and some people say that's not technically New York if you live in the city. Yeah, it's Canada. But I started a mentorship program for young men, and so we work with guys aged 17 to 25, and we call it the Be That Guy program, and so we focus on helping these young men manage their stress, build confidence, and develop healthier habits that are going to serve them for the rest of their lives. And I created this program kind of out of my own struggles. I was one of those guys, no pun intended, when I was in my early 20s who kind of needed some mentorship and some guidance. And through the right people and the right mentors, ended up meeting those individuals and kind of built this out of my own challenges and experiences. And I'm very blessed and honored to get to do this work and be let into these families' lives and these young men's lives to the capacity that I am. So thank you.
Hello, everybody. My name is Dr. Ezekiel Nelson, and I am not from New York.
Me neither.
I'm originally from Atlanta by way of Minnesota, and I live in North Carolina. And so I am a metaphysician, certified body worker, and the proud innovator of psychology and using transcending mind therapy to help men, women, children to be able to tap into their spiritual selves, spiritual lives, tap into their God selves to be able to help heal themselves as well as help heal others in the process. And so my belief is reflection is self-reflection, self-responsibility, self-awareness can help you to see the reflection in everybody else that is within you. So,
awesome. In our discussions, we all kind of were of the opinion that the title of this panel kind of incorporated 2 things, right? I feel like that was the gist of the conversation in our preparing for this panel. So just out of curiosity, I created the question of if you could rename the panel, what would it be? And mine would be, what is masculinity, yesterday, today, and tomorrow? So anybody want to chime in on what you would rename?
Yeah, so my idea was the new kind of toughness, and essentially leaning into it's okay for guys to talk about what they're thinking and feeling about, and vulnerability is this new strength. So let's redefine it as this new kind of toughness.
I want to go with even your program you do, and I've been teaching martial arts for like 50 years, right? And it's about, and Barry can attest this, it's the mentorship that I think masculinity is. I mean, you can never think that you are a positive. If we're going to look at it as even at a science point, masculinity meaning a positive, meaning that something's a negative. And I don't, in this, as a human, I don't know if there's any negative about us. We just need guidance, and I think that's where mentorship is. So, I mean, that's how I feel about it.
I feel in the sense that, like you said, was then and now, that we've come from a sense of masculinity where you had to be the tough guy, and then that's transitioned to where now you need to be the vulnerable guy. You know what I'm saying? So, but if we're redefining, my thought process is there is no norm. It's just be you. Understand who you are first, learn who you are, and then love yourself enough to walk into that. And that way you can be the person you are as a man.
That leads into our other question. Do you think that masculinity norm definitions need to be changed, and why? Either way.
Yeah, well, I don't know if, for me, masculinity was ever anything that I'm not now. But I learned early on that, my father passed when I was 9 years old, and I learned that it was okay to have feelings. It was the worst thing that ever happened. And I didn't downplay it, and my family was there, and actually the educators who came to my house to see me, really let me know that it was okay to not be happy, and so for me, masculinity was always about being empathic and about being emotional and about, caring and being kind, but I wrote one down just so I could have it. Modern masculinity, strength, empathy, and leadership in a changing world for this panel.
So it is also ethnicity plays a huge role in this, because so many black and brown men have a hard time asking for help. And it doesn't matter if I'm your friend, I am your cousin, I am even your brother, because I can't get my brother to talk to me. And he knows what I do. Right. So it's the scariest thing when I go to family functions and family relatives don't. It's not like I'm going to charge them on my auntie's couch. I'm just when I ask what's going on, I want to know, and I don't think people feel that safe place to fall into where they can release that negative masculinity. That's positive masculinity in good leadership. You will never get there until you're broken down into a complete restart to develop that.
One of the things that comes to mind when I think about masculinity is I think about the integration of both the hard and soft skills of life. And I think about the men in my life, my father, uncles, grandpas, coaches, teachers, who were, in my eyes, a masculine man. I've seen all of those men cry. Right? And at the same time, I've also seen all of those men be pretty intense at other times. And so it was this integration of, hey, I know when to tune this up, when I need to be this type of person, when I need to be that guy, right? And I also know what I need to do to maybe turn this back a little bit, right? And reading the room, understanding your environment. And so I think there's this awareness around these hard and soft skills when it comes to being a masculine man.
One thing also to consider is those young men that, whether we're really on any spectrum, them being raised by a single mother. Like for myself, I was raised by a single mother, so it was hard. You know, a single mother don't know how to necessarily tap into that masculine aspect to raise a man. You know what I'm saying? But they do their best, the best that they can, based on basically how they were raised and so forth. So it's good to have male mentors. You know, but if you don't have those, now you're fending for yourself. You know, and it's like, how can I? How am I supposed to act? You know, what am I supposed to do and say? And, you know, what is it to be a man in that aspect?
And kind of leapfrogging off of that, the societal norms that we have. I love the work that Brene Brown does around all of her philosophies on different styles. And her, kind of, this stems from her work. And, you know, the masculine expectation with society is very much you're the white knight on the horse, and you, it's pardon my language, and you always have to have your shit together, right? And if you fall off, we're like, get back up there and pretend you didn't fall off, hurry up. You know, and conversely, you know, the unreasonable feminine norm is do all, be all, and never let them see you sweat. Inevitably, no matter what age you are, you're gonna sweat.
Right.
And then they're like, oh, wipe that sweat off, hurry up, get back to it, right? Neither one of them are sustainable. And, you know, in the same vein, emotions, right? Men are encouraged to show two emotions, pride and anger, because both of those things are, you know, authoritative and great. Right. And women are encouraged to show everything else except pride and anger, because nobody likes an arrogant, angry woman, right?
Unless you're wearing the power shoes. Because if you,
I'm also not arrogant or angry.
If you wear your power shoes, you can do anything you want.
Right.
Guys too.
And she is wearing her power shoes.
You can walk on the moon.
You guys need to. Are you guys wearing your power shoes? You gotta wear your power shoes.
I'm a
guys.
natural barefooter, so I don't have power shoes.
You know, I just want to share that, you know, I grew up in Bensonhurst, Brooklyn, and this was a neighborhood that was controlled by the mob. And we learned two things, respect and, you know, and how to talk to people. You know, and I learned early on there was a pecking order. But I also learned that if you treat a man as a man, and we'll redefine that definition as we go along, you know, there's nothing to fear. It's all about, you know, treating people, you know, the way you'd like to be treated.
Exactly.
You know, with respect and care. You know, and concern, you know, people appreciated it. You know, I say, how you doing today, sir? You know, and, you know, I grew up there and I survived, and, you know, it's a lot different now, but, you know, that's my
Still
upbringing.
ran by the mob.
Yeah, different mob now.
It's that happy news, right? Did you hear about the guy that helped the lady across the street, as opposed to, you know, the guy that decided it was important to bomb something or whatever?
Yeah. And even being a man, like, I'm about to call you Pastor Paul. Dr. Paul had mentioned about, even in our culture, is like we have to be careful, because, you know, we have so many stressors that we're dealing with. You know, just to walk down the street just to have the color that we live in, and so forth. So if we try to be our true masculine selves, we're either labeled as an angry black man or a dangerous black man, you know what I'm saying, versus just, you know, just being in touch with ourselves. But if you do that, then you're a sissy. If you do anything other than that, then you're gay. So it's like, how do we be who we are? You know what I'm saying? That's the thing. We have to learn how to just understand that I am who I am. My godmother used to say, do not define me. You know what I'm saying? We like limitations. We like definitions, and we like caps and so forth. But she always say, to define me is to confine me. I shall not be confined. I am that I am. You know what I'm saying? So when we just live in the mind space that we are who we are, then we can be what we are. You know, and male or female, yeah, that's the gender. But to be a man, what is that? What is normal? You know what I'm saying?
Well, and is being a man masculine, or is it okay? Because we're talking about masculine norms, right? What about women that have masculine norms? Because we all have both, right? And so what does that look like?
It's balance.
It's what it looks like for women being raised by a single mother. She was able to show me both delicately that means I did get my butt whooped.
Plenty of times.
And she did nurture me. So what she had to portray out there was her masculine self because of, maybe it was the 70s, 60s, whatever the time, but I don't think it's changed. So she taught me that you have to be who you are and navigate through those myriad of factors and still be who you are. So when people are unnerved because of proximity of my height, my color, my size, whatever it may be, like Barry said, I'm going to show you that respect that you don't even know that you're giving me negative vibes. So then, once I'm able to release that, and I'm okay with it, then they are okay with it. And that's how it goes, instead of let me just, because it's not just killing them with kindness, it's killing them with the acceptance that they may find you offensive.
Opening the dialogue and creating that mutual respect.
I got one thing just to piggyback off of what Paul was saying, how I actually have a story to kind of exemplify this, but I'll try to make it simple. It's kind of like, do you want people to fall in love with the idea of you, or do you want people to fall in love with you? Right? Like, you can create this facade, and I think social media makes this very, very easy to do. But long story short, I played college football, and I was voted the captain of my college football team. And I would talk to the guys before each game, and I got emotional talking to 180 college football players before running onto the field. It's the last thing I wanted to do. And in the moment, I felt weak. I felt soft, felt all those nasty things running through my head, and I did it every time, and I just cared about these guys a lot. Last game, I decided to apologize to the team before we went onto the field, and about a third of the guys walked up to me, and they said, "Don't ever apologize for that." They said, "That's why we voted you into that role." They said, "We saw that you cared, we saw who you really were, and that made us better men." Right there, I realized that the vulnerability is that price of trust, right? I'm gonna show you who I am, even if it doesn't look that good in the moment, yet maybe you'll respect me because of it, and we won a lot of football games because of that, right? So
it gave them permission to be vulnerable themselves.
It did, right? And they told me a lot about that. It's still to this day, I still sometimes talk to those guys, and they're like, "Dude, I'm way more vulnerable now because of like you crying in front of us." I was like, "Thanks, guys. Like, I really appreciate that." I was, in the moment, that was really hard.
It's powerful.
Yeah.
Keep bringing it up. Keep bringing it up.
Rub salt in that.
I was like, I need that, guys. I'm still working through that.
I would think that kind of moving forward, and you guys have all touched on this, asking for help. Nobody likes to ask for help. It doesn't feel good. But looking at it from the other perspective, are you happy to help somebody when they ask you? Yeah. And you're taking that power from somebody else if you're not asking for help. So I would like to see that be part of the norm. And the expressing of all the emotions, good and bad. It's okay to be angry. It's also okay to cry. It's okay to belly laugh out loud, too, right? I mean, all of those things are fine, and I would like to see that be normal.
I don't think people at the CXO, I don't think they laugh that loud.
I hope they do.
Do you
They
think
should
so?
be. I don't know. I was in a few panels that people were laughing pretty good. That was part of my mission here. It's like, this is a serious subject, and it can be really conflicting, and it's a difficult identity finding, and it's a little bit like my perspective of pain. It's a serious topic, but we don't have to be serious about it.
Right.
Lighten
We can
up.
always have laughter.
Let's give people the space that they need to figure out what's best for them.
So the wellness question. Go ahead, Barry.
No, I was just going to say that, I led a school of 250 staff and 500 special needs students, and it was okay to be strong when I had to be strong. It was a matter of life and death for some people and some families, and I had to tell the truth. But you can tell the truth in a way that doesn't kill somebody.
Right.
That just gracefully doing so, but
Yes.
you needed to be strong, and that's an important piece of that.
People want you to lead.
Yeah, and people can tell when you're telling the truth from caring versus trying to insult them as well.
Or talking from ego.
Yes.
I think that's what DJ's talking about. Sometimes people need people to lead, right? And good mentorship knows not how to do a power over system, but a collaborative system where it builds you so you can lead others. You know, that's, you know, being in the military, the one thing that we do well is that we build leaders. We build leaders to lead, and that is to build other leaders. No matter how small or how large, it's to build a team of leaders.
Don't need more followers.
Right.
Well, and those masculine, like societally perceived masculine traits of strength and leadership and authoritarianism, when it's required, are those masculine traits that are important to have in leadership. And it's important for women in leadership to have those traits too.
Yes, yes.
And when we label things as, you know, crybaby or masculine or feminine or good or bad or whatever, we run into problems.
Exactly.
Well, we feel segregated.
Yeah, 100%.
Feel weird, feel broken.
Yeah. So I'm going to go into a question. Actually, this kind of came from the conversation I had with DJ. And thinking about those labels, and this is sort of a leading question a little bit. So what does it mean to be a good man now and in the future?
That's laughable.
Let me poke the bear.
So I would say that I think being a good man is...
Being that man?
Being that man is having a good heart and having a good brain. I think, and I said earlier about like that integration of the soft skills and the hard skills. Me and my business partner, we say this funny thing, like it's like no one to hug, no one to punch. Now, I'm not condoning violence, obviously, with that, but
sometimes a good punch is
sometimes
good,
a punch
even if
works,
it's a pillow.
right? But it's essentially like my goal is to lead, right? We want to build more leaders, and that doesn't mean that I'm going to completely destroy someone if I'm trying to help them get to point A to point B. Maybe it's, hey, maybe I just need to sit with this person, right? Maybe there's something that I just don't see, and they just need to verbalize this to me, and so maybe I need to lean a little bit more into that softer heart skill. And then there might be a time where it's like, hey, we need to grab the face mask a little bit. We got to really kind of, you know, jack this guy up a little bit, whatever it might be. But I think it's recognizing what is the more valuable behavior in that moment that's going to help that person get from point A to point B, right? Because our goal is results, right? Our goals are progress, right? So I think that's what a good man is today.
When I was mentoring a young man, and we had gotten into not an argument, but he was kind of going through some things. And I was trying to calm him down. He was just, and to a point I was like, well, look, why do you even listen to me? What's the point of you listening to me? If you're not going to listen to me now, why do you listen to me? He said, because Mr. Z, they call me Mr. Z. He said, because Mr. Z, you do what you say you're going to do. You never lied to me. And whenever I ask you to do something, whenever you say you're going to do it, you do it. That's why I listen. That's why I believe in you. And I was like, I almost cried after that. I was like, oh my God.
You know, crying's okay.
Right?
Then shove him into the side of the ice.
Right. So, you know, children or young people or people, period, they're looking to see that you're a man of your word, that you're going to do what you say you're going to do. Those leaders, they want to make sure that if you're going to tell me or try to lead me somewhere, what are you doing first?
Integrity, practice what you preach.
Exactly.
So for me, the good and bad, those terms, I feel like take us back in, 40 years ago, where you had to be a good man, whatever that means. And if you weren't a good man, you were a bad man, and you were probably in the slammer or picking fights, or people would move to the other side of the street if you were going that way. Mm-hmm. And I think those terms are antiquated. And if we talk about that, the moving forward, those goods and bads, I think we need to be talking about well-rounded and well-adjusted, and the combination of those two things, and
I just want to
even
piggyback
vulnerable.
on that one. Yeah, it's like there's a theory called the great man theory. Mm-hmm. Were you born to be a leader, or can a leader be developed? Mm-hmm. And I believe that leadership can be developed. And one of the things I gave myself to do was use whatever personal power and then position power I had to make people's lives better. You know, to me, that's what being a good man is, making connections with people, seeing things in people that they don't see in themselves yet, you know, and building that, you know. And when I left my position, it was filled effortlessly by succession, you know, and then that's what is continuing. It's a legacy of leaders that we develop together.
Filled by in a position of a human with integrity, male or female.
And I think that's where I was going to go. To be a good man means, you know, I look at it in like 5 different levels, and that's spiritual, physical, mental, and emotional, right? And if we can just learn our pros and our cons on all of those different categories, and know where we're weak, and know what, you know, how we're going to balance it as a human being. Because if we're not balanced, that means we're going to fall to the lack of our training, right? And if you fall to the lack of your training, then nothing will ever be balanced, right? The equation will always be off. And that's not going to lead you to where you would like to go with your heart and your mind, because you can never get there, and you're not going to never know why. And that kind of goes with our wellness issue.
And that's, you know, perspective, right? What you think it means to be a good man in yourself might not be what Barry thinks it is for you to be a good man.
And he's from
or
Brooklyn.
Me. And he's from Brooklyn,
Right.
so but watch
So-
out.
And I still like him.
Upstate's gonna chime in though.
Yeah, I'm trying to slide down to the city.
I mean, we're 50-50 in population. So I was having a conversation with somebody about what you guys think it means to be a good man or you know, a man with integrity. Might not be what the woman counterpart sitting next to you or across from you in your office or in your relationship thinks. That's
And again,
what that
it's still
means.
culturally different.
100%.
Right? It is still so culturally different, and it's tough to even imagine that it could never not be.
Breaking down societal expectations.
Right, but there's one common denominator, and it's called Iwa Pele, which means good character.
Good character.
Good character all the way around. So you live the morals, you have those standards that are uplifting, that's positive, that is, you know, spiritually inclined and in line with the divinity. All that is going to come into balance. It's going to come to where you're going to be able to treat others like you treat yourself, if you treat yourself right.
Everybody on this panel does amazing work to incorporate that physical, mental, emotional, spiritual all together. And by educating other people to incorporate all of those things in their work and empowering your leaders to incorporate those things and in how they lead, and really bringing that conversation to the forefront, I think will help us change these societal expectations that are unreasonable for everyone. So I'd like to open it up for people in the audience. You guys are chuckling along with us, and I'd like to hear your perspectives too, please. So please heckle or ask questions, and anybody on the panel is happy to answer.
Yes, you with the funny hat.
Do we have a mic back there? Oh no, it's in the beginning, in the middle of the room. Sorry.
Stationary.
Come on up here, man. Come on.
Regardless of the belief in relation with the divine being, God Elohim, He created us in His image. So we cannot blame who we are today, or either you're born a male or a female. It was not our decision. We open our eyes, we saw phony people, faces, and the society told us, this is how you have to live. It was not our choice. So what we control is our behavior, with our relationship with one another. The golden rule, you treat others the way you would like to be treated. simple.
Not so simple.
Not simple. It is our ego that make it difficult. That's why it's simple.
Correct.
I'd like to take,
Or your power shoes.
I'd like to take a challenge on 2 words you said, and it was about blame, which if you could think of blaming anything, no matter what, you're already putting yourself into a negative state. So your frequencies are all jacked up.
Right.
And then if you are going to control, I don't like the word control. I use the word more understanding. Because the more information, the more you understand, the more you can apply. Now, if you want to control something, that means you're done with your understanding or done with your learning, and now you're going to use the power over system because that's where your stomping in your feet comes in. So that's the only 2 words I want to add.
I think to pivot off of that, when we ask for help, it almost feels like you're giving someone else control.
Right.
And so maybe instead of asking for help in our moving forward, we ask for guidance instead.
Because some people feel that I don't need your help, but they need guidance.
I do need your guidance.
Or you need my help rather than...
He still has one more.
That's okay. You guys are the
Carry on.
So, carry on. So, this is something I wanted to say that's very important. But I think that a lot of people here maybe may know it, but waiting to the end. Please don't judge me. Waiting to the end. Jesus Christ say, man, love your woman. And he said to the woman, respect your husband. Now, the thing that people don't comprehend, maybe in their subconsciousness, is this. In order to love someone with no lie within your heart, you have to respect them first. A true love has to go with respect first. In order for you to respect a person, you have to have love for the person first. So all of those 2 words go in pair. So in a society, when you say to a woman, respect your husband, you have that. You have to. The husband will respect you first before he can love you. If a person don't respect you and just talk about love, it's fake. So I'll go by the God of heaven who created all and say, why does he say those 2 words like that? There's something that we are missing. You can't love a person if you don't have respect for that person initially. Coming back to masculinity, that's how you can apply it into your household, in a relationship between people. Now, that we should not judge, we should listen, we should try to comprehend, open our subconsciousness, our spiritual mind, to connect with our natural mind, so that we can be in synchronization with one another in society, living in peace, by treating other people the way that we would like to be treated. That's the way that I believe masculinity is supposed to be synchronizing with femininity.
We're going to have to cut you and let someone else.
No, it's okay.
Yeah, go ahead.
I'm good.
Come on.
In that same vein, if you respect yourself,
Yeah.
then you love yourself
Then you
as
love
well.
yourself.
Please.
Please.
Thank you.
Thank you.
Thank you.
True words.
My question is for DJ. With your company and what you do, the fact that you're working with young men, I think is absolutely amazing. But I'd be curious to know what your process is like, because working with young people, there's obviously a parental role within that. So it's great that you're able to mentor one-to-one with the boys. But how are you also being able to coach the parents so that they're able to provide that support to them as well?
Beautiful question.
Great question.
Thank you.
So, and I've been learning a lot about this over the last couple of months, and one of the things I've realized is that my biggest influence in my life was my father and my parents, and I think a lot of what I define as a good man was just the influence that I got from my father and grandpa and uncle and things like that. And so what I've realized is that a lot of the parents who want their sons to do this type of work, they also have to kind of look inward themselves, right? And so Paul was talking about, right, I use this saying, blame equals pain. So wherever I point the finger, I give the power, right? So if I can point the finger at myself and say, all right, how do I need to change to essentially help my son, right? So one of the things we do is we have like a guide that I give to all the parents for free, and I'm like, here's exactly what I'm going to do with your son. You can do this too with them. Now, hearing it from a parent where maybe the mom's voice has gone numb on the son's ears might be different than hearing it from me, a 29-year-old guy who's been there. Right?
You're 29?
I'm 29, yeah. Almost 30.
Me too.
So I think one of the things that we've considered is almost having like a joint program where you have parents go through, and typically it's single moms. That's honestly, over the last month, I've had 15 conversations, and it's been the exact same conversation every single time. It's a single mom who wants their son to have a positive male role model in their life, and they didn't have one growing up. And so the mother says, I can be my son's mother, but I can't be his father. Right? So we've thought about like, how can we actually support the mom and the son? And so we have some ideas that you actually helped me see this weekend, which I think is actually really profound, because it takes a village, right? Like, it's not, I'm not gonna, not gonna miraculously fix your son in a day, and then he goes home and right, he goes home and there's chips and soda still in the fridge, and now his diet's all crushed, right?
Before we get cut off here, because I see someone getting ready with the big hatchet thing like they used to do in the Gong Show, right? I know she's got the hook and everything coming. When you said it takes a village, in this conference, no matter who you meet and whose handshake you meet, that should be your village. Because you have resources within this room and in this building and in these conferences that you don't have to reach for all that much. Where it's like, hey, either I saw you at the conference, and can you help me with ... So do everything you can to create your village so you can help a village. Because you don't have to know everything, but every parent also needs mentoring. Communities need mentoring.
Guidance, right? Back to the guidance piece instead of helping, right? Awesome. Well, thanks, everyone. Do we have one more? Great.
Yeah, I'll be real quick. I want to know, because there are several women in this room. So as men work their way to redefining what their masculinity is, how can we as women help you with that?
That's for you.
Woohoo.
That's for me.
No, or for men.
Well, I'll speak for myself, you know. I waited till I was 2 days shy of 50 to get married for the first time. And that's my wife, Janet Patty, over there. And
hey, Patty.
I married her because I respected her, and then I loved her, you know. And then basically, she keeps me in line, you know. I'm very emotional. I've brought out the best in her. She brings out the best in me because she's not afraid to tell me the truth. And I think that's the most important thing. Don't be afraid to tell the truth. I may bark, but she can bark back, and then it's over.
Is she from Brooklyn, too?
Sure. She's from Staten Island.
Oh, boy.
I understand.
We can see where the bodies are buried.
Now.
That truthful communication, and for me, it's really taking time to listen when they fall off the horse, to find out what happened. Did the stirrup break, or do they need a second to get a drink? What is their actual need, and taking the time to sit and listen first before attempting to help or attempting to make a difference or putting them back up on the horse.
I would just say listen.
I agree with that.
I would just say listen.
Mm-hmm. Yeah, that's my biggest thing.
Because I know I got a lot of pain and hurt me.
Mm-hmm.
So.
Yeah. That's the biggest thing, is listening.
Making the space.
Yeah, just having that space. Exactly.
Yeah.
Exactly.
Yes.
There is.
Okay, here she comes. And you're
Here
going to
she
get
comes.
kicked first.
Thanks, everyone.
Thank you guys so much.
We're like, thank you, everyone.
All right, thank you so much for that panel. It is almost time for that extra networking happy hour from 4 to 6, but not quite yet. First, we have a crucial discussion. Let's take this conversation beyond individual well-being and explore how we can catalyze societal transformation for mental health on a larger scale. Mental health awareness has never been higher, yet many still struggle to access care. overcome stigma, or find support that goes beyond therapy sessions? What if improving well-being wasn't just about individual healing, but about reshaping society as a whole? In this next conversation, Beyond Therapy, Catalyzing Societal Transformation for Overall Well-Being, we shift the focus from personal treatment to community-driven solutions, policy changes, and cultural shifts that can create a more supportive and mentally healthy world. How do we make well-being a collective responsibility and not just an individual pursuit? Well, bringing fresh insights into this discussion, let's welcome our next panelist and our moderator, Sandeep Nath, the founder of renewalism.com. Give them a round of applause.
Thank you so much for that background about Beyond Therapy, Catalyzing Social Transformation for Overall Well-Being. It's a very interesting, important topic, and I'm joined by a wonderful group of people. Let me just give you their names as we start. Olga Shibanova from Slovakia, Christoph Raos from the Philippines, Chitra Sabesan, now in the US, Paya Wu from Laos.
Oh, I'm from Minneapolis. It snowed. I'm glad to be here.
All right. And I'm Sandeep Nath. And how we're going to conduct this is we'd like to have participation from the audience. So if you feel like interjecting at any point, feel free to just raise your hand, and we welcome that. But otherwise, we're just going to start with a few questions. And I'm going to start with the first one for Olga. And I think it's a logical question to get started on this subject because, Olga, the question to you is, first, let me introduce Olga in a little more detail here. You know, Olga is a healthcare visionary dedicated to promoting health equality through digital transformation and personalized healthcare innovations. As a co-CEO of AI Dental, see, AI and dental come in the same sequence. She leads efforts to revolutionize dental education with AI-driven solutions. Olga spearheaded initiatives like Health Clip, empowering patients to digitize and manage medical documentation, reflecting the European health data space philosophy. With a diverse background in law, global health project management, and digital innovation, she brings a holistic perspective to European health systems. Her experience spans leadership roles in startups, UN, and NGOs, as well as shaping digital health policies in multinational companies. Olga is also a coach and has taught entrepreneurial leadership. So that's a wide spectrum of stuff. What impressed me most was AI and dental coming together. God. So Olga, what comes first? Building a mature society and then a system for it, or motivating society to mature by providing the system that makes a mature society? Let's get you on that. Thank you.
Yeah, I hope we digested the question indeed. But basically, when I was thinking about this panel and what it means to me, and while we are discussing the innovative policies or how we want to change the healthcare systems and what we are doing for that, because obviously a lot of us are doing a lot of things on different spectrums, how to reshape the current healthcare system globally. I was thinking whether the society is ready for this change, meaning that we can bring very amazing policies. We can create very good innovative solutions to the healthcare processes, to clinicians or to patients themselves and so on. But then the question stands still, once we do it and once we implement it, whether people are actually ready for that, whether they're going to use it and whether it's going to bring the impact, which leads us to the question or to the thought process, what we can do to enable society to mature or to raise in order to accept those changes and to understand that that's for our human benefit. Because no wonder I'm also a founder of Philosophy Club. So that's also where it comes from. But I was thinking that we as human beings, we evolve also as a society like a child, right? We have some early stages of our development, then we get into teenage ages, then we get more mature, and so on and so on. So where are we as the society? Are we ready already to take full responsibility for our health and for our lives, and then to actually utilize the innovative systems, policies, and innovations into our daily life? So I don't have the answer on this question. I can philosophize all day on that, but I just wanted to open maybe also with that philosophy touch point a bit.
Would anybody in the audience like to offer any thoughts on this? Chicken or the egg? Please.
Well, thank you very much, actually, for having this topic. Mental health and well-being definitely is very well related, right? And I was discussing with my group colleagues before lunch how we view mental health and how we view exactly that approach. As you said, it is very difficult. Is people ready? People is ready if we present it the right way. Right? I understand that all we've gotten as a society, it is exactly that view. If I have a mental health issue, I'm not okay. And what do we picture? Somebody throwing rocks, somebody hitting somebody on the street, right? So the mentality has been presented, though, by the movies, by the Hollywood, by the social media, right? What do we see in a movie? We see exactly a psychotherapist sitting there and scraping on his notebook, right? And asking the same question over and over. How do you feel? How does that make you feel? Well, personally, I have gone through depression, and when I sat on the other side, I felt like nobody's listening, nobody freaking cares. You know, and the whole point is that I'm here because I need you, right? And us individuals, if we do present that, if we correct that, it's not actually a philosophy. It is human behavior. How we accept things, it's for what they're presented to us. If it's simplified, that it is okay. Mental health, it means your body, your soul, your mood, everything is together. That's what mental is, right?
Yeah.
So
Thank you.
it is, thank you very much, guys, really, for bringing this topic up, and I hope that this conversation will get farther and we can have more discussions about it, because it's an amazing topic.
Awesome. Unfortunately, we have only 45 minutes on this panel, but we'll keep taking that up. Olga, I'd like you to roll it forward.
Thank you. So I'm going to introduce the Dr. Christopher Rose, who is the licensed mental health counselor in Washington State and founder of Evolve Care Counseling, dedicated to helping individuals, children, and families heal and thrive. With a PhD in psychology and certifications in trauma and neurodivergence, sorry, he specializes in ADHD, emotional regulation, autism, anxiety, depression, and PTSD. Dr. Rose integrates CBT, mindfulness, EMDR, hypnotherapy, and VR therapy to help clients unlock their full potential. His approach fosters deep healing by combining innovative, evidence-based techniques with a safe, empowering space for transformation. He's passionate about mental health advocacy, and he works to expand access to care and destigmatize therapy. Yep. So I have, yes, that's, well, you do a lot of work, and I have the first question for you.
Yes.
So with the rapid advancements in AI and technology, what innovative solutions do you think will be essential for supporting others in the future?
Thank you for the question. Seeing how we're advancing so much with AI, we can incorporate so much information, even with the information that we get from different type of smartwatches. What's that ring that people are using, Aura? You can incorporate so much data from that, and so going from there, we can adapt gamification. because a lot of things that I have been seeing within my own practice is the current generation, well, they kind of lack resilience. They lack follow through with a lot of different things. And so it's developing the positive habits that you can go through gamification, where you encourage more engagement, self-improvement, and built into all this is progress tracking. Now, we have really great programs right now. Habitica is a great one. There is another one called Breezer, which is a weight loss program. Follows through with the same kind of gaming mechanics that you would see, and it takes all the information that you do from working out in a day and give you points, and you can spend it within the game itself. Incorporating different other stuff of biofeedback, we're doing so much better, making things more affordable, like with neurobiofeedback devices like Flow Time. You can learn different ways of how to get into different meditative states. You can see different wavelengths of looking from alpha, beta, theta, gamma, delta, and learning how to master those states. And then incorporating a lot of this other stuff too is we're going into the stage in our evolution where we're incorporating so much other technologies that we can take advantage of. VR therapy. A lot of the things that well, actually I have at my own private practice is helping kids that already have a hard time engaging others and then providing the virtual environment to engage other individuals. And what's really great about that, because the current platform I'm using right now is XR Health, and it actually comes up with cues of how to address certain situations, even bullying. That seems to be a prevalent issue that we have right now. And then later on, as we develop, looking at how we can adapt augmented reality. So we've been seeing a lot of stuff on Facebook ads. I've been seeing these different variations of sunglasses that have like little pop-up screens when you look through it. And it's really interesting of how far we can take that to the next level. So a lot of times, even with all the technology and advancements, I kind of want to bring it back to different forms of like mindfulness, self-regulation, emotional regulation skills, developing a higher sense of resilience in our society that throws obstacles in us, and then pushing through. So.
Thank you.
No problem.
Will you roll it forward?
I'll move forward, okay. I'm introducing Chitra Sabbesan. Chitra is a Canadian and British-trained healthcare leader, principal consultant, and CEO of CS Care Solutions. She also serves as Director of Quality and Chief Privacy Officer. With over 25 years of senior administrative experience spanning Canada, Qatar, Brazil, and China, she has led transformative initiatives across the health and academic health science sectors. Chitra is passionate about building bridges, collaborating with healthcare partners to improve care transitions for vulnerable populations and nurturing minds, advancing inclusive teaching and learning for the next generation for healthcare leaders. She has served as an executive board director for multiple organizations, is an accreditation surveyor, and a published author in respiratory therapy practices. She also writes and illustrates children's books focused on themes of bravery, self-advocacy, and maximizing potential for children with mobility, breathing, and communication challenges. Very impressive. So my question for you, what are the gaps in traditional healthcare and how have you overcome it?
Thank you so much for that question. There are so many challenges, right, in healthcare. My last position prior to me moving on to taking on the Director of Quality and Chief Privacy Officer, I was actually a clinical director for one of the largest regional hospitals, overseeing a pediatric psychiatric ward. I also had the emergency department. I also had a foot in the community for one of the community organizations that provided services for clients with mental health conditions. So one of the things that kept keeping me up at night is how many patients came through Emerge and they waited and waited for services. Some of them turned around. It was a regional hospital. And the wait list just became so huge, particularly for things like eating disorders, because there's always an underlying mental health issue for a lot of these children, but not addressed. So one of the things I did was really reflecting and talking to people, particularly in primary care and in community care, to see what their experiences have been. Because when we talk about well-being, well-being does not begin at the hospital. It's there to treat people when there is a crisis. Well-being is initiated in the community, at home. So what can we do to sort of strengthen that? Strengthen the capacity within our sort of community agencies, and plus, within the family circle. What are some of the things? We are never treating a child. We're actually treating and providing services for the whole family so that they're all doing the same thing. The goal is the same, that sort of a thing. So one of the things I did was actually, when I found out that healthcare is so reactive, certainly not preventative, there's so many fragmented sort of care processes with poor outcomes and barriers, particularly for underrepresented groups. Where are they? Don't tell me that they don't need mental health services. Where are they? If not, if anything, it's more prevalent amongst those groups. So those upstream efforts is what I'm talking about, that prevention. So one of the things I did was actually I put together a think tank and brought a lot of the community organizations together across different territories that supply patients or refer the patients to the hospital. Some of them even say, we don't have capacity, just drop by the emergency department of the hospital, they'll take you in. When that child or that youth or that teenager doesn't need that level of service. So through partnership, we actually proposed a model, a business model, and got funding to actually create a pathway from the hospital's outpatient unit for particularly, we started with eating disorders. Particularly with COVID-19, the prevalence of eating disorders went up. And it's mostly girls, but we were also starting to see boys being involved in that eating. And there's several layers of complexity when it came to eating disorders. So creating a pathway from the hospital to the community where there was a triage option. Some children had to be treated in the hospital because there were many underlying psychiatric conditions. However, there were many others who don't belong in the hospital setting, but the treatment could be provided in the community setting. So that care pathway has been created, streamlined, lots of PDSA cycles to ensure that, we are meeting the needs of people. One of the most important things in my work is to bring in the lived experience voices to the table. What's going well? What are your experiences for those who are receiving the services? And what can we do better? So 3 years later, it's still going strongly. We have a little home. It's set up like a home for the eating disorders. So really happy about that. And the other piece, the second sort of tier to this, is patients who come through Emerge. But how can we immediately provide that de-escalation, which is what they need, provide the families the top maybe 3 things that they need to know if this were to recur, and then send them home with an appointment in their hand. So in 72 hours, and less than 72 hours, somebody will call you because the appointment has been made, so that they are now set up in the community to strengthen. So well-being actually starts in the community. We need to push it back there, build the capacity within the community, because that's where it needs to be.
Beautiful.
Over to. Thank you. Okay. So I have the great privilege to introduce Paiyavu She is the founder of Your Own Pathway. She's a social worker by background, turned psychotherapist, and has now transitioned to empowerment life coaching, organizational leadership consultant, and embracing the life of being a content creator by hosting a podcast called Owning It and YouTube channel Your Own Pathway. Her intention is to help individuals, people, and organizations forge their own path by helping them rebuild their foundations that align with their values, ethics, and beliefs so they can proudly own it. Wonderful.
Thank you. I never thought that I would be saying hit the like and subscribe button, never in a million years, because I had a real job, and being a YouTuber is not a real job, but now I have that job, so it's a real job now.
It's an amazing thing that you're doing. I do have a question for you. Yeah. And it goes like this. What are some of the barriers that may, in your experience, that may have prevented someone from forging their own path? Through your, everyone that you've seen in your own experience, what are maybe some of the top 3, 4 reasons?
Yeah, so you're a psychotherapist, and I'm a psychotherapist, and like a typical psychotherapist, we go all the way back into your childhood. And so I would ask, how many of you are doing jobs that you said that you were going to do at 5 years old? Like, are you that astronaut? Are you that brain surgeon? Whatever, or, whatever job. How many of you are doing the job that you said that you would be doing at 5 years old right now? Raise your hand. Okay, nobody is. And why? Okay, one person. And what did you say that you were going to be at 5 years old?
I wanted to be in the medical field. I wanted to be like my mom, a nurse.
Oh, okay, so congratulations. And so so you're a nurse. You said you were going to be a nurse. And yet why, a lot of us didn't raise our hands because I think we had a lot of hopes and dreams. And then as we grew older and older, and so you could be whatever you want. What's your name? Loretta? You could be whatever you want, Loretta. And then you're like, yeah, I could be whatever you want. And then you hit middle school and high school, and your parents and your teachers and your coaches kind of say, maybe that's not the thing for you. It's like, I want to do this though, but it's like, no, that's not really your talent. That's not really your strong suit. So I really think you should try something. Your writing's not that great. You're creative, but it's not that great. And so people tell us that we don't have it. And so when we don't have it, we have to come up with a second, third, fourth plan. And then once you hit 18, 19, 20, real life hits. You have to adult. And when you're adulting, it's really hard, and you have to face reality. And everybody says, that's a nice dream to do art, but let's come back to reality, because art doesn't make money. Being an artist is, you're a poor artist. You're poor. You're not going to get anywhere. And so we have these thoughts, we have these ideas, and then we push away our dreams, our hopes. We push away that 5-year-old inner child that we had. And so we live in reality. And so because we live in reality, we have bills to pay. We have status quos that we have to meet. We have to check boxes. We create a life that makes other people comfortable. We're not living our true self because our true self makes other people uncomfortable. And so you go through life, kind of lost, and you're wondering, who am I? But you're so tired, you're so, you're in overdrive, you don't have time to do anything, and then you let go of all those dreams and hopes, and you're checking the boxes that society tells us to. You got to fit in certain boxes because that's how they do data. And so if you don't fit in those boxes, people get mad. I think about that line. In school, how you're all supposed to line up. And when you don't line up, one kid yells and tells the teacher, it's like, oh, she's out of line. And you get in trouble because you dare be out of line, because you're not in line with everybody else. And so that's what happens when you grow up. Everybody wants you to be in line. Everybody wants you to be in data, so that's easy to count you. And so you start to let go of those hopes, those dreams, and then you lose yourself. And then when I ask my clients, who are you? They're like, I don't know. I'm a mom, I'm a lawyer, I'm a son. I'm like, those are roles, but who are you as a person? And that's such an easy and hard question. And they have this like crisis, like, I don't know who I am. And so society kind of forces us to let go of our dreams. And it's finding that inner child again of who you are. So that's it.
You can pass it forward.
Yes, I'll pass it forward here. And so I have the honor of introducing Sandeep Nath, who is a globally recognized thought leader, speaker, and coach, acclaimed for his work in bridging consciousness and commerce. A four-time author, his book Renewal has inspired the renewalism movement, a transformative initiative helping enterprises build conscious cultures that drive sustainable and profitable growth, recognizing consciousness as the principal agent for societal transformation and overall well-being. Sandeep partners with mid-sized health institutions and hospitals to integrate energy-led practices for patient care and workplace well-being. A member of various boards, mindfulness and Qigong expert and international Reiki master, Sandeep has taken renewalism habits to more than 46 cities across 4 continents. So very impressive. So first question for you is, as a Qigong expert, Sandeep, how do you see this practice as a catalyst in bringing societal transformation and well-being?
Thank you. I'm going to start with what is Qigong, because in any audience that I speak to, less than 1% people have come across this word before. And I had come across it myself till I went to the Himalayas and learned from Tibetan lamas, a practice that's about 5,000 years old, which brings the body, the mind, and the spirit in alignment. And Qi is the life force energy, the spirit, and Gang is to work with. So Qigong is basically working with energy. And in this forum where we're talking about social transformation, and that's the important thing, I want to draw your attention to something you could Google up later. There was, in the 90s, a hospital in China which was completely based on Qigong practices. And they did every kind of procedure with 95% and above success rate, with no surgical interventions, with no medication. It was called the Medicineless Hospital, and the key word to search up Medicineless Hospital would be Hun Yuan, Hunyuan. So the Hun Yuan Medicineless Hospital finally ran into political problems and had to shut down sometime around 2002. But reviving that sort of a practice in society is what the potential of ancient Oriental wisdom is all about. And reviving those practices, renewing our society, the way we live and work with that kind of wisdom is certainly going to take us far. It's something that is prevalent in the eastern side. You have parks in Singapore, in Malaysia, of course in China. You have hospitals, traditional hospitals practicing Western medicine, who are also doing Qigong practices. You're talking about communities. So, you know, making a community practice of working Qigong for about 20 minutes a day gets the whole community in a different kind of a relationship. And when we experience such stuff ourselves and experience how we don't need to see a doctor anymore. I haven't seen a doctor in 20 years for an ailment. That's when it becomes part of our belief system and breaks that conditioning that keeps us where we ought to be or whatever. So bringing Qigong into mainstream is going to result in huge societal transformation. And another aspect of this is that about 8 times out of 10, the reason we visit doctors is something induced by stress, directly or indirectly. And stress by itself comes when the body, the mind, and the spirit are not aligned. You know, what the body wants to do something, and the mind is saying something different. And that's when you're stressed. Do I do it? Do I not do it? Did I do right? all that worries and anxieties and all that come in. And then that manifests as something physical, and then you pop in a tablet. But if your body, mind, spirit are aligned with a daily Qigong habit, and no more stress. So that's kind of where I believe that would go. And I see that we're short of time. So Olga, if you'd like to post the next question to Christoph and keep it to less than 2 minutes, that'll be great.
Definitely, I'm happy to. So the next question will be, how can we empower individuals to take ownership of their mental health and well-being to drive meaningful societal change?
Well, behest of everything else, I think, well, also from personal experience and helping other clients along their journeys in life, seeking, it's more like how we conceptualize of how to get help, right? It's destigmatizing of how we see mental health and seeing that seeking help is not a weakness. It's like having to promote a culture, helping creating better policies that helps individuals want to go out and become better. Providing better education about like how we deal with mental health. I mean, we do pretty good in America introducing a lot of coping strategies. I see a lot of kids that come into my practice, and they have a lot of foundational skills with mindfulness and training, but it's not practiced a lot because it's not cool. So, like, we have to do a different stance of how to approach this as a society that builds a positive net worth for everyone else. So it's like, I'm a big fan of Qigong, mindfulness training. I'm a huge martial artist fan. All these parts that we have in our society, we have access. But if we can get like a larger stage of trying to get more influencers to promote these a lot better, going from the social media aspect of it and promoting it through our communities, and we can see a bigger change within society itself, and then like with everything else, AI can help out with that process too by integrating so much information and see the trends and how to push for those trends to help push a lot of mental health awareness, better mind-body connection, and seeking out services when needed. I'm hoping that's under 2 minutes.
You have a question for Chitra?
I do. Chitra, what is the critical to catalyzing societal transformation for overall well-being?
Well, that's a really, power-packed question. But, as I had mentioned in the first, part of my response, there's a lot of things. The society needs to be involved. One thing that you had said, Chris, is with regards to stigmatization, right? It still exists in a big way in the communities. The other pieces that we don't really have a lot of time to speak about is homelessness. For youth, where do they go after they come to the hospital? It's creating those transition pathways and stability within the community. What about jobs, for them, so that they can continue to integrate? But who does that, right? Who's responsible for ensuring that our youth can have a sustainable future? That's why I'm on the board of directors for one of the organizations that does exactly this, that the Youth Justice is also under that. So I learn a lot from the individuals that are part of that system. So there are so many, but so self-advocacy is one thing I want to get started with. So important, and again, it's multifaceted. You can say you can do so many wonderful things in life and whatnot, but they need to want to believe it. So how do you make it practical? How do you continue to mentor these individuals, ensure that they have the right peer support as well? People who've graduated, who've done really well, can they come back and provide these sorts of, mentorship and to tell people that I went through that and I'm just 2 years older than you. You know, that sort of a thing. And so really creating those platforms is important. I can talk till the cows go flying, but they won't believe me because I've not really had that experience that they have gone through. So they need to hear that from peers. The other thing is, for those individuals who have family, because not everyone does, and what's the definition of family, right? May come to mind as well, is really bringing the family unit together and learning together about what it is that your loved one is experiencing. What are the feelings, what are the thoughts, and how can we get to the root of that issue that exists. Food security tends to be a really big problem as well. So again, that's a whole topic on its own. So self-advocacy, person and family-centered sort of approaches, and building that community partnership and integrating them back in the community is really important, and developing those transition pathways. So as a part of leadership, you can look at legislation policy, you can talk to government, you can create those pathways, bring in lived experience voices to the table, because that sort of advocacy is, and the patient story, those playbooks that you use, is very powerful. It's underrated, perhaps underutilized, but really bringing the families to the table and really empowering them to speak out the experience. Everybody has a human heart somewhere. We get buried with so many, red tapes and whatnot. So these sort of things really help. So I just want to say that, if you set your mind to doing something and you've got a great, wonderful group of people, like-minded people doing this, I think we can get somewhere, but not without the support of government. So you need to have them on your side. So there are strategies to do that as well. I never say no to anything. I'm always there doing everything in my power, because it's every step that makes a difference.
Awesome. I invite the audience to one-on-one with you on the strategies. Over to Paya. I have a question for her.
Yes, I do. Yeah, I have a question for you. Okay. Sorry, I was just completely immersed in my in the depth of my ocean. So the second question for you, wonderful, building on all of the responses and in your enterprise and experiences. How can someone or an organization rebuild their foundations?
I think we talked about this all week, is getting to know yourself, taking time to really get to know yourself, what you want, and those are the foundations. Whenever you build a house or anything, you need a foundation, and so you gotta build from that. And so questions to really ask yourself, either as an individual or as an organization, is what is most important to you? What's not important to you? What do you like? Do you actually like that, or were you taught to like that? Do you actually like burgers, or did somebody tell you to like that? So, just really simple questions that I think a lot of us as adults, we don't take the time to consider thinking. And so when you are ready to rebuild your foundation, either as a person or as a business, start out with these simple questions. And what are your values? What are your ethics? What are your philosophies? And kind of go from there. And the best part about rebuilding your foundations is you can change anytime. It doesn't have to stick. When you build a house, okay, yeah, if you build a foundation that's not working, maybe you have to tear things down, but you as a person or organization have the flexibility to always pivot and change your mind if that no longer works for you. So just very simple questions to ask yourself and go from there. So I know I want to keep it on time here. So last question here for
simple and very powerful questions.
Yeah.
Points.
So Sandeep, how does the renewalism movement help health institutions go beyond therapy?
Thank you. That's a good question, because there must be many of you representing health institutions here, and I'm going to keep it short so that we can invite a question or two from you. There are basically two aspects that any health institution would be looking at. One would be the patient experience. And just to recap, renewalism is about renewing consciousness, renewing the ancient Oriental wisdom and bringing that into life and work. And let's say now that we know a little about Qigong, which could be one of the renewalism habits, when we bring that into hospitals, for example, the patient recovery is much faster and the patients are empowered to self-care. So this really goes beyond therapies and goes into that aspect of well-being starts way before you enter the hospital. The other is the staff of the hospital itself. And, you know, staff in all health institutions is very stressed. So going back to the concept of body, mind, spirit alignment and renewing oneself every hour of every day, there are habits for that, that would create a much better patient experience and a much happier staff worker. So it really runs deep once a health institution could adopt a culture of such practices. And then that apart, you know, experiencing it for yourself, as I just said, when medical professionals have experienced these habits working for them, they break their existing conditioning, and that's how the whole movement moves forward into other people's domains, houses, offices, and wherever else. So that creates community, that creates connection, and that raises consciousness. And ultimately, we must remember that 3,000 years ago, even 2,500 years ago, we didn't have health institutions. Everybody took care of themselves. And that's because they connected much better with spirit. And let's renew that kind of concept. So that said, I'd invite any questions. We have a minute or two. Happy to take them on. Yes, sir, please.
So you said everything starts when we're young, but when I look at my school days in Europe, at school we were taught to be silent. We also just had to listen to the teacher, and then at exams try to reproduce everything correctly, so we would pass the math exams. I had, for instance, during my high school, 6 hours of Latin for 6 years in a row, and I don't know how this prepared us myself for life, actually. And so my question is, what can we do to prepare children during high school for life, really, for the roller coaster that life is, to be prepared, how to handle wellness and let's say, become happy. Yeah?
Fantastic. Paya, you want to take that one?
Wow, that's, yeah, that's a really packed one. I'll do my best. You know, I look at the kids that I have in my life, and I have nieces and nephews, and trying to prepare them for life, I give them the education, the compassion, and yet I also say, you know, when you go out in the real world, sometimes not everybody's going to be nice or kind, but that doesn't mean that you have to be mean or be vicious or be anything because people tell you that that's how you need to be. And so looking at young kids, I think, especially now, and you work with kids, and so you see a lot of this, and I used to work with kids too, and I think I said this, like they're trying to be themselves, and then we're telling them they need to be something else, and so they lose that part of them. And so what would you say, Chris, to add on to that? Like, you work with kids.
I think it's about mostly just identity.
Yeah.
Because a lot of kids don't know who they are anymore. They look through all these different individuals on YouTube, different types of social media platforms, and they want to be these people. What's surprising to me is a lot of the kids I've been dealing with, even teenagers, they expect to be millionaires by the time they get to out of high school. And then the crushing realization afterwards, and then they have to rebuild themselves after that. So
they all want to be YouTube stars and TikTok stars?
They're really popular.
I can see Chitra and Olga all heating up to the mic. But you know, to your point, there's only one thing that I'd say. If the principal allows it, we'll talk.
Just a minute. This is concerning our children. One thing I wanted to say is it's okay to tell your children that people fall, right? I think that's a reality that parents tend to mask. It's okay for me to tell my son or daughter that, you know how many times mom has fallen? But the important thing is how I was able to pivot, self-reflect, what am I supposed to do differently so that my outcome is different? And how did I rebuild myself to get to where I need to go? And then the second piece is, what are you doing in your power to contribute as a peer to someone who has less than you do? Because remember that we are all on this one particular spectrum, right? But we are all human beings. We enter this planet with a certain ticket, and we do have an end to it. We all do, despite what we've got. So it's really hitting home those reality pieces. And then you're humanizing them. You're hitting home that human side, that realistic side, early on. Then my children, this is how I raised them. And they're humanitarians. They will get up, they will open the door, and they're very young. And they have done social services. And I never told them to do that. They found that this was their calling. And they learn, they fall, and we talk, and they strengthen, they become stronger than they used to be. And you keep moving forward. Because there are more obstacles in the way.
Pushing for resilience. Yeah.
Thank you.
Okay, thank you so much for having us.
Thank you.
Thank you all. Thank you for your participation.
Excellent. Thank you so much, panelists. All right, let's talk about something critical, chronic pain. It affects over 50 million Americans and millions more worldwide. Yet managing it remains one of healthcare's most complex and debated challenges. How do we ensure effective relief while mitigating the risks of overprescription and dependency? In this fireside chat, first-hand strategies for safe and responsible pain management. Our experts will share insights and cutting-edge approaches to ensuring that patients receive the relief that they need without the unintended consequences of misuse or addiction. Let's welcome Manaz Kazan Shadman, the PhD chair of the advisory board at Viva Valet, Inc., and Shrivana Singh Raju, founder and in charge of Qubit Wellness Pharmacy, to discuss the practical and ethical approaches to pain management in today's evolving medical landscape. Give it up for our next speakers.
All right. I'll correct the name again. It's Srivani Singaraju. All right. Another critical, most important topic for pharmacists and pharmacy and healthcare network and healthcare providers, pain management. So, hello everyone. How is everything? Thank you for having us here again. And they said fireside chat. I'll take that as a waterside chat. I'm okay with that. And yeah, it's a very important topic for pharmacists. We are under the radar by DA, FDA. We are the police. We are the gatekeepers for pain management. I'd like Minaj start and introduce herself. And
thank you so much for having both of us here, of course. I think the approach in pain management on this panel is very interesting, is that we have a medical, pharmaceutical approach and the practical day-to-day business approach of our community's response to opioid disorder, which really comes from the mismanagement of pain and the fact that a lot of our clients, a lot of our residences in elderly care homes try to manage their own pain the same way that they try to manage their wound care. And unfortunately, that has led to the current opioid disaster in our communities and the overdoses that we see. I have first-hand knowledge because as the CEO of Housing, we provide shelters for the unhoused, and a lot of our unsheltered population deal with addiction and mental health, and a lot of that actually starts with trying to treat themselves for pain. So I'm so thrilled to be here with you talking about this, bringing the scientific values and really the responsibilities. Where does it fall? On the patient or the doctor?
Also the family. Patient, doctor, and the family. When it comes to pain management, especially for seniors, as they age, they become like babies because their metabolism goes down, their sensitivity to drugs increases. So it is very important both the doctors, patient, and family know what's the cause of the pain. That's where we start from.
That is such a value proposition that you just mentioned, especially in the elderly adult. At Viva Valley, where I'm the chair of their advisory board, we invested in this company because one of the things that they did is developing a proprietary software so that they can do a symptom tracking of pain. And recently I had a fall. As you can see, I'm not that young anymore, but when I had the fall, I started having headaches. And I kept telling my doctor, I have headaches. But when? How many times? Which part of my head? So I started putting a graph myself and pointing out here, there. And we have actually now been able to create a proprietary software where we can allow the patients and the seniors to go in and identify when they have pain, how much, what level of pain, and share that with their doctor so that they don't get overdosed or underdosed.
Correct. Very true, yes. Logging, maintaining a daily log helps, especially for seniors too. And as a pharmacist, as a person who understands the impact of tiny little chemical molecules at cellular level, I'm very cautious when when a prescription for patient comes for pain. The main cause could be an inflammation that needs to be addressed as well. Most of the time I see prescriptions coming only for pain management, but the root cause is missing. And also other thing is, yes, I do not stop patients from taking prescription. We try to manage them first with non-pharmacological interventions. But if needed, we do advise, So pain is 4 different types: musculoskeletal pain, like, inflammation from rheumatoid arthritis, inflammatory pain, like osteoarthritis, fibromyalgia, and then neuromuscular pain from diabetes. Yes, we discussed about your husband. And another pain is unknown reasons, like trauma, surgical pain, cancer pain. So based on these categories, categorizing them, knowing what is causing the pain, how we always tell them you can take pain medication, but at the same time, include non-pharmacological interventions too.
It's interesting that, most of the market is looking at pain medication. What do you, doctor, think about holistic approach or phyto-based products like cannabis? That has been, our research shows that over the age of 60, 90% of the patients prefer non-opioid, non-FDA products like cannabis to control their pain. What is your thought about that?
Absolutely. I do follow a holistic approach. I myself have fibromyalgia. I was diagnosed when I delivered my second one, long time. 2010, I got diagnosed. And doctors right away wanted to put me on, nothing wrong. That is their practice, wanted to put me on DMARDs, the disease-modifying, rheumatoid drugs. But I know inside me what mistake I'm doing. I know, I'm not, because I just delivered a baby, I'm busy with my new roles. I was juggling so many things, first child, second child, just a barely minimum gap. But I said, you know what, give me 2 years' time. I will do holistic approach because I also have an Ayurveda certificate. I also trained in psychological behavior. So I changed my diet. I follow anything that can help minimize the pain sensitivity. Do it, go for it. Like cannabis, yes, FDA is struggling to approve it. They're still struggling to analyze it, get the data. But if it helps, I have a cancer patient, she takes it. She also adds another opioid, but still, she doesn't need to be too much on the opioid. So if it is helping, why not? Anything that helps you. At that age of 60, what we want to see is they have basic privileges, they have a comfort. Why let them suffer? The risk versus benefits, not at that age when they're in severe pain and debilitating pain and they cannot even get up, So mental health impacts.
That's very true. And I think, what do you think about the younger adults? Because it seems to me that the younger adults are getting hooked on these pain medications, not purely because of pain, but a different type of psycho pain, depression, anxiety. What are your thoughts about that?
Absolutely. Education and knowledge, how to empower them. That's where, we as a pharmacist, we tell the doctors, and we also have a comprehensive medication therapy management. I'm certified in medication therapy management. So we have conference calls with physical therapists, psych therapists, doctors, pain management. We engage all of them, making sure the patient knows the reason, because taking the, this addictive medications doesn't remove the pain, cause. They're still in pain. And if that young age they're starting, they saturate so soon, the receptors saturate so soon, and their future path is more, horrendous for them, looking at from the pain management point of view. So we always advise the patients to do non-pharmacological, holistic yoga, behavioral therapy change. If something is helping them, why not? As long as they do it under supervision in a moderate.
So it's interesting. It seems to me that the entire pain management is a much larger holistic approach. It's the engagement of counseling, engagement of the physicians, and understanding the age of the patient. Depending, for example, if you're over 60, as I said, the degenerative situations, the length that it takes for healing, and you have to deal with it. And you're right, in that case, why not use alternative methods like cannabis or acupuncture, which I believe now acupuncture is really working these days, correct?
Yes.
And I think, but now it all comes back to then why do we have so much opioid disorder that all of the physicians get blamed? Where does the responsibility start and end? Is there a conversation about that as well?
Diversion. Diversion is one reason why opioid crisis is existing, because let's say, for example, I had a case many years ago. This doctor prescribed opioid medication for this patient for cancer, and this caregiver was picking up. But then one morning, this doctor calls me and says, my prescription pad is stolen. These were the days where we did not have, electronic prescribing techniques. So do not accept any of my prescriptions. Anybody bringing prescription, that's not me. So diversion and abuse, dependence, and ecstasy reasons, that's the main reason for me. They're not really using it for the real reason and root cause of the pain management. So unfortunately, the people who really need for pain management are not able to access because of this diversion.
And it's interesting that in schools now, we have to face the fact that most of the staff need to be trained into using Narcan to actually help, which when you talk to them, the root again is pain. And they take different substances to deal with pain. What is your recommendation for the society as a whole? How do you think we should manage this?
As a society, definitely, especially for seniors, if your concern is, make sure if they have neuralgia from diabetes, make sure that is addressed. Use any antidepressants to bring down the pain sensitivity. Use an add-on therapy. About that, beyond that, if they're still not able to manage pain, then we can introduce an opioid. But there are a lot of tools these days, a lot of studies have been done, a lot of equipment, a lot of certified healthcare providers that are capable of providing CBD or, acupuncture. We have acupuncture office in our facility. We do encourage. I have a patient who has sciatica. So she was in a lot of pain when she came to my clinic, a lot of pain on a lot of high doses of, even the antidepressant Lyrica, and she was on high doses of opioid. I told her, let's just give you this thing. It won't treat you. It won't get you away from sciatica pain, but it will help you minimize taking excessively these chronic medications. And she really liked it. She really liked it. She said one acupressure relieved her. Even applying the CBD oil topically relieved her, and she was using less of the pain med. Yes, it's a loss from pharmacy point of view, but I'm so happy I was able to empower her to manage the pain in non-pharmacological way.
That's fantastic. That's really nice. As one of the people that, again, I'm very involved in community and society and their needs, because we build for their needs, and we invest in companies that provide services like Viva Valet for the seniors, and the concern about the children of the adult is when they're not around, they're worried about their parents. And so we try to address that by providing a concierge service, by providing trusted advisors to come to the homes and take care of their elderly, their elders, as we recall. And we found that they are very, very keen to looking at options. And it seems to me that in pain management, we really need to keep an open mind and use all the tools, from physical therapy to using, holistic approach,
anything,
counseling,
even sitting in a bathtub with an Epsom salt helps you, go for it.
Go for it.
Yeah,
okay.
Just have a daily practice.
Get a daily massage. How about that?
Yes. Just having a family support also. Sometimes the mental anxiety, lack of empathy, for them the support can also aggravate anxiety and depression. That can also lead to pain triggers, right?
Yes.
And also, I don't judge my patients because they're an opioid or they need it. At that stage when they need it, they need it. But that said, have a regular practice that helps you minimize this pain sensitivity. That is the key point. Have the support system. We also do concierge medication therapy management. We come to their house in a holistic, in a collaborative comprehensive care, which means vaccines. For example, shingles. If seniors are not vaccinated against shingles, that's a very horrible pain to manage.
Yes.
So vaccination is still helpful. I believe that can protect them from a lot of neuralgia pain too. So shingles vaccine, now there's an MMR outbreak. So do consult the doctors and see if you can get an MMR vaccine. Anything that can help them healthy, like Tdap. Sometimes seniors with simple whooping cough or an outbreak of severe respiratory infections have persistent cough. They can't manage the pain. Because of the anxiety. So all of these things can be managed with collaborative care from physicians, pharmacists, nurse care, teams like you.
Thank you. Some have this thought process that we really don't need to give medication for pain, and let's increase the pain tolerance of the patient. Do you think there's any truth to that, or that's actually just a myth?
May and may not, yes and no. Like, for example, for me, I get days where I just cannot function. Like, I do know the tools. I do practice yoga every day. I try to eat healthy, turmeric milk and all that. But there are days where I just cannot. It's just, my body is like, I give up. So what do? Like, I need, to take my pain anti-inflammatory pill and then an analgesia to, so that I can function. So yes and no, it requires a lot of willpower. I have read a lot of books where they say quantum energy in your body. Try to teach your body. But how can you tell a cancer patient like that? My aunt, she had both her breasts removed. Yeah. She has severe scar. And she's she's almost 70 now. I can't tell her, sit and do meditation, sit and, have a turmeric. She needs help. She needs that Lyrica high doses, or she needs some opioid management. She needs everybody in the healthcare society to give her that comfort that she can move on.
Do you think there is new technology needed to bring in new tools for pain management?
We are still exploring. I think the healthcare system is still evolving. We are still learning. There are recently FDA approved a non-opioid pain management drug. I'm pretty excited. I want to see how that turns out. They're comparing it to an opioid type of therapeutic relief, but it's a non-opioid. It helps in relieving the peripheral pain, blocking the pain sensors going to the brain. And I also seen a lot of booths here that are trying to help mimic, trigger, diverse the pain signal. So they're all exciting pathways. Let's keep open-minded and let's learn from that.
I'm glad you said that about what we see in the booth at this conference. Exciting, a lot of red light.
Yes.
And it reminded me that my daughters, I think they really think that mom needs help. So I get every red light therapy tool that has been shipped to the house. from red light for my hair, from red light for my back.
Wrinkles.
And then I walked through the conference. I'm like, okay, this conference is lighting in red light.
I felt like disco lights all over.
Disco lights all over.
I'm ready to party. But that's good. Innovation is good. There's my philosophy in my house. I always tell my kids, failure is okay. At least it shows we have tried something new.
At least we're trying something new.
Yeah, as long as it's not overly abused, you go for it, try for it.
Go for it.
Yeah.
So we only have like about 7 minutes, but I wanted to know if anyone has any comments about pain management and any questions to our esteemed doctor here. If so, please step forward and let's discuss this. We lost a few minutes, but I'm just thrilled that I have such knowledge sitting next to me that we should discuss more.
And same here. Thank you, Manash. That's great sharing the stage with you. Hello.
I appreciate what y'all talking about because this is right up my alley. And so I was just wondering, I heard you using certain nutrition or such as like CBDs and stuff like that for like sciatica. I do massage therapy as well. So would you also suggest like just certain herbs and so forth that could also help with like stuff like sciatica pain management?
So you said you have sciatica?
No. I deal with people with sciatica.
Okay, with sciatica,
yes.
And then they're on CBD already?
Some may be, but some aren't, because some are like allergic to it. But like, would you, could you like suggest maybe some herbs or something that where they couldn't do the CBD, but they maybe can do some herbs or something like that? Would that?
She has more research on CBD. I would let her.
Well, thank you so much. Yes, I actually am an investor at a company called Royal Emerald Pharmaceuticals. And what we do is we research and we provide the raw material for the scientists extracted from cannabinoids, whether with THC or without, whether it's CBN, CBD, CBG. And Royal Emerald is one of the very few companies in the United States that has a federal license. And so if you want to develop a product and you want to file a patent or go to FDA, you will need Royal Emerald as your partner. And they will provide the raw material for you. They also have the capabilities of reproducing the cells at a bioreactor level, so it can be consistent for your research. And we work with researchers throughout the United States. We also have an export license, so we can send the products throughout the world. We work with Turkey, with Brazil, with Poland on different research. Now, coming back to your question. The research that we have, which is also posted on the NIH website, shows that, yes, there is definite effectiveness with CBN and CBG. Now, CBD is what everyone talks about, and you can put it topical. But the fact that if you don't have enough THC in it, the neuropathic lines don't actually talk. So you need some THC, and that's where the problem starts. Because that's federally not approved, although that doesn't include us. We are federally approved. But the researchers, we are now working with them to show how much of THC can be added in without the hallucination, but create the chain of neuropathic communication to actually happen. And so to understand more, I actually studied at Cornell on medical cannabis, and it allowed me to really understand what an amazing plant we're dealing with. We are now also looking at psychedelics and to try to find out how much that would work, but it appears that that is more into your neurosystem of depression, but the CBD, THC, CBN, CBG, and many other CVNC, they all work for sciatic and the communication of nerve systems and muscle problems.
And from pharmacist's point of view, I always go with FDA approved line, but from pain management, like I have a whole spectrum, I monitor all stages of the patient. So using herbal products doesn't harm. You can try, but everything has to be consistent. At least make them, use for at least 3 months.
Okay.
And that will give them benefit. And it's always like, physical therapy. I always tell my patients, just like you take your car for service, also take your body to physical therapy. Somewhere or some point needs to be serviced in your body. Have the doctor send a prescription. Make sure your body is, aligned back again. Because a lot of times, as a pharmacist for me, I didn't know. One of my kinesiologists told me, my hip has a little bit of distortion years ago because I've been abusing my body at work. And that was creating spinal nerve and then my migraines. So the migraines are not pure migraines. It's coming from, distortion in my hip. So always service your body, so stay healthy.
Thank you.
Thank you, doctor.
Thank you for the great question.
Any other comments? Any questions? So, I want to expand on this conversation about how we are all looking for alternatives, correct? When I had my fall and it resulted a major pressure on my neck, that's when everything started, because I'm allergic toward codeine and anything that has codeine. And a lot of the medication they gave me was giving me so many allergic reactions, blisters, and all kind of problems. And that is why my husband and I started looking at alternative medicine and how we got involved into, can we look at different options? And it seems to me that as we work with regulation and as we move forward with hopefully understanding the product better and scientists being able to get to the product so that they can do their research, we may have alternative products and allow us to get out of the greed of the pharmaceutical base right now, because this is a multi-billion-dollar industry, and it's very greed-focused. But what do you think about that, Doctor?
Psychedelics is still, FDA a few months back still denied it. They're still, trying to look into more data because of the addiction problems and abuse and where it ends up, because we lost even celebrities to psychedelics. So they're still cautious about recommending them. But I'm game for CBD oils. My friend has a knee surgery and she topically applies CBD oil. And I'm sorry about your head injury, and I have patients who have codeine allergies. So in their situation, if alternative approach without overuse and abuse is helping them, but do monitor your blood work, make sure your liver is not impacted, be cautious of what you, I always tell them to get certified companies like yours. You said you're listed on NIH, that is awesome. I would like to.
Oh yeah, you can definitely look up the site with NIDA and FDA. Royal Emerald is an approved federally licensed company. I'm not promoting the company, but if you're a scientist and you want to work on the products, definitely look them up or call me and I'll make sure that you contact our research team and you work with them. But it is important, I think, that we understand that actually marijuana is not an addictive product, and unlike codeine and heroin and morphine and others that you actually become addicted, the addiction is really not part of the plant process. But that took a long time of research to really establish that. And coming with new products is just amazing. And I think, does anyone know if there are any other new products that are coming in for pain management? Any of the doctors, the esteemed doctors in the room? Do you have any knowledge of any type of a phyto-based products? No, correct. So we're still really just focused on marijuana and cannabis, cannabinoids, and stuff like that. It's interesting. I mean, we're hanging our hat on red light therapy, and we're still hesitant about using natural plants. And I think we should really have an open mind and understand and work with the scientists and figure out what is that we can do to battle opioid disorder. Because as many of you know, I'm a real estate developer. One of the biggest problems that we have is the unsheltered communities that are now, basically encamping into the metropolitan areas. And the big issue is that they have mental health problems and they have addiction problems, and primarily caused by pain. And we are not addressing it properly. Just throwing them into an apartment or a house does not solve the problem.
Yeah,
does not solve the problem. And they actually also destroy the property as well, because they are not in the mindset to be able to live independently. So this is a very expensive, very tough situation for our communities. And I think if all of you doctors could come up with a new way of dealing with pain, you guys would be opening the Pandora's box to maybe the next $1 billion unicorn.
Yeah, and also supporting healthcare, right, in a non-toxic, non-debilitating way for customers. So we want to make sure they have basic privileges. We want to make sure they are not dependent on it. We want to make sure that the families are also educated on how to manage them, So that's the key part here. So helping, supporting in every possible way. Pain management not just ends with the patient picking up at the prescription from the pharmacy. It starts in the house. It starts from, how the patient has been handled and educated and taking it. Sometimes the pain may not be the pain they're sensing. It could be something else triggering from. Yeah.
Yes, yes.
Yeah.
So, doctor, I have a question. When you get into a family gathering, does everybody come to you and ask you for medical advice?
No, I hide away. I take my hat off and I'm here to party. No, I would like, sometimes my friends, but there's a lot of HIPAA compliance, so I tell them what happens in the pharmacy in Vegas stays there. That's it.
That's it.
But
and what is your advice for both? Let's segment this. We have about 4 minutes. So let me hear from you your advice on pain management for the younger generation and pain management for the older generation, if you can do that.
I mean, speak up. If you're in pain, speak up. Let the doctors know, let the family know. But take all the tools you need. If it is definitely a reason, definitely address inflammation. Make sure they know how to manage inflammation. That's the root cause that triggers a lot of pain. So that needs to be addressed. And we cannot perfectly correct anyone. There's no solution. It's, especially in pain management. It cannot completely go away. Let's say, for example, you had head trauma. You have no tool to use, right? You cannot take any FDA-approved prescription authorized by the doctor.
Yeah.
You cannot manage. So what do you do, right? So you're dependent on these tools. So you need a healthcare provider that can help you manage with those, non-FDA approved or, other non-prescription drugs. So my advice is speak up, know the root cause. 100% treatment is not possible. Always be under the supervision of a certified healthcare provider, and always get your products. If you're using something non-FDA approved, make sure they are certified labels. Like as you said, you have NIH studies. I always like to look into clinical studies. I always like to see the data. So always make sure you're going to the products you're purchasing have some national recognition.
Great advice. So to make sure that the products are safe, that they're manufactured in a GMP, CGMP facility within the regulations of the federal FDA or other agencies.
Absolutely, that's something that has the data. And if you're using polypharmacy, which means if you have complications, like seniors especially, they have a lot of complications. I always tell my patients we do free brown bag days, which means they can bring in the prescriptions. We also do virtual. They have to list all the products, not just the prescription drugs. That includes vitamins, supplements, minerals, anything else they're using intermittently, not necessarily every day. Even if they're using like twice a week for migraine, I need to know if you're using a CBD oil. So list everything else. So as pharmacists, we can help you. We can advocate for you. This might interact, or even sometimes the timing. Taking a good drug, wrong timing can be bad for your health. So we can help you what time you need to take that food, what time this supplement should be taken. So it doesn't, you need to have some efficacy also, right? Sometimes taking a pain medication at the wrong time with the wrong drug may not be efficient. So a lot of things, bad timing can be wrong too.
Bad timing can be wrong too.
Yeah.
Well, thank you so much, everyone, for joining us. I hope that you enjoyed this panel.
Thank you. Thank you all. You've
Thank
been
you
an
all.
amazing audience. Thank you.
So wonderful.
All right, excellent. Thank you so much for that. Now let's look ahead to how technology is revolutionizing rehabilitation and physiotherapy. This fireside chat on the future of rehabilitation, cutting-edge innovations in physiotherapy practice, explores how emerging innovations are reshaping rehabilitation techniques, making treatment more personalized, engaging, and effective. What does the next decade hold for physical therapy, and how can these advancements help patients heal faster and more efficiently? Here to unpack these exciting developments is Quang Una Tran, PT, DPT, FAFS, and CEO and owner of Perspective Physical Therapy, and Dr. Isa Maya Shalamat, for Psychic CEO at Yoga of Health, LLC. Please give them a big round of applause.
Thank you, thank you. So in full transparency, when they had asked me to do this talk, and I was like, sure, I can talk about the innovations and future of physiotherapy, I came here and my wife was like, hey, you're supposed to talk about AI and wearable technology. And I was like, crap, but it's okay. So if you guys are in here for that talk, that's not what this is going to be about. And if you're going to stay, can I ask y'all just kind of move into these front tables? I just like to see who I'm speaking to, and I want to make this valuable for you.
Okay, so testing. Okay. So I want to introduce Dr. Kwang. He's a host of a podcast called the Myofascial Health Podcast. He's an innovator in myofascial release therapy with John Barnes. He has a private practice of physical therapy clinic in Austin, Texas, specializing in rock climbing injuries. And welcome, Dr. Kwang.
Thank you. So a little bit about my story is I know what it feels like to struggle with injuries. Back when I was a competitive soccer player, I injured my knee, I tore my ACL, and I had to get surgery for it. And the unimaginable happened when I re-injured the same knee and needed another surgery. And even worse, a surgery after that. After my third surgery, I was confused, and I thought, is it possible to find joy in these sports again? And I knew that there had to be a better way. I remember feeling isolated and alone. I felt left out when my friends were playing sports without me, and I finally found sport-specific physical therapy and myofascial release. And using these non-traditional methods helped me rehabilitate from my injuries and allow me to play and enjoy sports again at a high level without fearing re-injury. And now I use my personal experiences, my qualifications, and my trainings to help each individual patient help accomplish their personal health goals and competition goals. And to my right is Dr. Chalamet. She practices and innovates body work and created the Doctor of the Future medical assessment for healthcare providers, from doctors to massage therapists, to bring together an integration in how we approach medical conditions and their assessments. She developed the Yoga of Health system over the past 3 decades to replace the existing healthcare model that allows innovation for everyone practicing medicine. She's known as the Psychic CEO. Thank you for joining us.
Thank you. So we were going to start with the topic of the model of medicine, the current medical model today.
So I think when everyone knows about the healthcare system, they kind of recognize it's a broken system. And so there's one thing to just kind of accept that, or you can use this as an opportunity to find a different model, to innovate. And so I think we can recognize that. I know that my personal experiences with the traditional model, I continue to have retorn ACLs, more surgeries, and I was just caught up in the system. And no doctor, no physical therapist could tell me, hey, why does this keep happening? I kept asking, I was lost in my own recovery. And this is a common story that I hear with a lot of the patients that I'll work with. They'll say, man, I've tried those things. I've tried the traditional things, but nothing seems to help. And it's a very vulnerable place for a patient to be saying to themselves, hey, I need help. And I take that with great pride, and it's because I know that I have my own personal experiences that I want to be able to help them just the way that I needed the help when I was in their shoes. Dr. Chalamet, do you have any experiences to share on that front?
Sure. Yes, and I've noticed with chiropractic in particular as a form of physiotherapy and working with physical therapists over the years, having trained in physical therapy myself, although I'm not a physical therapist, I've discovered that there are a lot of levels to this. There are a lot of layers to what makes health, and when you have recurring injuries, it's not always physical therapy. It's not always the actual movement of the muscle of the fascia that's going to fix the situation. I usually tell people that whatever body work, and I use that word broadly to kind of encompass all of this, what doesn't work with body work, you have to go to nutrition. You have to look at the inflammatory aspects of food, and alkaline diet being the sort of goal for clients. And So the current system, I mean, what I see is I see that we have kind of a merging happening within, from osteopathic, Western medicine meets Eastern, and this has been happening for a number of decades. I have friends who did the very first chiropractic adjustments, and they didn't get paid, and they did this in Berkeley, and people would just show up and get adjusted, and that was back in the 60s. So we can see how much that this has progressed. I mean, you can get physical therapists can get insurance now, can receive insurance, and that wasn't until very recently as well, along with things like chiropractic. I always say LAC, but acupuncture as well. And I'm excited to see some of the changes within the insurance company world, like just being able to accept insurance for more and more different types of modalities. So it's an exciting movement that we have happening right now. And at the same time, this is what it takes is this dialogue between all different healthcare providers, and knowing that there's no threat to someone losing their job, if they're like a family care physician and is afraid that, if they don't start to integrate these medical options in, that they're going to lose their jobs and not be able to provide for their families. And I think that is very important that we understand that this is more of a sort of a trade over and an innovation happening within all of our different, the industry, the health industry itself. So we can go on to that topic that kind of leads into.
So something that you mentioned was fascia. And
Yes.
I don't know if everyone's familiar with what that is. Could you kind of explain in your own words an easy way to understand that for everybody?
For sure. So fascia is a pretty new discovery, even though it's something that we've had in our bodies all along. I'm thinking of like Ida Rolf, one of the pioneers. She created Rolfing, right? And we look at the cadavers that have been kind of worked on in different medical practices and medical schools and so forth, and we're finding that they would just take the fascia and they would just throw it in the garbage. So it wasn't considered a respectable or even a sensory organ, which is now that's the established classification. So fascia is a gel-like substance that holds everything together in the body. It's like it takes up more room than the skin. So the skin used to be the largest sensory organ, but the fascia actually now is kind of trumped that. And when we're looking at relieving pain from the body, we really want to look at the fascia. And the reason for that is because fascia is what carries more nerves. And so anytime you have pain, it's an impingement of the nerve. And nerves are what I call the electrical system of the body. It's the energy. We are the energy that is infused into the body, experiencing through the body. And anytime there's pain, there's blockage of ourselves experiencing our body vehicle and having the mobility that we should have. And that is pain itself. That's the definition of pain according to more modern understanding of health. Would you like to add anything to that?
Yeah, so I like to dumb things down. I'm not super smart. And so for me, I just like to say, fascia is a connective tissue. It runs from your head to your toes, through your muscles, to your organs, all the way down to the cellular level. And when we have injuries, whether physical or emotional, that gets held in your fascial system. And so oftentimes, what I have found is where someone feels pain is kind of the symptom. But the root cause of that is somewhere else. And you have to be able to feel a little bit deeper into the fascial system. And a modality that I use is John Barnes myofascial release. And it helps you really connect with the patient. I think John has taught me to say, we're treating the being and the human being. When I treat someone, it's not a shoulder injury. I'm treating someone who is using that for a reason. So I wouldn't treat a rock climber that I have an interest in than someone who's like a grandmother who just needs to put their dishes over their head. And so it's about that connection. And where I find that the healthcare system is really lacking is to get complete healing, it needs to address the full human being. And that's the mind, body, spirit, and emotions. And I think a lot of times when you go to different healthcare practitioners, they only focus on one. I think we have this model where it's a reductionist model of thinking. We think, hey, if we break things down into smaller and smaller components, then if we study those, then we'll understand the bigger components. And I'm saying, I don't know that that's right? And so if we can kind of treat the entire person and treat them with empathy and compassion, then oftentimes they will respond well to that. You know, I'm not telling my patients what to do. Oftentimes they're just asking me, hey, can you sit in the mud with me? You know, and as a guy, you know, sometimes I have this fix-it mentality, like, oh, we gotta fix this, we gotta fix this. Sometimes they just need to listen. And you'd be surprised at how many patients I see when they go through the traditional healthcare model, they're like, I felt like a number. No one was listening to me. I was sharing my concerns and they were falling on deaf ears. And so through myofascial release, we're able to connect to the tissues, release the traumas, and then lo and behold, they get much better, much quicker. You have anything to add?
Beautiful. I love that. Yes, and that makes sense with the emotional piece, because that is like, if we were to, this is just when I work on my patients, clients, I see them as there's this interaction happening. It's the way that I assess. So it's like what I call the doctor of the future. It's a way of medically assessing people with hands-on approach. And so the way that I term things is a little unique, so just bear with me. I call the body vehicle. So we all have a body vehicle. It's our immediate environment. And then the fascia is like the emotional body. It's the link that connects us to, you could say, the spiritual and the physical. And that's the area where most of us are disconnected. In the West especially. I think meditation really helps, but overall it's that emotional body piece that many of us are just in denial of. It's something that we've never really been taught or understood. And so the fascia is that area. I would say on the earth level, fascia is like the mycelium of the earth, right? It communicates everything to everything else. It's under the ocean, it's everywhere. And so when it's tracking. It's called tracking, or it's a stroke of myofascial. You're pressing into, instead of thinking of you're focusing on the muscle, releasing the pain in the muscle. You're actually focusing on the fascia itself, and then you're moving that energy so that you have it's similar. You could say it's similar to all of these other modalities we've been talking about this last few days. But that is what will happen, I've noticed, is people will say, okay, the pain's gone here, but what you'll see is that the pain they think that it moved, but it's not that it moved. It's that they're becoming more aware because the awareness is now in that area, and before it was blocked. And then they realize that with that awareness that there's pain somewhere else. So we're addressing these different layers of pain in the fascia with myofascial release therapy.
Perfect. And something that you mentioned was awareness. And something that John has taught us is without awareness, there's no choice. And so if you're not aware of different possibilities, you're going to keep doing what you've been doing and just look around, and that becomes an echo chamber. And especially in healthcare, there's a lot of burnout. You know, I think, especially as physical therapists, we're in this, hospital system, everything is based on productivity. And so you're overworked, underpaid, and yet when you're like, is this what I went to school for? And everyone around you is like, this is just what it is, and you kind of get sold on this idea that, job satisfaction and all this stuff, and then inevitably when you burn out, you're like, what am I doing here? And without awareness, there's no choice. And so for me, I'll say that I have found ways to innovate by starting my own practice. And I don't use insurance. You said you're a bit about insurance, and by all means, if you're using it, fantastic. But I hate when insurance companies tell me, hey, you can only see this patient for 20 visits. Let's say for an ACL tear. It's like, it takes at least a year to recover. And you're saying I only get 20 visits to get this person back to what they want to do. And when I feel like I'm limited by insurance, I can't give the highest level of care that I know I'm capable of. And then on top of that, I think a lot of times patients get stacked. So in productivity-based healthcare systems, I was seeing 3 to 4 patients in the same hour, and we're not getting paid for documentation. So I was getting burnt out. I was spending extra time taking work home, not the best person at home. And then finally, I'm like, okay, there has to be a different way. Absolutely has to be. And I've been lucky to find my mentors and my business coaches to help me kind of navigate through that. But when you're in that system and you're like, well, everybody else is doing this, and then all of your supervisors are saying, no one's going to pay more than their copay for physical therapy, and they've been doing that for 30 years, you kind of been like, okay, I guess this is what I have to do. And I'll say that there's opportunities to innovate, and I think one of the ways to do that is to start your own thing, whether you're a physical therapist or somebody else. Starting your own thing, creating your own company, I think that's one of the more tangible things anyone can do to reach their own level of freedom. You know, I think that's what we're looking for. A lot of entrepreneurs are looking for this freedom piece. It's not necessarily to make a lot of money. That's a driver for a lot of people. Typically, when you're in healthcare, you're not doing it for the money. Now, that process in and of itself is a challenging process. And so I think for me, I have to rely on God. I don't know if you guys are spiritual in that sense, but I believe in my soul that God will give you a vision, but he's not going to show you the path to get there. Because if he showed you the path and you knew what it took to build a business, a successful one, you wouldn't take it. And so I've had to grow and go through challenges and obstacles, and that's what you have to accept about it. You know, failure is part of the process. Growing up in an Asian household, failure was like the worst thing in the world. And failure was a B for me, you know? So like, I would get hit if I got a B. But with that, in business, it's part of it. And what you learn is there's no such thing as failure. You either learn or you succeed. And so once you reframe it like that, you realize, hey, there's really nothing stopping you other than your own belief systems and your own thoughts. So that becomes part of how you have to grow into.
Excellent.
Dr. Chalamet?
Very nice. I like that. Yes, so that makes perfect sense. You know, that's why so many people are taking up the mantle of CEO in the medical industry, because we have to compete. We have to compete, and so we need a strong willpower. You know, we need a strong center, and that's. I was just talking about that in my short acceptance speech for the award. Was just that if you don't have that strength, that inner strength, to really, I know this is not necessarily off topic, but that it's easy for you to kind of get bogged down with the idea that, you know, you've got to go and accept a job somewhere else or work with what's already here. In California, we have a health freedom law. It's based on that basically anyone can start and create a modality and say, this is what I do. This could be, you know, the ESA method or something, and then you would be allowed legally to basically manufacture that or have it become something. So I don't know what other states or countries what's there, but I've lived basically my whole life in California. So I think that's a wonderful thing, and maybe any of you who don't have that or have some restrictions to kind of find a way to make that happen. I mean, I don't know if we want everyone to move to California. Maybe it's better that people just innovate where they are, and just take that initiative. But we wanted to talk also about yoga. Is there anything more you want to?
Yeah, so share? I think we're talking about innovation in the future of physiotherapy.
Yes.
And just as a quick raise of hands, how many physical therapists or physiotherapists are in the audience? Oh, wow, I'm the only one. Okay, all right, that's fine. That's totally fine. And so I guess for those of us maybe in careers that have high burnout from healthcare, what are easier ways that you would recommend to innovate other than, let's say, moving to California and starting your own thing?
Okay. Innovate in the practice itself, or like the practice of physiotherapy?
Or I guess for the audience, since there's not physical therapists, let's say innovate in their healthcare careers.
Like rehabilitation, basically.
Sure.
Methods, okay. Well, I think we do have to work with what's happening and the resources we have available to us, wherever we are, you know, in any position we are, and telling, like, I would say things like using social media is very important, even having a YouTube channel or podcast, and just get the word out. I mean, that's one of the reasons I'm here. Is I've just been doing in the trenches for 20-some years, until recently I started going, okay, I need to talk more about this, because the CEO piece is getting the funding. And the funding is really important, because I know that as healthcare providers, many of us don't think about that. We sort of think that everyone's as excited as we are. And I met with President Trump recently, and it was like 2 minutes to talk about this, and you just have to, I don't want to say you have to be ruthless, but I think that we have to definitely take risks. You know, fortune favors the brave for a reason. So we just show up, do the work, get over any kind of fear that we have, because Elon Musk talks about it all the time. He says, I was afraid, but I just did it anyway. So that's going to be important for all of us in this industry, because we need massive reform. We know this, and with this new NIH director, I'm speaking to the Americans here, but I think it's happening all over the world, not just in the US, with DOGE, and then with 1.5 trillion that we have RFK Jr. and Nicole Shanahan are working with, which is way less than before. It was 4.7 trillion over the last COVID couple years. And so we need to look at bringing subsidies. I know that wherever you at, that's fine, but it's really important to bring in, find a way with our companies to be ready for the funding that's going to be funneled to us. Because one of the things that RFK had mentioned is that he is removing commercials. He's removing ads for pharmaceuticals. That was his first step. And who's going to replace those? Just like an addiction, you've got to replace it with something better, right? So you want to, all of us need to take that initiative of going, okay, let's get in contact with the, RFK people, send them a plan, send them a bill. That's what Donald Trump said. Send a bill, send me a plan. Work with your local policymakers and get the funding. Because most of us have some medical, we have the ability to accept insurance, so it's going to be easy to receive that funding. But I'd say get ready for that, because I think over the next year or two, it's going to be easier to make that happen and to build. So getting a plan together to have whatever you're doing grow exponentially is going to be important, because we want to reach the demands of the people. We want to have all of the services that we offer available to them for these next few years.
So thank you for that answer. I'm going to go a different approach. I think a lot of times we think that we have to cast a wide net to capture as many patients as we can. And what I've learned through my personal experiences is instead of casting a wide net, cast a deep net. And so for me, I've niched down and worked with rock climbers. And there were a lot of fears around that, right? When I first started, I'm a rock climber myself, and I was like, would a rock climber pay the rate that I want to charge for physical therapy? And I went to go climbing at Waco Tanks, which is out in El Paso, Texas. And there's this term for climbers called dirtbaggers. And a dirtbagger is a climber who lives out of their car, drives around just to climb. And when I met them, I was like, there's no way that climbers are going to pay for physical therapy. So I kind of pushed that idea away. And instead, I started looking at women's health, because, half the population are women. Women go through a whole lot: childbirth, different traumas, and there's definitely a need for that. And this is where I have to trust in God, because even though I had committed to making the wrong decision, my heart was in it for climbers. And I had a friend who got injured. She injured her shoulder, and she was like, hey, I need physical therapy. I've gotten massage therapy, and it's helped, but I really want to get back to climbing. And it wasn't until I worked with her that I was like, this is what I want to do. And if I do this and I fail, then at least I'll know that I've tried. And I think that feeling and that taking that risk was so important. And, I work in physical therapy, and I've rehabilitated a lot of old people. And if you guys have the opportunity to spend some time with the older generation and have conversations with them, it means so much to them just to have a conversation. I think oftentimes they feel neglected or isolated and alone. And when you have these conversations and you ask them, like, what do you regret about your life? They'll say they wish they would have taken more risks or done more things. No one ever regrets, oh man, I should have worked more in the office. I wish I would have made more money, right? And so just make sure you're focusing on the right things. Now, for me, the innovation of casting that deep net, I don't have that much money, right? So if I am a generic physical therapist and I say, hey, we're gonna help with shoulder injuries or hip injuries or sciatica, There are physical therapy chains that have millions of dollars at their disposal, and I will get crushed. But if I can take my slice of the pie and say, hey, I work with climbers, and if you're a climber, I can help you. We have very specific injuries for our niche sport. Then that slice of the pie becomes something that I can become an expert in. And then that community, we have a huge community of climbers in Austin, that's where I'm more well known. And so that's the risk that you take. And I would say to innovate, I would say that a big part of it is getting out of your head space and getting into your heart space. I think what I'm trying to say is, a lot of times we have this fearful voice, and it's very loud, like, you can't do this, you're not good enough, why you? And that voice is very loud, and it drives a lot of people to not do anything and to just accept the status quo and just kind of grind out this unhappy life. And deep down, if you want to know where your heart is, just look at where your mind wanders. If you have this dream, it's always going to tug at you. And no matter how long it's been, it's going to be like, hey, remember you said you wanted to try this thing? And it's going to be soft. And it's going to be a softer voice that's harder to listen to, but that's your intuition. And if you can start trusting your intuition, that becomes a skill. And I know that for us, a lot of it's driven by data, like A/B testing, split testing, and all these things. But once you do that, you get to be your authentic self. And when you find that authenticity, you attract the people who are gravitated towards you. I'm not here chasing somebody and like, oh, how do I find this marketing thing? How do I do this? And X, Y, and Z. It's like, hey, this is what I do. I can speak to your fears. And now that I understand you and I can provide the result that you're looking for, patients are way more likely to work with you. And the fears that I have of that was projected onto me, no one's going to pay more than their copay. Well, when I sell the result instead of physical therapy, more patients are willing to do that because they know what they're getting from it, And so I would say to innovate, to trust your own intuition, right? And that's often hard to do. But just like exercising or anything else, like consistency and practice, you get better at it. And so that's still a process that I'm still learning. But it has helped guide me to kind of get out of the rat race. And if anyone's in healthcare, you kind of feel that pressure, And so for me, I think innovation allows you to do that. And then also, everyone has their own gifts. I think everyone is born with natural God-given gifts. Mm-hmm. And we unlearn these because we hear, hey, this is what's important. Really what's important is to chase the money. Or, hey, you want this nice car, or you get this house. And you forget these gifts, but they're always there. And so if you have the courage to just kind of be still, instead of saying, hey, I got to do this stuff, I got to have this go-go mentality, this has to get taken care of, just be still and say, hey, what was I good at? When I was a kid, what did I naturally have joy in? Instead of something being, hey, I got to do this because this amount of time is what's limiting me, or, hey, time is money, X, Y, Z. It's like when you were a kid, you used to draw and color and do all these things, and time wasn't even a factor. And I think those are where your gifts are. Can you share some of your gifts?
Well, I was a Buddhist nun for almost 10 years, so with the Dalai Lama. And during that time, I did a lot of body work. It was all donation-based. It was a lot of experimental. It was really fun because I was able to really meditate and go deep, and because the amount of time that the session, it wasn't timed at all. It was, when it was done, So people would come in and I'd have like lines of people, which was great because it was around the time that before and during the stock market crash of 2008. And so everyone was like, didn't have money. They needed hands-on and they needed care. And I love to be able to have, pretty much just before it happened, 2004, when I gave up my wealth. I'd been a wealthy person, worked with Steve Jobs in my early 20s, and then moved from that into just giving up everything so I could serve others. And I think that was a really brilliant time in my life because I learned so much just not having to even think about money, speaking of, when you can really go deep and discover things, which is a wonderful time. So he and I have probably about maybe 20 years difference in age, which is great because I love the fact that there's this nuance of the approach based on, where we are in our practice and so forth. And so I would say that was definitely a gift. Being a psychic CEO is something that Steve Jobs gave me that name. He was my first paying client. I was 22 at the time. And he recognized that gift in me, being able to just read people, basically, without really talking to them or trying to figure out from the mental level. That's one gift for sure. I think that's one that I didn't ever really develop. I kind of came in with it, and then I progressed with that. But I'd say that the more up, speaking of deep, the higher you go, the more deep you have to go. So one thing I've noticed is I'm never going to give up body work. Like, people ask me, they're like, well, why do you still work on 20, 30, sometimes 50, 60 people a week? And it's because I consider touch the final frontier. It's like, this is where we remember that we have this body. And if we don't have a body, we don't have a life, right? There's no purpose being here without a body, right? You don't have anything going on Earth. So the physical touch is really important, and that keeps me humble. It humbles me and reminds me that this is where it happens. And as high as you go with all these lofty ideas and so forth, as deep you have to go. So, thank you.
Of course. So
we have about a minute left here.
Yeah. So talking about your gifts is something that I think is important, because when you find your gift, you should double down. You should go all in. And sometimes it's something that you don't even think is a gift. More recently, someone said, hey, you communicate really well. And I was like, that's interesting. English was my second language. So it's one of those things. And I'll say that, when someone says someone's psychic, there's a version of me, especially in healthcare, that I was like, oh, that sounds a little bit out there. Now, the further I've gotten into myofascial release, what I've learned is your intuition can be divided and separated into kind of different categories. So clairaudience is the ability to hear, clairvoyance is the ability to know, clairsentient is ability to feel. And everyone has at least one. Some people have two or more. But I think the most important thing is make sure you're not comparing yourself to anybody else. Like, your gifts are your gifts. And just because somebody else has a different gift, don't say, man, how come they have that, right? Because then that takes the power away from you. And so I have a gift that I would call clairsentient. I have ability to feel. And sometimes my patients will be like, how did you know how to put your hands there? I'm like, I don't know. I just kind of felt guided there. And I'll say that everybody has their version of that. And once you tap into that, you can really help serve your communities and change things for yourself, for your families, for your communities. And it's only by doing that. So take the risk. And don't let fear control you, and just know that, hey, love is the way, and I think that's all I have to say.
Thank you. Thank you.
Does anyone have any questions on any of the topics, or are we out of time?
Out of time for questions? No. Okay.
No problem.
Okay.
Thanks, y'all.
Thank you.
But I'm sure they will be around at the networking happy hour, so you can ask any questions that you may come up with. Big thank you to our speakers on that last panel. Now it's time for our final panel of the day. What makes a patient's healthcare experience truly exceptional? Is it shorter wait times, better communication, or a more empathetic approach from medical staff? The reality is it's all of the above and more. This next discussion, getting success and elevating patient experience, understanding the A to Z of it, breaks down the key factors that define patient satisfaction, from hospital design to digital health solutions, provider interactions, and follow-up care. Diving into this crucial conversation, let's welcome our panelists and our moderator, Dr. Mustalo Dohalawa, Medical Director of HeartSafe, who brings years of expertise into transforming patient care and healthcare service delivery. Big round of applause for them. Thank you.
Good afternoon, everybody. I think we're closing it out. I think we're ending it on an amazing note for you. If everybody wants to stand up for just a quick second and maybe take a big stretch, as we are at the home stretch now. Here we go. Nice to see an audience. I love it. My name is Mustali Dohadwala. I'm a clinician. I'm a clinician in invasive cardiology. I own my own practice a little north of Boston, Massachusetts, called Heart Safe Boston. I've been doing it for about 15 years. And I have a patient panel of about 3,000 patients. So, yeah. Why don't we have a seat? Just going to take a moment, and if everybody can introduce themselves, we'll start with the ladies. Sure.
Hi there, nice to meet you all. It's the final day and I'm finally getting over the jet lag. I work in clinical trial data transparency, so I have other experience within the pharmaceutical sector, but data transparency is my thing right now, so we focus on data sharing and access to, just making information more easy for the public to understand and fighting misinformation. Thanks so much for having me, guys.
I'm Dr. Nilan Kavil. I'm a clinician in the long-term care sector. We deal with post-acute long-term care. In addition to that, I'm an AI advocate, AI in healthcare. We build predictive analysis for patients.
Of course, I'm Andrew Paxisian. I'm part of All Care Home Health Provider. So we provide services at the home for post-acute at home, and also part of the National Alliance for Home Care at Home, and being part of California, on the board of California Home Care Association. But also, my previous life, I was an engineer in computer and electrical engineering. But now I've been into population management and health, but that's where my expertise is in the post-acute space.
And I'm Peter Axe, the chairman and CEO of Upscript Health. We partner with pharmaceutical companies to develop solutions for direct-to-patient care. We do that with a basis of telemedicine. So if you think about our business, if you were go to a branded drug website, for example, Ubrelvy, if you suffer from migraine headaches, you would see a pop-up that says, would you like to talk to a telehealth provider now? Would you like to see if Ubrelvy is right for you? Would you like to see if there's a way to treat your migraine headaches with something other than Ubrelvy? You'd click on that button and you're on our platform. And we serve almost every major pharmaceutical company in the world at this point. Been around for 20 plus years. And we're developing more and more complicated solutions than just sort of providing a medication treatment on the web. So.
Amazing to be around such thought leaders, such well-accomplished thought leaders. It's great. Just want to start something off by sort of get our juices marinating here a little bit, if possible. If you guys can just briefly tell me at this point where we are right now, what do you believe will truly elevate the patient experience?
I think it's about using digital innovation and that human healthcare to try and elevate, and find out their needs as well, and just not missing out the human element. Because I think there's been a lot of discussion about AI, but then that kind of dehumanizes what the patients really are after, and it's the patients whom we serve, so we should really focus on what their needs are. I think that's the
a fine balance is what I'm hearing from you. Yeah.
According to me, it's like we're not doing a personalized patient care. We are more into the traditional methods of care. So we need to personalize the treatments we have to meet the patient where they are. That means at home, location-wise, or depending upon what their needs are, like, in the home, safety of the patient. All that is the concern that I would think of, personalized medicine.
And I would say, health literacy, just to compound on what you're saying is, how do we configure a great experience for the patient, but also take a look at the whole health system, from doctors down to the home aides as well. How do we make useful time for everyone? Again, we're stretched thin as far as the healthcare experience, but how do we make it more welcoming, coming from the doctor's side, coming from the hospital OR, God forbid, but also at the home, but also elevate the community to make sure that they understand what disease process is in their own terms, and if they're able to accept it or not and comprehend. And we should be able to take that journey with them together to enhance that experience.
So we're all mentioning tactics. These are real tactics, ways to improve healthcare and elevate the experience. But you really have to go beneath that, in my view. And you have to look at the system. We have a really very broken healthcare system. And until you fix the fundamental of that system, which is cost, you can't really worry about anything else. The tactics, you can try and get an extra minute out of a physician's time to get a little better treatment, but you really have to look at the cost structure. If you look at Western countries in the world today, our healthcare costs are double per capita of any other Western country on average. We have probably the lowest outcomes in the Western world in healthcare today. So the systemic problem is all built around our structure is wrong and the cost structure is wrong. And just some symptoms of that, you have PBMs that literally double the price of medication so that they can get 50% rebates. You have clinicians that are reimbursed at awful reimbursement rates. They're not really allowed to be able to deliver good care. And the list goes on and on and on. So the question about elevating care is really complicated. It stems from a cost structure that doesn't work, and then we can fix the symptoms in the meantime, but that's my thought.
Yeah, it's fantastic. I mean, you're 100% right. It's extremely complicated. There are many nuances to this. But if we can try, would it be possible to identify other barriers besides cost, which is certainly the most important, which I completely agree with you there. What other barriers do you foresee? And perhaps, do you have a solution how to navigate around or over that barrier?
Yeah, I think another thing, because this talk, the title is about patents, and I'm guessing with that it's like intellectual property and aspects of, competitors. They don't want other people getting access to information, but I see more of this as a collaboration, not competition, because we're all there for one common shared goal. And so intellectual property, and so what if someone else gets access to, I mean, I know there's like aspects of trade secrets, but someone can think, oh, we can collaborate and make something great together. So I think that's the solution, really, is collaboration in terms of that aspect.
Dr. Cheryl?
I would think of technology as a solution to this, because my realm is that, and I see that it helps my patients. We have able to, in my practice alone, we have 4,000 patients in our practice. We were able to cut down readmission rates from the SNFs due to use of technology. So I think technology, predictive analysis, looking at what the patient needs and what is, focusing on those aspects, the RPM, real-time metrics, that is what is going to elevate the experience, I think so.
I think, taking a look at EMRs and taking a look at every, facet of the healthcare system. Take a look at the hospitals, you take a look at skilled nursing facilities, you take out even home care. They're all in their own silos, and we can't really share this information readily. Again, I go back to how do we make most efficient of time for each part of the care continuum, but also how do we make it appropriate for our patients, right? At the same time, we're just kind of like pushing it down their throats, like, hey, this is what we've learned, right? But how do we bring it back to this is what the patient wants? What can we emphasize? What can we like really take a look and have compassion about them, right? Really hear them and where they're at, meet them where they're at, right? And then now we could bring it back. And how do we reach those synergies where we could have all these information, interoperability, even though it's a big buzzword right now, but how do we make that real? So at least it's making best effective time for everyone here in each one of their silos. But at the same time, using AI stacks, such as RPM, such as generative AI, and make it useful for the system, but also make it very personalized for the patient, right? To make effective, efficient work, to hopefully see some cost synergies as well.
These are all great thoughts. I think the best way I can answer that is by telling you a little bit about how we do business in our business model. Because what we've done is to say there's a lot of friction in healthcare delivery, and let's find the pain points and let's resolve that friction. So for example, when you go to that website and you're interested in a medication or treatment, or we even treat things like sickle cell anemia, if you suffer from sickle cell anemia and you want to examine a new drug that's out, you click on a button and talk to our telehealth provider. That telehealth provider's going to be available when you want them available, number one. Number two, they're going to be trained on that disease state and all the other options in the market. Number two, education. Number three, we're going to make it inexpensive for you to have care online because we can be really efficient with the use of our clinicians. Four, we're going to work with your payer, your insurance provider, and determine whether or not you need a prior authorization. If you do need one, we'll prepare it 100% of the time, whereas in traditional markets, PAs are prepared about 50% of the time. So we'll prepare the PA, we'll work with the payer to get coverage, and we'll do all this seamlessly so that the patient doesn't have to deal with that pain. We have patient support people dealing with that. And then we'll ship the medication right to you. So we take away all these friction points in healthcare delivery, and that's kind of our aim. And we believe that's a new channel and it's a new way of looking at healthcare, and that's kind of what we've been defining.
Yeah, tremendous. I mean, I feel like all the solutions that you guys offered, I mean, I feel like we're not navigating around, we're not jumping over, we're flying over these barriers, so that's great. You get some really thoughtful people here on the panel. Appreciate that. I'd like to introduce some framing thoughts, do a little bit more of a deep dive into this concept about patient experience. And I'd like us just to think for a moment, what defines exceptional patient experience without exception? Let me repeat that one more time. What defines exceptional patient experience without exception? So I'm going to start with empathy. How do we reintegrate empathy? Now, some of us here are clinicians. Some of us work closely with clinicians. I'm sure we all have something to say.
Thank you. Yeah, I think with empathy, it's also about thinking about just their perspective, and also we've all been in a state where we've had, clinical treatment or we needed help from the doctor. So just think, what kind of information would we want from like a healthcare provider, or what kind of information would, even our caregivers or our loved ones want? And it's having that kind of heart to think. And I think with empathy as well, in this current age where we kind of look towards more digital means, we've still got that human aspect, so we should stay connected. So I think that's a huge part of empathy for me.
Thank you.
I'm going to be honest here. 15, 20 minutes of our time, do we really know our patient? That's the question to all the clinicians. We really don't know. We are just addressing the scenario right there. We're not looking through what the patient is, what an individual is. 15 minutes doesn't do justice. You cannot develop trust with 15 minutes. You over time, if they're going to come back to you, yes, eventually you can gain that trust. Why 15 minutes? It's regulated. That's the truth, right? So we are driven by the payment, as he said, the cost. We have to meet our cost, and that's 15 minutes is what we get to see. So I think time is very, very important in order to build the patient trust. If there is trust, then of course it's an elevated experience.
I mean, we're pretty lucky over at home care where we spend a frequent amount of time with the patients themselves. I mean, we're not there forever, but we're there kind of intermittently or, for a set amount of time. So I have to kind of flip it on its head. But at the same time, you have to build that trust. At the same time, you have to have that understanding, like culturally, spiritually, with these patients to really gain that. So it takes some time, to really build that. But once you build that relationship, that warm touch, again, on my conversation on high tech and high touch, those are one of the biggest emphasis that we really emphasize to our clinicians, is really build it, and then now we start stacking on top information. Now we start stacking on behavior, and then take a look at it as well. Especially when you're at the home, sometimes you're going to have to question certain things, and then how do you gravitate that? And with that empathy, it's like you have to be in their shoes. You have to be in their shoes and really have that human connections to really make that influential change with them.
You're asking about empathy in the digital age, which is almost an oxymoron, right? But, I tell you, my philosophy is you reward certain behaviors. And one of the things we do is we reward our clinicians for receiving very high patient scores, whether it's Trustpilot scores, a digital way to measure performance, or NPS scores. But we do surveys all the time of our patient population, pre and post treatment, and we try and learn, are they getting from the visit what they need? Do they feel heard? I mean, so much of empathy is about being heard, right? It's about being recognized for what you're going through and having someone listen. At least my wife tells me.
At least your wife listens to you. I think I think Dr. Cheryl, you brought up trust. I think that's a very important word for us to further examine and explore here. Dr. Peter, Mr. Peter, as well as Devaki, can you guys share a little bit more about what that healthcare provider patient trust really should look like?
I think
I'll
trust.
start with you.
Yeah.
Peter.
Thank you. I think trust is about honesty as well, and for the patient to be open about whether their needs are being met and what kind of the healthcare provider can do to give them more. And I think it's important to integrate them into like interactive surveys, or maybe like patient experience is one thing, but patient satisfaction, you can determine that by, gathering their thoughts as well. Because it's all well and good to have people walking into the clinic and think you provided them with a good service, but when they walk out, you don't really know whether they actually had satisfaction in their experience or not. So I think trust is about whether it's good or bad, being open and honest about what the experience was.
Fair enough. Mr. Peter, I mean, for you, I think my question to you would be, in this digital age, are there metrics that can be utilized to help identify trust? And I mean, I'm sure you're doing that when it comes to assessing how well your providers are doing.
Look, that's a really interesting question. I think there's a qualitative analysis we go through and a quantitative analysis. And let's talk about the quantitative because that's easy. The quantitative is we look, so in the telemedicine world, just so everyone understands, there's three modalities, right? There's a video visit you have with a clinician online. There's an audio visit you might have with a clinician, and there's an asynchronous interaction, meaning you fill out a question set, the clinician reviews it, not in real time necessarily, and they'll get back to you with questions. So in those environments, to best quantify the patient experience, you look at how long was the video call, how long was the audio call. You look at what are the digital questions that were asked in advance, what were the responses from the clinician, did the clinician follow up with specific SOAP notes in their medical records. You can look at all those elements and sort of come up with a quantitative analysis. But on the qualitative side, it gets back to patient surveys and overall patient experience. It gets back to things like return patients. Do patients come back? Do we see a lot of return? And we do. We see a lot of return patients in our organization. And if we didn't, I'd be upset. Right? It's, you build trust with people, and if they come back to you, you've done a good job of it, and if they don't come back to you, you haven't done a good job of it. So the fact that we have patients remaining more compliant on meds, the fact that we have refills coming through regularly for our fulfillment partners, the fact that we have patients follow up with questions months after being treated, that's a really powerful statement that there's a real dynamic between the clinician that treated them and the patient. And being able to track all that, you can do that in the digital world. You just have to build the software. But that's sort of how we look at it from a qualitative perspective.
So, Andrew, for you, I think about establishing a robust, multidisciplinary care team more important now than ever. Can you sort of expand a little bit more on that, please?
Yeah, when we take a look at a patient home, right, and take a look at multidisciplinary teams and take a look at the whole systems, it's vitally important that each system has its most important roles, right? Not only from like the pharmacy delivery, not only for the DME companies delivery, but also from specialty units. But when we take a multidisciplinary, it takes I want to say a whole village sometimes, or probably a whole town or the globe, to make it real, right? but how do we make that information very pertinent and precise? And that's so difficult, during these days, because there's always this friction of push and pull, who's going to be there, who's actually going to get paid for certain things with it. But it's very important to really keep that patient in the center, what they really want too, right? To really having that listening type of perception and being heard, right? Because everyone likes to be heard. But once we have that and that iteration, what does the team have to value in what the patient has, and really accentuate that patient experience? Because if you're not hurting and just pushing items down their throat, they're never going to be appreciating us, right? Same thing with the health plans, same thing with certain modalities, is how can we get that patient centered and really create those synergistic goals that the patient really wants, but make sure all the team members are lined up, right? But how do we make best effective time and information so everyone together could really reach those goals?
That's great. I think that for me, it is vital now more than ever to really focus on, shifting the way we look at diagnostics, treatment, prevention. We need to go away from the traditional metrics and look at granular metrics in order to truly establish an exceptional patient experience. And I think that when I think about granular metrics, I'm not thinking about what their traditional risk factors are, like hypertension, hyperlipidemia, diabetes, smoking. I'm thinking more about, what does their food situation look like? Can they get to my appointment? Do I need to call a taxi for them? Do I need to make sure that there's a space for the van outside my office? And is it safe for them at home? Do they have a social structure at home?
So you're talking mostly like social determinants of health, right? Because that's a big thing from CMS these days, is do they have these access? And especially when we go towards the home, I mean, we're there often, again, like you said, with food disparities, if they can't get over to the physician's, clinic, right? Do they have mobile services? Maybe the helpline has it or not. Are they able to transfer train? Is there a caregiver there, right? Because when you have a patient going over to see their physician, or even during a virtual call, you may not see what's in the fridge. You may say, hey, I'm eating well. What does that really mean, right? You can see that over video chat, but not until a person, either a caregiver or one of our clinicians, opens up the fridge and is like, no, this person needs some help, right? Or, same thing with, my culture. We eat rice in the morning. We eat rice over dinner. Sometimes we make rice for like dessert, right? Oh goodness, right? Some people here are like, oh yes, I could relate to that, right? But sometimes, that you can never take away, right? Because that's culturally ingrained, right? And those are like one of the biggest things, like how can we really modify certain items? How can we aid and accelerate? We're definitely going to have to meet them where they're at. And I think you discovered a cultural disparity with your AI models, right?
So what we do is we take consideration of the patient's, all their health, the home situation, and we do all the factors, embed all these factors. We have a questionnaire, we have an inpatient, as you told me, there's an intake person who goes in and sees the situation, puts it in, for the clinician to review. Right now what happens is all the modalities are, as you said, they're all in Xylo. They're all working, but they're all in different spots. But I think it's like if the music, let's consider the patient as the music, right? But the orchestra, it should be together. The drums can't play separate. The violin can't do its job. Everybody's doing their job, but it's not together. So who's going to coordinate this? And for me, I think it's technology that's going to coordinate this.
I totally agree. It's like, how can we accelerate it? We have all the data there, but how do we bring it all together to make it informational, get rid of the noise? And again, I think, when we're talking about it, it's like, how do we make that information specific for each doctor, so each modality, to the caregivers as well, instead of looking at all these big things which are so overwhelming, but how do we make it very specific in the orchestra that we're trying to create for the patient themselves?
That's fantastic. Thanks for making an intro to my next framing thought. I think we really don't have a choice horses out of the barn, the train's moving, healthcare delivery is evolving or has evolved. I'd like to hear more from Peter and Bucky again regarding, what is your take, especially in the virtual medicine space, on how do you empower patients over a video call or a telephone? How can you empower your providers to be able to have those more difficult conversations regarding overall prognosis, what's realistic, what could be wasteful, what is empathetic when it comes to efficacy and healthcare utility?
Sure, and that's a really complicated question. And I think the first point I want to make is not every patient seeking care should be going to telemedicine. There's just a lot of ailments that shouldn't be treated through telemedicine. But generally speaking, our patient population is filled with people that are informed about their disability or their disease state or at least what their symptoms are, and they can be conversant about what their symptoms are. And then they can have an intelligent conversation with a clinician who really needs to collect information. And again, we reward our clinicians to collect information and make a decision. In medical school, you're taught that 95% of a diagnosis is information-based, right? It's not touching your knee or feeling your skin most of the time, vast majority of the time. It's gaining information. So we really encourage gaining more and more information. And we also have a culture in our organization. You talk about empathy, and you raised the question of empathy and made the point. And one of the things about our organization is our culture from the very top down is all about doing the right thing. Whether it's our pharma partners, whether it's our patients, whether it's our clinicians, whether it's our employees, it's always doing the right thing. Our decisions are never made based on dollars. They never will be made based on dollars, no matter who our equity investors are. And we will just always try and do the right thing and embed an integrity that the clinician is going to be empathetic, is going to gain information that they need to make a diagnosis or to treat or to assist the patient, and they're going to hear about the patient's problem and be thoughtful about it. I don't know if I've answered your question, but hopefully I've at least gotten most of it.
Lots of insightful thoughts there.
Thank you so much. I completely agree with Peter on doing the right thing and all the things you mentioned about integrity as well. I think with the patient experience, it's also important, like from an information perspective, I also agree that they need to have all the information, whether it's like, there could be information that kind of is very difficult for them to understand, but then it's that fear of the unknown that can make them go back and feel worried. And a lot of the talks in the conference, I find, has been more towards herbal medicine as well, and there's been like a bit of demonization of pharma and the drug development industry, and of course there's bad people in every industry, but it's about making sure that information about herbal and chemical or drug interventions are out there for the patient to make their own decision and not to have like a biased opinion to push them towards one thing or the other, but to help them make an informed choice. I think that's what really matters, to empower the patient. Like, here's everything you need, and if you need any other questions answering, just feel free to reach out and just be like an open book. I think that's true empowerment.
Excellent. I see a big pink elephant in the back of the room. I'm not sure if you guys do as well, but I think there's a tremendous shift in paradigm, a philosophical shift as we move from a fee-for-service, transactional, volume-based healthcare delivery system to a value-based system. And I truly believe that this will allow us to very shortly prioritize our patient-provider relationships, of course, but I think it's going to allow me in particular to focus on prevention of cardiovascular disease. It'll keep me from over-treating, perhaps even under-treating. And then finally, I think from my standpoint, I do believe that we're going to better focus on quality of care rather than the quantity or duration of care, life. Dr. Cheryl, I know that you in your space, I mean, you probably deal with the sickest with chronic medical conditions. Do you have any thoughts there?
So I believe prevention is better, like especially in chronic conditions, right? Like most of my patients have at least, if you look at the chart, they'll have at least 20 diagnoses. And there'll be almost 30, 40 prescriptions from different modalities. So with chronic care, we have to imply prevention as the first thing, but how do we prevent it? How do we prevent hospitalization? That is where diagnosis, I don't think only providers could do justice to, we can't do all the notes, we can't read the 20-year worth of record, we cannot do it, it's humanly not possible. That's where I think technology is the only way to go, is the only way to go to reduce this. And wearables, wearables give you an idea of the patients. Assessing who's critically ill, who needs the most attention is very hard in a sector like mine, especially. In a SNF, you have like 200 patients. So every day, everybody is chronic. So, and as a provider, you cannot be attending to all 200 patients every day. But who's watching them? That's the question. Who's keeping up with their metrics? Who's doing their vitals? Yes, long-term care, we have nurses who do their vitals. But are they all, are they using devices that is FDA credentialed to do the vitals? Or are they pulling off something from their Amazon shelf and just doing the vitals? What is the credibility to all this? That is what is important, in chronic care. Unless we bring in all these modalities together, we're not going to be able to manage these conditions.
Thank you for introducing my next and last framing thought. I promised we did not do a dress rehearsal. Promise. I am anticipating in a very nervous way the future of medicine, the future of healthcare. I imagine, potentially health bots curating a personalized, right, precision-centric approach in treating, colony members on Mars, right? But all joking aside, I think we've got some thought leaders here that are innovative, and I'm curious to hear from them what the next 5, 15, 25 years looks like. And let's start with Peter regarding the digital first solutions.
Sure, and you've already touched upon it, but there's no question the next decade is going to be about AI, and it's going to be about a transformation of care and delivering it using agents of AI that are smart, that are efficient, that can absorb more information faster, and that can somehow elevate the patient experience while at the same time reducing costs very dramatically. I do think a systemic change because of AI will impact the cost structure of healthcare and really be very, very helpful. Now, for that to really happen, though, a number of things have to occur regulatory-wise, because we have real issues with our regulatory structure in this country, and the most blatant example in my space is, in my space of telemedicine, is that we have 50 state credentialing of physicians, 50 state rules you have to use, and you have to be licensed. If you're a clinician and you want to treat across state lines, you have to be licensed in multiple states. Why is that? Why don't we have a national licensing structure? Why don't we have a national licensing structure for pharmacists? Why do we have antiquated corporate practice of medicine statutes that require all telemedicine companies to create arcane structures, legal structures, to accommodate rules that make little sense in the world of HMOs and other types of corporate organizations? So there's a lot of things that have to occur regulatory-wise, and we haven't even touched upon how regulations have to manage AI and the use of AI. But I caution the United States not to be overly concerned about safety of AI and get worried about what the problems will be before they allow certain things to occur and let us see how this develops. But at the right time, we are going to need regulations around all this.
Fantastic. In line with AI, artificial intelligence, how do you see it incorporating itself in personalization of medicine, precision-based medicine, where where we're essentially providing each of our patient members a prescription, an individualized prescription for their, let's say, 20 medical problems.
So that's where you can bring in the genomic study. That we, as I said, we cannot do it all. We need artificial intelligence to do it. So the genomics, their lifestyle habits, their real-time metrics, all this has to be put in together and then delivered, then cultural aspects to it. So if a human person cannot combine all this and develop a personalized care. So for example, as you know, I would say not all medications work for everybody, correct? But now we are just using a standard of care. Am I right? Aspirin might not work for him. The examples are a lot. So what I want to do is what we want to bring up is personal, don't do the testing methods right now just because it's there in the standards. Now, what are we doing as physicians? We give them, we trial the medication. If the blood pressure goes down, okay, well and good. Continue for the next six months, and then we come back, Oh, it's not working, we do another one. That's because we don't know the other side of what the patient's doing. We need to know what is their genomics. Why is it coming? Culturally, what is their ethnicity? That is very important.
So you're talking about a lot of data endpoints,
yes,
right?
So
how do we make those endpoints meaningful? Perhaps, Andrew, I don't know if you want to chime in and share your thoughts.
So we have so much, as an engineer, it's like we have so many things going on. Again, I agree, genomics and being very precise, right? We also have a little bit of empathy. Is like, are they willing to? Again, from the regulatory side, it's like we have a lot of hurdles to go through. I think the current day right now is what is the patient acceptance of using it as well, right? But also give the realization in like 5 to 10 years, how do we use technology to really accelerate it? Be customizable for it, because we have everything allotted for us. But the guardrails of our government has to be in state as well. And I think, all of us goes down to the hill and really advocate for what we want for our separate industries. Mm-hmm. But also try and take a look at it if we kind of flip it on its head. What is the future that we have with technology? What was the outreaching future? What is that invention of it? Again, Steve Jobs brought up the iPhone and revolutionized it. I think in healthcare, we're at this crossroads where we should be able to utilize that to our advantage, really, and be cost effective, be efficient, but also be very precise of what that genomics and what the patient needs, and also hear them out. And also Congress has to hear us out as well, to add on.
Lucky, what do you see the future when it comes to patient data privacy? It's truly fascinating. I think it's going to become an ethical dilemma very soon, if it already hasn't come up.
Yeah, definitely. I think AI has raised a lot of ethical dilemmas as well, because AI has advanced in areas where it's not been put to good use, but it hasn't advanced so much in areas where it could be more meaningful. So I think it's about having that constant connection with the patient where they can, that they're not forced to, accept that, if they're in a clinical trial, they can leave at any time, or just give that open space as well. I think data privacy as well, it's hopefully the legal and regulatory aspect is changing surrounding AI, and that will be quite interesting to see in the next decade or so, but is expanding quite a lot.
I don't know who here in the panel is familiar or very familiar with the brain-machine interface.
Talk about Neuralink.
That's right, Neuralink, right? I mean, as some may or may not be aware, but more recently there have been some very elegantly put together preclinical early phase studies showing a tremendous advantage with this particular technology and helping people that are tremendously debilitated, predominantly physically debilitated, but potentially even mentally debilitated by implantation in a very invasive, minimally invasive, or for that matter, non-invasive methodologies in stimulating the brain. What do you foresee when it comes to privacy? How do you handle privacy? That data that's there. Remember, there is a computer, and there's a mini computer, there's a microcomputer in somebody's brain. How do you handle that data? How do you handle privacy? Who owns it?
Well, it's all considered PHI, right? Personal health information, and there are lots of rules around PHI under HIPAA. So there are rules in place to restrict access, to restrict how it's stored, to restrict how it could be used. So, and I do think that they're quite effective. And then the question is just enforcing HIPAA audits of organizations that have this data, and to be sure it's enforced.
So, I mean, I think one thing that's provocative, I think, to say the least, is this architecture has been put together by some really, really smart people, engineers, scientists. They've essentially curated, a treatment plan for this particular patient member. Do they not have any intellectual property value in that data?
I'll make sure I understand the question. You mean the engineers who have designed the software,
correct,
who are using the data? So, we're a good example, right? We have dozens and dozens of engineers, and they have access to all sorts of PHI. To become an employee of ours, you have to sign a dozen different documents, including trade secret rules and secrecy laws, and then HIPAA compliant documentation as well. And so, we think we contract around that. And then we only allow access to those engineers that have to have access to that. And we keep a strict flow chart of who should be allowed access. For example, we have patient support people all the time dealing with PHI. Well, there's only certain patient support people that can access certain aspects of files. And you have to build your software that way so that you can control access and you can password protect access. And look, and then we're all susceptible to cyber breaches, right? We're all susceptible to threats, no matter how robust our systems are. And that brings up a whole another whirlwind of issues and problems.
Yeah, I was going to bring up interception of signals, electrical interference. What happens if that small, seed-funded company that has this phenomenal new microchip ends up going belly up?
Well, so by the way, you're bringing up a really interesting question, because one of my theses in the world I speak in venture capital, is that we have created a system in the United States, and data is getting so complicated that it's really very difficult to develop startups. It's really a very difficult, unless you are a well-funded startup with tens of millions of dollars of venture capital behind you, it's really difficult to start a company today that you can grow and expand on. And that's one of the reasons is cybersecurity, the integrity of data and maintaining its security.
What do you do with downtime?
Yeah.
Well, I think
5 kids. How about that? 5 kids.
I think that's all the time that we have. I just wanted to give an opportunity to ask folks that may have any last minute questions. I think we are the last panel, so I think we do have a couple of minutes, I hoped, for any questions or comments.
But we are going to be available after this. So if you want one-on-one time, we're all here.
Thank you, everybody.
Thank you.
Excellent. Thank you so much for that session, panelists. And here we are, the final session of the Health 2.0 Conference USA 2025. Over the past 3 days, we've explored groundbreaking innovations, tackled pressing healthcare challenges, and engaged in meaningful discussions shaping the future of medicine. From digital health advancements to mental wellness, patient care, and ethical medical practices, every session has sparked ideas that will drive change beyond this conference hall. On behalf of the entire Health 2.0 conference team, we extend our deepest gratitude to our incredible speakers, panelists, sponsors, and of course, our attendees. Your passion and dedication makes this event so impactful. I'd also like to extend our gratitude to our sponsors and partners, silver sponsor Centrifuge Inc., and our bronze sponsors VitaWell Topocathan, Regine Global, and Dr. Weiss Wellness, PLLC, for their generous support. Ladies and gentlemen, we are not done yet. Let's keep this energy going as we head into some of the best parts of the conference, networking hour. After 3 incredible days, it's time to unwind, connect, and celebrate. Join us for cocktails, refreshments, and great conversation with peers, industry leaders, and visionaries. Whether you're here to spark new partnerships, exchange big ideas, or just relax and enjoy the vibe, this is your moment. Let's cheers to a successful event that you all made possible. And we'll see you in Dubai.